Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked by a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life...
A&E selfie!
Down below. Too slow.
love...
Such a good boy. So proud of you.
and loss...
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
A busy day.
I hope it's busy, because when it's not busy, it's more tiring.
Beep, 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 beep. We're coming through.
And I should probably write some notes.
Yeah, you should.
Oh! Hello, recess.
Hello, recess.
Dr. Sophie first came to St George's 2 years ago as part of her training in emergency medicine. Today, she's one of the registrars treating patients in Resus.
My mum always tells me that when she was pregnant with my brother, I wanted to be a midwife and then kind of a nurse. And then apparently I found out that doctors earn more money, so I was decided I wanted to be a doctor.
Just gonna feel in your neck, okay?
My graduation day, I was more worried about falling off the stage in my heels than anything else, so that was probably my biggest memory from the day, and I didn't fall down the stairs. My parents were incredibly proud of me passing my medical degree and graduating.
He's got a nasty scratch up here and he's got some blood in the left axilla.
I've been in London now for 12 years. I always thought I'd leave, but I met a guy, we got married, and I do feel really settled. My mother-in-law wants us to move up to the northwest, so whereas I'd much rather move to the south. Not because of her, I will hasten to add, she'll kill me.
Simon.
Hello, St George's. An adult. Go ahead. Yeah.
Adult female trauma call, ETA 30 minutes.
A 44-year-old woman is on her way to St George's after being kicked by a horse at stables 20 miles away in Surrey.
When you've got a trauma patient coming through, it's always really important to think about what that patient has gone through. For them, this is such a traumatic experience. Most of our patients go through this once in their lives.
There's another trauma coming. That's a headache. I don't know the full details.
If someone's been kicked by a horse, there's a potential for really serious injuries. It all depends on the size of the horse, how the person was kicked, where on the body they were kicked.
44-year-old kicked by a horse.
Hi, can I have an adults trauma call to A&E Resus?
If someone is unable to walk, then you're a lot more concerned. A horse kick could cause major internal injuries that you might not be able to see externally.
The woman's friend is travelling with her in the ambulance.
I was with my 2 daughters, Matilda and Jocelyn, and we drove home, and at the top of the lane, there was an ambulance parked on the main road, which was a bit odd. And then the further down we got, we saw more ambulances. I went up and finally found one of the ambulance men, and he said, oh, there was a lady in the field and she'd been kicked by a horse. So I ran up to the field. The stables are out on their own, up a little lane, across a couple of fields, so nobody would be passing by. She could have been there for a long time. When I first saw Janine, there was blood, but I couldn't quite tell where the blood was coming from. There was a bit of focus around her abdomen, and so I thought, crikey, there's a lot of important stuff there. My girls really, really liked Janine. They were really worried for her.
Clinical Director Phil is leading the trauma team.
That's 44-year-old Janine. Janine, she was with her horses today, and one of the horses kicked her back leg.
Yeah, where caught her here?
There, yeah,
okay.
in the hip area and the pelvic
Okay,
area.
yeah.
She basically crawled to get the phone. She called us.
Yeah.
So when we get there, very tearful.
Okay.
Quite a lot of pain.
What's her name?
It's Janine.
Hi, Janine. Hello. We're going to use a thing called a scoop stretcher just to pop you onto our bed, OK? Right, so we lift her onto the bed then, guys. OK. OK. Everyone got some?
Ready, steady, lift.
OK, gently down. Break the scoop, north and south. Broken at the bottom. Is it very painful at the moment?
It's all right when I don't move.
All right, quick listen to your heart and your lungs.
The biggest concern about fractures to the pelvis is if you damage the major arteries that supply the leg that run through the pelvis, then you can have a catastrophic bleed, and potentially that can be fatal.
So the pain, is it all this sort of area?
Yeah.
Good. Does that hurt a little bit? OK, we won't do that again.
Doctors are concerned the injury to Janine's pelvis may have caused a serious internal bleed. She's being sent for an urgent CT scan to determine the full extent of her injuries.
I'm trying not to cry.
I was going to CT because of the mechanism.
I'm just going to take her out to CT, OK?
Everybody ready? Yep. On slide. Ready, brace, slide.
Oh, OK.
Sorry.
Over an hour ago, professional dog walker Janine was kicked by her horse at her stables in Surrey. Doctors suspect a fractured pelvis, but she needs scans to rule out a potentially fatal internal bleed.
I've probably known Janine pretty much since we first moved in. She keeps her horses just up the lane, and we've got some fields which we were quite happy to let her have her horses in. We started chatting over the horses. She's a complete soft touch, and so if there's a horse which is really needy and needs someone just to love them, even though they're not going to be riding them or show jumping them, Janine will do that. She'll happily have a horse as a pet and make sure it has a good life. I think Janine has a real affinity with animals. I think if you spend that much time with them, it would be odd if you didn't have some sort of a special bond. So she clearly respects them, and they absolutely respect her. She's got a really good heart.
It's been brutal. It's all the weekend warriors, isn't it? I mean, everybody needs a hobby. I wouldn't stop anybody from doing anything they love.
I like the fact that Janine is just really straightforward. There's no second guessing. She's a very genuine person. What you see is what you get. We got a dog, and Janine was fantastic. Every time we just didn't know what to do to handle it, she was on speed dial. I love the sense of community out here. Every autumn, everyone in the lane goes and sweeps all the leaves off the road. And then we have, in the winter, we go and sweep all the snow off the road. Living here, you know that if you need them, there's someone there that can help out.
Oh, was that a fracture? That'll be the pain.
That is where the pain.
Fracture.
Oh, she's... Oh, ow, naughty horse. Bad
Done a
horse.
number on that.
Bad horse.
Her job is to walk dogs. It's very physical, and if she can't walk, then her life would really change.
We're done. We'll see if we can smooth out that bump again, all right? On slide, ready, brace, slide.
Oh, God, that hurt.
Done.
Fucking horse. Excuse my language.
No. Absolutely, you go for it.
Glue factory or burgers. Oh, God, that hurt.
Initial scan results reveal a major fracture to Janine's pelvis. She'll be immobilised to minimise further damage. Doctors must carry out further tests to determine whether or not her injuries could be life-changing.
I'm going to La France.
La France?
Yeah.
Nice, whereabouts?
Normandy.
Normandy.
See, I'm really good at French.
Yeah. Order your lunch. What are you going to have?
Je voudrais un poisson.
A chicken with
limon.
Lemon. You're good at Nando's. Limon et herb.
George's resus. An adult trauma call. Femur fracture, yeah. 2 minutes. How fast was this car going? Thank you very much. Bye.
An 18-year-old motorcyclist has collided with a car.
Can I have an unknown adult male trauma booked into Resus 8, please?
Every department that you work in will probably see at least one road traffic collision a day, if not a lot more. I've seen some nasty spine injuries. I've seen nasty pelvic injuries. I've seen nasty head injuries.
The rider's friend is travelling with him to A&E from the scene of the accident.
Me and George was just riding down to the motorcycle shop. I was on the back of this bike and George was driving. A car driver sort of just pulled out in front of this van and we just had no chance to see him. And before I knew it, just was bang on the floor. I ran over to George, make sure he was all right, and straight away I could see that his right leg was sort of hanging. When I looked at the car, there was a huge crack in the windscreen, so he must have bounced off the windscreen onto the bonnet. I remember trying to talk to George in that because he was sort of drifting off in between consciousness.
Yeah.
This is George. He was riding a bike, and the friend is outside. They were both on the motorbike. He's all right. And then they T-boned the car. They didn't see where it was coming from.
Okay.
So his upper leg is quite big hematoma.
So it's broken skin, yeah?
It's broken.
Okay. And was he at the front or the back? Was he a driver?
He was driving.
Okay. Okay. So can I have 3 down one side and 1 on the other? We'll take out the right side first. On the anaesthetist or the ODP's instructions. So primary survey.
George's mother is on her way to the emergency department.
When I got the phone call about the accident, I was at my daughter's house because I'd been babysitting the night before. And it was my son Tommy, and he said George has had a motorbike accident. It was scary.
Simon, are you getting morphine?
Oh, he loves the motorbike. Always has since he was a little boy. We got him a motocross motorbike when he was young. I think he was about 10. Banger cars, motorbikes, anything rough, George liked. I never thought about him having an accident or anything like that.
Can we wait? Look, if it's that painful, we'll give him some ketamine and then we'll have a look at it.
If you've got a nasty leg injury, that might take the focus away from their neck, where actually they could also have a serious injury that could ultimately paralyse them if you miss that.
In the way of imaging, gone over there. Yeah, good. Then we'll do leg as well. Do you want to put Kendrick traction splint on? Yeah. Give him some ketamine and then do that. Right, I'm just going to give you another little painkiller, all right? Just relax.
Doctors must stabilise George's leg with a splint before sending him for a full CT scan.
It does seem to be motorcyclists that come in with some of the worst injuries that you could get, and some of the most devastating injuries as well.
All right.
I'm going to go around for the scanner, OK?
So we just need to wait and see the scan for this lady, don't we? Yep. OK, I'll back shortly.
Over an hour ago, professional dog walker Janine arrived in Resus after being kicked by her horse. Initial scan reports show a significant fracture to her pelvis.
Did you say, what happened then? How did you...
I got hit by... He kicked me by the gate and knocked me backwards. So I was then sat on my arse, but I knew I couldn't move this side because it was pain straight away. So I kind of bun shuffled to the tat. I could not move this leg at all.
Why didn't you phone me?
Well, I just kind of went into panic mode. I'm not doing this anymore. I'm too old for this. If I shatter my pelvis, am I not going to be able to walk dogs? What am I going to do with my work, my mortgage?
Don't worry about that for now. You know, it is what it is.
I am very good at putting a big front on. Inside, I feel like I'm sitting an exam. I'm anxious and I'm a bit like a swan. I can come across very confident on the top, but underneath my little legs are going crazy because I just don't know what to say or what to do, and sometimes I just don't know how to be. I have something called Asperger's. I find people's social situations very difficult. When I was doing PA work, one of the things I found the hardest was the office politics. People are really complicated. My animals, they're so much easier. I should always been working with animals. I started up my dog walking business 13 years ago. I've been called Little Miss Doolittle because I do talk to the animals a lot. I just have an affinity with them. I've always loved them.
I just wanted to let you know that we're going to move you to a different area of the A&E department.
Okay.
And one of our doctors will see you with the results of your scan.
When I was a child, I was always taking animals home. I took an elephant home once. We had a beagle and a Labrador at the time, and I was allowed to take the dogs for a walk on my own. And they used to have the circus, and I went over there, and this baby elephant had broken free of its chain. I thought it was a stray, so I walked it all the way home. Literally grabbed her trunk and just took her home. I was walking down the road with an elephant, a beagle and a Labrador, and nobody stopped me. My mum thought it was Game for a Laugh. Do you remember Jeremy Beadle at the time, Game for a Laugh? And she was looking for all the cameras. There was nobody around. I was like, this is a stray. We keep strays. And then I got frog marched back with my mum and my dad to the circus to give the elephant back.
I can honestly say I've not experienced, I've never done childbirth, but that pain was, I've just never...
You were so brave.
Janine will be closely monitored while doctors decide how to treat her fractured pelvis and give her the best chance of walking normally again.
OK, right, we're going to slide you across, George, all right? Ready?
Scaffolder George needs a CT scan after being knocked off his motorbike less than 2 hours ago.
I'm going to do a scan of your head and neck first, OK?
This is the guy on the yes. Oh, yes. He's young, isn't he? Oh!
George's mum and sister have arrived at St George's.
When he was about 5, he was at primary school and they had concerns that his reading and writing wasn't up to scratch, and they seemed to think that he was acting out his behaviour because of that reason. So they sent him to a behavioural school in Battersea. And he started, like, playing up big time at school, running the teachers ragged. I used to dread parents' evening.
The scan reveals a significant break to George's right femur. Doctors will await the full report to confirm any other injuries or nerve damage to his leg.
George, you've got some lovely people here to see you.
George, your mum's here. You all right? No, I know you're not all right, mate. Silly question.
You're doing just fine, my love. Being really brave.
Thank you.
Hello, St. George's Emergency.
He's gone.
Is he on warfarin, do you know? Out of priority, easy 5.
There are definitely moments when you just don't want that phone to go off anymore. Because when it does, you seem to be trying to juggle a whole load of balls in the air at the same time. You've just got to kind of get on, get your team ready and be prepared for what's coming in.
An 80-year-old man is being rushed to St George's with an uncontrollable nosebleed. He'll be brought into resus because of anti-clotting medication he takes for his heart.
I was staying overnight with my daughter, family babysitting, because it was my granddaughter's 8th birthday treat, and the family had planned to go to Chessington for the day. And early on the Saturday morning, my grandson James came in and said I was needed because of this massive nosebleed. It was just as well the grandson turned up when he did. By then, Val couldn't really have the strength to stand up anymore. The decision was then made we couldn't contain it, so we should call an ambulance. And they managed to get him downstairs to the ambulance. And just before we left the house, they turned around and said they were going to put the blue lights on and send us in as a resus case. That really made me think, actually, this is more serious than I'd imagined.
Number 5, please.
On 3. 1, 2, 3.
Let's take that out. We'll just...
Continuously bleeding.
That's fine.
This is Val. He's 80 years old. Val's had a continuous epistatic for... I'm not sure roughly how much blood he's lost, but since we've arrived, wherever's in that bucket there, initially blood's been quite clotty, but it's been more kind of just seeping through, even with the dressings on.
Do you want to put the epistatic on? Oh, thanks.
All right.
Thank you.
Thank you.
My name's Sophie, I'm one of the doctors. Okay, now we're going to put a little something in the back of your nose, okay? This is hopefully going to try and stop that bleeding. So it's going to be a bit of pressure, all right? Young adults will actually compensate having lost an awful lot of blood, whereas elderly patients will cope quite poorly with losing what is a reasonably small amount of blood. If you worry that their blood volume is going to reduce, they're not going to get enough blood to their brain, they're not going to get enough blood to their vital organs, they're not going to get enough blood to their heart. And if they're not getting enough blood to those organs, you become quite unwell. Is it a bit painful?
I think he's quite different from anyone I'd ever met before. The night that we met, he asked if he could have my phone number, and I was somewhat bemused when the way he recorded it was to dip his finger in his pint of beer and write it on his forehead. Apparently that was his method. He was fun to be with. We had a lot of laughs. We both felt, I think, that we'd known each other a very long time. Seemed to be a natural union.
Doctors must now wait to see if the inflated dressings will stem the bleeding from Val's nose.
In a minute, we'll move you back and sit you right up, okay?
Right.
Should we get you going? Let your bad leg fall back like that, yeah.
So yeah, bring your crutches out.
Right, OK.
All right.
Stand up straight. You look like that. Yeah, so look in front of you. Put the crutches a little way in front of you. Hop, stop. Hop, stop.
This is the first time I've been on them.
Do you have a pain in your hand?
No, it was just this hand here, but it seems to be fine.
Okay. 18-year-old motorcyclist George has seriously fractured his right femur after he collided with a car and was catapulted into the windscreen. An orthopaedic specialist has arrived to determine if he has also suffered nerve damage to his leg. Is it possible to move your toes? Toes?
I'm going to try, yeah?
Yeah.
I'm going to try. 2 seconds, yeah?
Yeah, only toes. Try.
No, man.
If they've got poor sensation in their feet or they can't move properly, then obviously you're a lot more concerned. If we don't treat an open fracture appropriately initially, then you can have quite serious consequences down the line and the potential to cause quite serious disability.
I don't know what they gave me earlier.
Morphine.
I thought I was dead. I was seeing different things. I wasn't seeing life. You go out there and get set phone so I can ring my uncle.
Oh, he was coming up the hospital. He was going to get your bike.
I told him not to bother.
But they want to see you, just to make sure you're all right, matey. Everyone wants to come and make sure you're all right.
I'm a fag. I'm a fag and go home. I remember flying.
Over the handlebars.
Don't know where, I just remember flying. Literally flying and stuff.
I knew he was going to be my last baby, so he got spoiled. I always cooked him different dinners, what he liked. The others used to have chores indoors to do, and George got away with doing nothing. Morphine might be wearing off. I've got 4 children. It was tough bringing them up. George was about 2 when me and his dad split up. For a while, we used to see him every weekend. And then it stopped, and he would and he wouldn't, and that's how it's always been. I think it did bother George growing up not having their dad, because a lot of his friends had their dads and that. They need some sort of male guidance, I think, because there are certain things that a mum can't talk to her son about. My brother played a very important role in his upbringing, but I think he still missed his dad.
Doctors are concerned about the lack of movement in George's foot. They need to run further tests before ruling out any life-changing injuries.
Just check your blood pressure and everything and make sure everything's all right.
Val arrived in A&E 15 minutes ago with a serious nosebleed that had lasted almost 3 hours. Dr. Sophie has inserted nasal tampons, and Val will be closely monitored until they stop the blood loss.
Yes, I noticed that. Very keen on blood pressure, but you never measure how much blood there's left in the body, do you?
Oh, we've already done that. At the moment, you probably have lost a reasonable amount of blood.
and we'll just need to keep an eye on it. But at the moment, yeah, it always looks an awful lot worse than it actually is.
Having spent all my life as a dairy farmer, I realise that blood does look quite dramatic. I was actually born on the farm in South Ruislip. I would have found it difficult to imagine growing up anywhere else. When I was a kid, we only had about 30 cows. My father, I think, always hoped that either I or my brother would carry on with the farm. But my mother was very set against the idea. She saw it as a very difficult life.
Right, I'll go get your wife then. Do you want me to bring her in?
Yes, yes.
It's not a job as such, it is definitely a way of life. When I first met Val, I really didn't know anything about farming. I'd always been fond of animals. I don't know if that was any preparation for life as a farmer's wife.
Hi, I'm Sophie, I'm one of the doctors. Do you want to come and see your husband?
Val's daughter, Sarah, has also arrived in Resus.
Hello.
What are you doing?
Well, if I was perfectly all right, I wouldn't be here.
This is true.
Would you like to take a seat, madam? People would think that I was mad getting up at 5 o'clock in the morning, but I enjoyed looking after healthy animals that are enjoying life. On a nice spring morning or summer's morning, you'd think, oh my, what a wonderful world.
Do you feel like that blood's still trickling down your throat at all?
I don't feel it now, no.
Good. All right. So what we do is we generally leave these packs in for 24 hours just to hopefully have stopped any bleeding. I need to speak to the ear, nose and throat doctors. It's likely that you'll need to stay in under them.
All right. I'm just going to pop on this. It's like a little bolster just to...
Oh, your finger's out.
Oh.
Idiot.
Oh, there's a time for humour and there's a time for not. Calm down, dear.
The visit to A&E disrupted family plans to go to the Chessington Adventure Park for the day.
Now, let's come to terms with the day, because if I'm in here overnight...
You're going to be here, they were saying, for 24 hours. We will...
Yeah, OK, the knock-on consequences of that are twofold.
Mum is here with Mum's car. Mum's car is in the car park.
She's here with one dog without any dog food.
That's all right, we can get dog food. So that's one thing to do. The other thing is working out what we do during the day today.
I think you should go because Dad's safe.
Yes, but we need to think of the four-legged friend.
Wait a minute. Why don't you talk so that I can hear you?
Let's just get you settled first and then we'll...
I am very settled.
Oh, good.
I'm wondering how long it's going to be before you two wander off so I can go back to sleep, which is what I was going to do when I...
Rudely awaken.
My voice has gone all hoarse.
Oh, well, perhaps you need
Give it a rest. You walked into that one.
We have only the one daughter. I think she's got her mother's charm and my bloody-mindedness, but could never see herself as actually running a farm. I was always more concerned that any children that we had would be happy in what they did than that they should do what I had chosen to do.
Val will now undergo further tests so doctors can find the cause of his severe nosebleed.
He's gone now. And what's the plan with number... OK. People always say, what would you do if you went to doctor? And I can honestly say I'm not sure what else I'd do. My husband is not a medic, but his mum, dad, aunts, grandparents were all medics. He never wanted to go into medicine. I don't think he could deal with it at all. He can't stand the sight of blood. But the next best thing for him was marrying someone who was a doctor, and his family love me, so it's fine. My mother-in-law loves me. It's amazing.
Yeah. Bless you. Bless you. She sneezes like a little pixie, doesn't she? Whereas I sneeze like not a lady, basically.
Do you know what? I'm not even hungry.
You don't?
No, I'm thirsty. I'm really, really thirsty.
Do you want a lip balm?
Yeah, because my lips are so dry.
Almost 4 hours ago, dog walker Janine was kicked by her horse. Initial scans indicate she has a severe fracture to her pelvis and is being kept under close observation for signs of any deterioration.
Hello. I'm Sophie. I'm the nurse that's taking over. And I'm just going to do your blood pressure, if that's okay. Sorry, I have really, really cold hands. There's nothing I can do about it.
While this nurse is with you, I'll pop down there.
Thank you.
My mum was literally my best friend. She really understood me when not many people did. Oh, she was just gorgeous. She is gorgeous. About 16 years ago, I remember it 'cause it was just after my birthday, she had pains in her chest and pains in her arm. And Dad took her to the doctors and, you know, insisted. And the doctor said she needed to go for tests. So Dad took her straight away. She came home first because she wanted her knitting. So I did her a big bottle of water. She got her knitting and I got her slippers. And that was the last time I saw her normal. And then I got a phone call about an hour or so later. I heard it ring, but I didn't get to the phone in time. And I went downstairs. It was like BT 1571, you've got a message. It was my dad saying, she's dead.
Do you want to pop that on your finger? I'm going to get you some IV paracetamol as well, so a bit more pain relief.
I remember turning up at the hospital thinking that she was dead, that they had managed to resuscitate her. But they'd managed, she was 13 minutes without oxygen, so she suffered hypoxia, which means starvation of oxygen to the brain, and sadly she was left very, very badly brain damaged. So now she's probably got the mental age of a 2-year-old. She doesn't really know who I am. Quite a few years, I really would genuinely think that I'd get home one day and Dad will say, she's back, it's all okay, everything's okay. But it never happened. My mum's heart attack was a massive wake-up call. I was like, I've got to make some serious changes. My home life is now really, really sad. I don't want my work life to be really sad too. And everybody thought I was crazy when I said I wanted to start walking dogs. Everybody, it was a crackpot idea. Nobody took me serious. So that was 13 years ago.
Doctors are discussing Janine's injuries with orthopaedic specialists to decide whether she needs emergency surgery.
Hiya, there's a bit of a crack in the bone in the pelvis there. OK. And you won't be allowed to hobble around on that, so we're going to bring you into hospital and keep you pain-free as much as we can, OK?
Starting to feel really sick.
OK, we'll give you some anti-sickness medicine as well.
Could that be all the morphine?
Yeah.
I really am starting to feel really quite not very well.
What happened to Mum changed my whole aspect of life. She's wicked, she's still lovely. She's got a joke. If you say to her how to make a snooker table laugh, she goes, tickle its balls. Every time. She remembers that joke from years ago.
I don't think I asked, do you?
George's brother-in-law Jimmy and friend Seb have come to see him in resus.
George, your doctor wants to speak to you.
Orthopaedic doctors have now received the final report of George's scan.
George, this is regarding your femur. It has fracture and also it's open fracture. At the same time, scan shows a pelvic fracture. You need surgery. We are going to cut it upper part of the thigh region and we put a nail insert.
So when's he having this operation?
So as soon as possible, if it is a theatre-free, I will discuss with them and we can arrange that.
It was hard to see him in pain. I got a lump in my throat. I felt a bit helpless that I couldn't do anything. But it was the operation I was worried about. I didn't want his life to be different.
I'm going to put a small mark on your leg, okay?
George has sustained critical damage to his leg, and doctors are now preparing him for theatre.
Don't worry, I'll be here, I won't leave. All right? I'll still be here waiting for you to come round. And once you go down for your op and they put that nail in, you won't be in you won't be in as much pain. All right? So put you in a cast as well.
I'm going to remove your neck, then it will be...
He used to have a naughty little temper on him, but as he's got older, he's like a different boy. He's a right softy, he is, right softy. He will go over to, say, Seb's, and I'll be indoors on my own, and he'll ring me an hour later and he'll say, "Are you all right, Mum? Are you bored? Do you want me to come back because you're indoors on your own?" I'm very proud of George. I'm very proud. He's turned into a lovely young man.
I'm going to move you just to a different bed space, OK?
George will now be moved to an orthopaedic ward ahead of a 6-hour operation. Earlier today, Val experienced a severe nosebleed while visiting his daughter in London. He's now waiting to see an ear, nose and throat specialist.
How are you getting on?
I feel it's an awful lot of fuss about a nosebleed.
Daddy, when you can hear the blood pouring into the bucket, that's not a nosebleed.
And there was quite a nice big clot that came out, so...
That's what holding my head over the bathroom sink.
Let's just come and have a word.
I was also aware... Where's my secretary gone?
Oh,
She's never here when she's wanted.
Oh, dear.
It's so difficult getting the right staff. You must probably find the same problem. Oh, wait. The body's over here.
Daddy, we're going to assume that when the ENT guys come, they're going to keep you in, because I think that, it sounds like they are. They've asked for a bed for you already. I'm therefore going to go home now and go to Chessington for the day. Have fun, darling.
Righto. Bye-bye, dear.
Mwah. I will see you later. I'll come see you tonight. Bye-bye. Mwah. OK.
Bye, dear. Thank you very much.
Have a happy day.
Age is something that you cannot fight against. So I was determined we weren't going to sit there like a couple of decaying geriatrics with the whole place collapsing around us. That we were going to get out whilst we were doing a decent job. It's about 6 years since we left the farm. 6 years and a few months. The real trauma was parting with the dairy herd. It was my reason for being, in a way.
They went to an auction sale and all the cows had to be washed and brushed and made to look beautiful. And they went through one by one in the ring. It was very, very sad to see them go. But rather than fail to carry on, it was better to make the decision to stop, sell them and turn the page. Wherever we travel in the country, Val's always what I call farming over the hedge. He says, he comments like, "Oh, they've got a new barn going up there," or, "Oh, they ploughed that field the other way round." It's something that he's always going to do, I think.
They tried to get me out of bed. I remember crying and crying and crying, and I just couldn't do it. I just could not stand up. That scared the life out of me. I have found something that I truly 110% belong doing. It's animals, it's what I love most. I love it every day. There's not a day that I don't get excited about walking my waggies.
My family mean everything to me. Even when it isn't hard times or tough times, we're always there talking together, see each other for a cup of tea. We'd all probably be everywhere if we weren't close, to be fair with you. We all help each other out, and it's what makes us the pack, if you know what I mean? Makes us get through.
He has said to me from time to time that I've done a good job bringing him up on my own, and yeah, I think he does think sometimes that he owes me something, but he doesn't.
Georges, can I have some help, please?
She needs me, and I know she's going to want me.
You can't take another one.
Is he still fitting?
Liam, can you open your eyes?
St George's Resus. I realised it was a real trauma call.
It's always in the back of your head. I could lose Liam.
Very, very scary.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week.
I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before. We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked by a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie!
Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
A&E, can I help?
We called
earlier on about the hot air blowing through the vents. Is anybody onto this?
I'm hot, plus I'm getting hot flashes on top of my hot. I feel like my shirt is sticking to me.
Don't even talk to me about hot.
Hi. Anesthesiology. Hi. Reese.
Reese has been a consultant at St George's for the past 3 years.
Hey, have we got a Welshie in the house?
Yeah?
Yay, Team Wales. I grew up in South Wales, roundabout in the Vale of Glamorgan. Being an only child, my school was a really happy place. You just feel like, you know, you're all in it together and you're just all sort of supporting each other as friends. You've walked 10K. I don't have time to go to the gym, so I'm just going to walk around the hospital until my bleep goes off.
I've given up my gym membership.
My career has brought me to London, so I've had to leave some of my close friends back in Wales where I trained. But we're lucky we're a big group of consultants, and quite often, you know, you'll sit after a shift and just discuss, did I do the right thing? You know, would you have done something maybe differently? Just to share that responsibility of big and potentially life-changing decisions. We should fist bump now.
Lola, St George's? Sure, go ahead. Yep. $15. 5. Echo Mike. Thanks, bye. Priority call, 5 minutes.
A 13-year-old boy is being rushed to St George's after crashing his bike into a parked car whilst playing with a friend. He's sustained injuries to his face and head.
Yeah, let's think about some paracetamol and morphine. When the phone goes and you hear that it is a pediatric call, like, I want to know what the details are, whether this is a significant injury or not. If a child comes in with a significant head injury, what I'm worried about is any internal bleeding. Then we're worried about fractures in the facial bones. Cool, if you could all put an apron on top of your legs.
His mum arrived at the scene of the accident and followed the ambulance to St George's.
I was sat in the back garden having lunch. The umbrella was up, the sun was shining, and Tom was out with friends on a bike ride. My phone went, and I thought, OK, who's that? Picked the phone up, and it was Tom's friend, Ollie. And I immediately thought, what's wrong? Something's happened. Why is Ollie ringing me? He said, Tom's had an accident, and I could hear him in the background, and that was, yeah, not a nice noise. He was clearly distressed. So when I got to where Tom had had his accident, he was on the ground. His whole side of his face had come up, big, red, enormous, and his face was completely distorted. And he had blood coming out of his nose and his mouth.
This is Tom, he's 13. Racing his friend down the hill on their push bike. Wasn't looking where he was going. He's hit a stationary vehicle. Cannot remember anything. Large swelling, lost chipped and lost tooth in the face. Was complaining of groin pains. Had 1 gram of paracetamol.
Lovely. What's his name?
Tom.
Tom. And where's Mum? Hi, Mum. Come with me. I'm Reese, one of the A&E consultants. Why don't you go up and be next to him so that you can see your face? Do you mind taking his head? Is that all right? Thank you. Do you want to do a primary survey, please?
Oh, just keep your head still, Tom. It's all right, don't worry. We'll let you know if we want you to move. So, swelling to the right side of the face, and there's some dental damage front right side as well.
In children with a significant head injury, we need to get our assessment done as quickly as possible, because if there is any evidence of internal bleeding, then we need to treat that as soon as we can, really. And that's why we always activate a trauma call response to these children, because we need to be able to make a really rapid assessment to make sure that we don't miss any of these injuries.
Can you feel me touching your legs here? Where's it hurting? In your groin. OK, all right.
He was clearly concussed. He didn't quite know what was going on. And at that stage, I wasn't quite sure what we were dealing with.
Well, I'm going to take the collar off so I can feel around the back of your neck. Yeah. OK, so...
Where does it hurt there? Here?
Yeah. Okay. He's got a subconjunctival hemorrhage.
Has he? So we'll CT his face as well, then?
Yeah.
Doctors are concerned that the impact to Tom's skull may have caused a bleed on his brain. They'll need to scan him immediately to determine whether he's suffered any life-changing injuries.
His facial bones need CTing because he's got subconjunctival hemorrhage and he's got a big I think he's got a maxillary bone fracture. So we'll do his orbits and then we'll do his head because of the amnesia and the mechanism. Can we start taking him round, Danny? And it's just they're holding the scan for us.
I was worried about brain injury because it was such a huge swelling. And I was just thinking, right, I hope he's all right.
You could come in a sec, Mum.
Thanks.
Okay, this is Tom.
Hi, Tom. Tom, we're just going to take some pictures of your head and your face, OK?
13-year-old Tom arrived at St George's after crashing his bike into a parked car. He's been brought to CT so doctors can assess the severity of his injuries.
Ready, steady, slide. Perfect.
Are you happy to wait outside just for 2 minutes?
Thanks. Just take a seat. We'll be 2 minutes, Mum. There's some just chairs there.
That's it. You keep nice and still. We'll be back in a minute, all right?
Family was always part of the plan. I met my husband at university through a mutual friend. We got married in our late 20s. I think he might have stopped at 2, but I was one of 3, so 3 seemed like the right kind of number. I remember being pregnant with Tom. I had horrendous morning sickness from about 5 weeks that lasted to about 35 weeks, which is when I had him. His entrance into the world was dramatic. The day he was born, I had a massive, torrential, huge bleed. I don't remember the moment he was born because I had a general anaesthetic and a crash section. I was out of it. There's no time to put in an epidural and fiddle around. It really is get the baby out now.
He's got a big bruise on his right side of his chin. He's got some amnesia of the event, no loss of consciousness. Contusions over the left side of his groin and testicle. Can you do mandible, please?
Tom was gorgeous. He was small to start with, but grew quite quickly. There was that, precious first baby, and particularly because he arrived in a hurry and all in a bit of a dramatic way. He talked really early. Said his first word when he was about 11 months old. It was sock.
I just looked straight,
Yeah.
By the time he was 2, he was speaking in full-length sentences, and you could have a conversation with him. He sat quietly by a bookcase and read books and chatted. Wonderful, perfect baby.
Doctors will await the results of the CT scan to see whether the impact has caused a bleed inside Tom's brain.
It is getting hotter and hotter now. I'm starting to smell.
Would you rather have 3 eyebrows, so a third one up here, okay, or have a third armpit in the middle of your chest?
Oh, that's gross. Oh, I don't know. I think I'd rather the third armpit.
Someone's written a face on his leg, look. It's a pair of lips. I thought it was a wound.
You getting McDonald's breakfast? Are you getting, oh, you're getting double egg muffin.
26-year-old Andy has come to A&E after injuring his knee during a game of frisbee.
Get the hash browns as well, man. Get the hash browns as well.
His friend Sam, who was with him at the time, is on his way to St George's.
Well, how long are you going to be? Right, so. A little bit of fresh air. Where is Sam? There he is.
Bagel or muffin?
Both. Right, hash brown in it.
Go on, stand up and get it.
Please, no, that's Thank you. We met in reception when I was 4. We were quite heavily imaginative kids, where we'd build dens. The music's so loud. And just always playing characters and things like that. Patrolling, trying to catch me riding dirty.
I was quite a naughty kid at school, but Andy wasn't. He's not really naughty. He likes joking about, but he's not. So we didn't get into too much trouble.
Patrolling and trying to catch me riding dirty. I remember going to see Sam at his house for playtimes, and we'd just start laughing and smiling before we even got to the door.
Oh, my God.
Don't fucking touch it. It's hurting more and more. I think it might could be sobering up more and more. I'm gonna get a selfie of me on my foot. It's just me and my big leg. We go to the hospital. We're hanging out.
We are a bit more like a double act, I guess. We tend to stick together quite a lot. He can get pretty hyper and it sort of spurs me on, and then we can, yeah, get pretty carried away, I think.
Do you have a best friend? You wonder why they're your best friend? Stop it! No, literally. Literally, Pan, stop it.
I know how to sort of make him laugh, and he's got a very sort of stupid sense of humour, like, not very refined, just very sort of idiotic.
Oh, God. Yeah, well, I'm tired. Oh, see if we can get some blankets.
You can't get blankets.
You don't reckon? I don't know how I would have survived a lot of the situations in my life without Sam. Selfie.
"13-year-old Tom has severe facial injuries after crashing his bike into a car. The initial results of his CT scan reveal no damage to his brain, but doctors are still concerned that the force of the impact may have caused internal injuries.
Hi, it's Reese, A&E consultant. He's just got a really massive hematoma to the right side of his face, so extending all over the cheek up to the eye. He's got a subconjunctival hemorrhage as well on the lateral aspect of the eye, but normal eye movements. If you see the size of it.
Are those tears of pain or tears of upset? But you know what? It's all going to get better. Tom is just somebody who grabs life by the horns. He throws himself into things and then he'll fall over and hurt himself. He's very competitive. He wants to do his best and he wants to get the best out of things, and he will push himself.
What happened?
What happened? You hit a parked car, darling.
How?
How? I think maybe you just for a moment weren't looking where you were going. Your bike is a write-off.
That's so stupid.
It was a bit stupid. You've got a really good friend in Ollie Watkins, haven't you?
Did he call an ambulance?
And me.
How did he know your number?
Well, because you use his phone to call me so many times. So he's probably very sensibly saved it. I'm a kidney specialist in my other life when I'm not being mum. My dad was a paediatrician. He always said to me, don't be a doctor, go and be a dentist. It's much more career-friendly for women. But I wanted to do medicine when I was very small. I stuck with that idea.
going to give you some pain relief, Tom. Okay. Are you Tom or Thomas?
Tom, please.
Tom, OK. Thomas when you're in trouble?
Yeah.
OK, well, you're not in trouble today, then we'll definitely call you Tom.
Half of me is rational and calm because that's what I've been trained to do. But actually, I'm still his mummy and he's still my baby boy. And there's that kind of mix of distress that my little boy is there with his smashed up face and his broken teeth.
Don't worry, honestly. Don't worry, you're in the right place.
Tom will now wait to be seen by specialist surgeons to decide whether or not he'll require emergency surgery to relieve the swelling in his face.
Oh, John loves that film, Beaches.
Oh, yeah, Bette Midler one.
Yeah.
I love her singing.
That's what we're having at his funeral.
Oh, right.
And you haven't booked your funeral, have you?
No.
No, I went to the Co-op. On the way in, I want meatloaf, bat out of hell. I said, and on the way out, the dance of the mods. You know the mods?
Yeah.
Don't know. Can you see anything of those photos?
I can see a bed and I can see people in it.
This is Clemmy, our young one.
There's no point in showing me pictures now, I can't see her.
No, I don't know. I'm trying to work out how bad your sight is, that's the thing.
50-year-old Jason has come to A&E with his best friend Matthew after suffering from blurred vision for the past 2 days.
What games are you playing at the moment?
Stuff you play on the PC.
Which ones?
One's called World of Warcraft. I play the Star Wars one.
So you're not playing Candy Crush, then?
Good God, no.
I'm on level 438.
I've known him since I was 13 years old, and we were at boarding school.
It was a small boarding school in Henley that specialised in dyslexics, kids that failed common entrance. It was a boys-only school at the time. Jason was in Welsh House up at the top of the school, and I was in the main building, Skipworth. Who is it you like that they had at the Oxford Union debate the other day? Nice show. Where'd you get that from?
Well, I bought it.
Where from?
Marks and Spencer.
Jesus, they don't do nice shirts like that for me.
Marks and Spencer, non-iron.
Yeah, I suspect, but if you need extra length, you don't get those good shirts.
Mostly got to know each other, sharing homework and figuring out stuff in lessons.
He was useless at maths, I was good at maths. He was much better on the Englishes than I was. We also got involved in the Film Society, and I was a projectionist, and Jason was on the door.
There was a play once, A Christmas Carol, and they decided they wanted a bit of comic relief and got us to be Farmer and his wife. So I was the henpecked farmer and he was the wife. So, you know, we come on our cue and get a big laugh.
Mike, we're at St George's Tooting. OK.
Matthew, come over here again. I'd had a bad time with bullying at my previous school. He had managed to keep people away from him by being a tall person and being rude to people. So I was quite often apologising for him or just trying to keep people from beating him up. We stuck together, basically.
Oh, well, anyway. What else do I do with my iPad?
Mr. Andrew Laurie, please.
26-year-old Andy has a swollen knee after twisting his leg during a game of frisbee.
God bless you.
Who did all this? Bless.
I know, that's so embarrassing.
It's not, it looks nice.
I mean, no, it doesn't. I wanted sympathy and they drew on it and put lipstick on it.
that's what friends are for, isn't it?
Can you prescribe me with better friends?
You've got best friends, I would say. My name is Shabana.
Hello, my name's Andrew.
I'm one of the nurse practitioners. Nice to meet you too.
How are you? How's your night been?
It's been good. Tell me about yourself.
Oh, well, it's my friend Ollie's 26th birthday party. We had a barbecue in a park, and we were playing ultimate frisbee.
Yeah.
And my friend tackled me.
Okay.
Not naming any names, but that guy right there.
Did you fall directly on the knee, or did you twist your knee?
I couldn't say. So I was drinking alcohol at the time.
And the swelling and bruising came up when?
A couple of hours, really.
Couple of hours. Okay. What we'll have to do is we'll definitely have to X-ray this knee first. Any numbness, pins and needles in your leg?
Yes, it's very numb.
Can you lift this leg up in the air, straight up? No. Okay, and how much can you bend your knee?
Oh, I don't want to try that.
Pain there?
Not pain. It's like a spider.
When we were very young, Andy was always very happy.
Whoa. Like, I know you know what you're doing.
But I think his dad left when he was maybe 10, and after that, I think there was always a little hint of, even though he was generally still very happy and easygoing and relaxed, there was a little hint of sadness.
Right. You have any medical problems otherwise? Any medication you take regularly?
Citralopram.
Okay, and what's that for?
For anxiety and depression.
I remember, obviously, when I was 16 and I had the first few times of just not getting out of bed and just all these horrible questions and all this critiquing of yourself. Without anybody explaining to you, obviously, what's happening to you, you just sort of get on with it.
What do you do for work?
I'm unemployed at the moment.
Okay.
It wasn't as much of a problem at university. It wasn't until I left and started going into full-time work where I found I wasn't able to just be myself. On days where I was feeling down, that's when I found depression became a bit unmanageable for me.
That's humongous. I really can't be asked to it.
I didn't want to go and get help from it because it wasn't something you go and get help for. But at the time, I had responsibilities. I was living by myself as well. I couldn't afford to let depression affect my life in the way it was, so that's when I went to see my GP.
The thing is, my knee's gone into a whole different shape. It's like, it's now pointing out.
It's always kind of weird to think, like, where's the knee?
It comes and goes. You can sort of sense and feel things creeping up on you. I've always thought it's been like falling down a black hole, which is right in front of you. But when you do fall into it, you feel like a failure for falling down it again.
All right. Would you like to come and take your seat back on the chair, or you're comfortable on a bed?
Oh, I'm going to go in the chair. I don't like being in the bed.
Careful. That's it. Well done.
Yeah, man.
Hey, man. How you doing?
Hey, bless you.
I'll see you after the X-ray, yeah?
Yeah. Am I going to see you again? Because you're very.
Yeah. I'm going to come back to you after the X-ray.
Good.
When you are feeling a little bit low, it's good to go and see Sam because he'll just make you laugh.
You thought it was funny, right?
It was funny at the time.
It was funny.
And remind you not to take everything so seriously, you know.
You see me rolling, they hate it.
Do you have any medical problems at all?
No, this is my very first time in my whole life in a hospital as a patient.
Right, welcome.
No.
Hello, so tell me about what's happened.
Well, I woke up from a nap and suddenly my eyesight is blurry in the middle, and it was there. I can't tell you if it came on suddenly.
50-year-old Jason has come to St George's after suffering problems with his vision.
Right, so I'm just going to check your reflexes.
Okay.
Jason started working at his father's office, which was based in Oxford Street. And, you know, we saw each other and we did a few things together.
Be right back.
Sure.
Saw the new Jurassic Park film.
Yeah, very good.
You thought it was good, did you?
Oh, they're brilliant.
Really?
Ah.
I thought it went on for far too long. His parents were very good at inviting me over for a weekend or something. And I got to know his family quite well.
Dinosaurs are going to escape. People are going to get eaten.
Jason, if I remember correctly, I don't know of any films you've walked out saying they're rubbish. You always had a thing about saying every film was good.
I don't. I have seen some rubbish movies.
I've always thought you'd make a really good film critic reviewer for the cinemas.
I mean, he stayed weekends with me and my parents, and I stayed a few weekends here and there.
Name me the 3 worst films you've seen.
Home Alone.
Home Alone. Oh, that sums it up.
I went to see the Mad Max movie.
You went to see it? Any good?
Yes.
I suppose it's a test of your friendship when a tragedy occurs. It was the summer holidays, and I saw a news item on the television. And I remember thinking I recognised that house. And then I picked up a copy of the newspaper. And I can remember reading the newspaper, and 2 of the names of the dead were Jason's parents.
When I was 21, my parents were killed. I don't really remember much else about that day, except eventually going home and seeing my sister and hiding from people. Matthew obviously heard and came round to see how I was doing. And just wanted to be there.
There's not much else to it. I mean, just befriending him, talk to him. But, you know, you either run a mile or you're there. And that's it, you know. For what good it was, I was there.
We just sat there, really, and that was enough. I mean, we talked a bit about other things, but... and it was just nice to be supported.
I've spoken to the ophthalmologist on the phone, so the eye specialist, and they would like to see you so they can have a more thorough examination of your eyes. Okay. You can go and get something to eat and then come by to their Duke Elder ward.
I'll take him there.
It's sad that I never got to know them as an adult. When it's sudden like that, it's quite difficult to deal with. No problem.
Yeah, Sunbeam.
Lovely. Thank you.
Right, go on.
Right, now the question is...
Go on, let's find a way out.
Where do we go from here?
Don't worry, I'll show you.
My face really hurts. Your face hurts? Yeah, well, you've just that strong painkiller you've had just takes a minute to kick in. You've just had it through that cannula in your arm. Put your head down. Go wiggling around.
Specialist doctors have been called to assess Tom's stomach and groin, which took much of the force of the collision when his bike crashed into a parked car.
I'd like you to have a little look at his groin, if that's OK. And then it's probably going to be max fax. If you have any injury to the abdominal area, you can injure the pelvic bone, which is, a significant injury. But if a handlebar goes into your abdominal wall, it can injure the small bowel or organs such as the liver or the spleen. And those can be really serious injuries.
Hi.
Hi, I'm another doctor, I'm afraid. I need to look at your tummy, because I think your handlebars probably hit you in your lower tummy. You tell me if your tummy hurts, OK? Is that all right?
Yeah.
Tom is definitely quite an open boy. We've always got on well and had a good bond. And I can tell if he's not happy about something, if something's bothering him. working through those issues and difficulties is, you know, it's part of being a mum, isn't it?
So, yeah.
God bless you all. A little cut.
Yeah, you've got a tiny, tiny cut.
My mum didn't work. We weren't overly close when I was growing up, but it wasn't until I had children that I really kind of appreciated what she had been through and what she had done. And I think had she still been around, we would have had a closer relationship now than we did growing up. But unfortunately, she got Parkinson's disease when she was in her early 40s. I was expecting Tom when Mum was admitted to hospital the last time. She got to see the scan pictures and that really upset her. She just turned her face away. And I think she knew then that she wasn't going to meet him. I was about, I guess, 6 months pregnant when she died. That was really tough.
Any pain here?
No.
Any pain here?
No. Yeah.
Bit there, huh?
Having Tom there was a distraction from what I was doing, even though he was still babe in arms and in one of those bouncy chair things. I think probably the loss did make me territorial with him, a bit like some lioness with her cub or something. Come and have a look, but I'll growl if you get too close.
It's like he didn't quite hit you where it counts, OK?
Few.
Grandchildren are still in the office.
Good. Hey.
So we're
baby.
gonna probably need to watch you overnight if nothing else.
I'm not meant to go home.
I don't think so just yet, love.
No, we need some scans.
What's waiting at home for you? In a minute.
You got
Be
somewhere you need to be.
fixed. No. You're not playing cricket tomorrow, that's for sure. OK? Don't worry, darling.
So we're going to x-ray his wrist, Mum, now, and then send him round to Peds, and then we'll have a look at him there.
Doctors are still concerned that Tom's facial injuries may have caused underlying damage, and he'll be taken to paediatric A&E for further observation.
So this is your finger.
Is it that tiny dot there?
It is that tiny, tiny dot there, and that is exactly where you've got that nasty bruise.
Can you believe that? Wow.
I'm pretty impressed you saw that.
Quite amazing.
Maybe you should consider a career in radiology. Think about it.
What work do you do?
I'm a university professor.
In what subject?
History.
I never took history.
Well, that's a shame.
It is. My father said there's no future in history.
No, it's history.
Hey, I've just finished a level on Candy Crush. Amazing.
Jason has been referred to an eye specialist after suffering blurred vision at home.
What a hoot.
For which I apologise.
Don't worry, this is what it's about. You know, when you have an emergency, which is what you've got, you know, it's about being there to help.
I've always managed to remain single. I guess I sort of somehow picked up a bit of a solitary lifestyle. So it's always nice to have friends you can go out with as and when. Being friends with Matthew has really helped in that way.
And I took the children to go and see Roald Dahl's Matilda, which is very good.
Wow.
And had some very good music in it. When your eyesight comes back, we'll go off and see something like that.
Yes. He's not the easiest person in the world to get to know, but when you get to know him, he's the most loyal friend you're gonna ever have. They like the songs in Frozen?
Good God, yes. You have family and you have friends. You can't do anything about your family, but you can choose your friends. Let it go, let it go.
Or something.
Yeah, they love that one. And Jason, I know that if I can call on him to do something, he'll do it. Do you remember when Rocky was the first ever film that made it to 3?
Yeah. You know they're doing another Rocky. But it's not about him.
Yeah.
So it's called Creed.
I remember his sister got married and I was the only guest that was allowed to come with Jason. I was very honoured at that. Would you like to try some aero?
No, it's fine.
They've made it look like boobies.
I think in all likelihood, I think we'll probably be friends the rest of our lives. At least I hope we will.
How are you doing, Tom?
13-year-old Tom has been brought to paediatric A&E, whilst doctors await the results of his X-ray.
But I just want to have a little look at this swelling, so I'm just going to have a little feel of it. Is that all right? How much pain are you in? What's that magic number now? Just around there. So I've got some good news for you. You haven't broken any bones in your face. And your wrist X-ray was normal as well.
Yeah.
Yeah, did someone tell you? No, you just worked it out.
It was probably.
Okay, you made your own decision that you thought it was okay, yeah? You're gonna make a doctor out of you then when you grow up? Or a professional cyclist?
I used to work full-time, I worked part-time because fairly quickly I realised that I wasn't seeing my family.
I've got a feeling he'll stay with us tonight. Thank you.
Thanks very much. It's good, isn't it? I think I've got quite close bonds with all of them for very different reasons. You have to let them kind of grow up and develop and take their own risks. Nice and warm. There's a lot on the news that makes you think our children aren't safe if they leave the front door, but I think you do have to develop the skills that allow you to get out there and understand life. So get out there, enjoy it, discover new things.
Tom will be kept in overnight, whilst doctors monitor his facial injuries for signs of any further complications.
I want to go see things that are going on. I hate not seeing shit. Stop it.
Andy and his friend Sam are awaiting the results of an X-ray of his knee after he fell and twisted it during a game of frisbee.
I have got a 26-year-old gentleman. His knee is significantly swollen. We cannot see any obvious fractures.
They're really friendly here. Like in the X-ray room, the guy was sick. He was chilling with the beats and that.
All right, my dear, I've spoken to the orthopedic doctors.
Okay.
There is a bit of fluid and blood in the joint. Okay, the problem could be there is a tiny, tiny fracture, which we can't see because of the amount of swelling you have. For now, we'll put your knee in a splint. We'll give you a couple of crutches. No more smoking, no more drinking. All right?
Okay. Thank you, by the way.
No drinking and smoking for you.
As soon as you said there's no drinking and smoking, I was like, it's the last thing I want to do. I just want to chill out and play Risk and watch Independence Day.
Andy, considering the things he's gone through, has done pretty well. He went to uni a year after me, I think when he was 19. And since then, he's always just worked, really putting in a lot of hours, and he's done very well. Yeah, I think he should probably remember that sometimes.
What were you playing, by the way?
Ultimate Frisbee. We had one of those Frisbees, which is like competition weight, so it glides perfectly through the air. It was all in the name of fun, though.
Of course.
When I was about 16, 17, I was having some issues at home.
To stand, please.
Yes.
It was Christmas Day when Andy called me. He was on his own. He really fell out with his mum. They'd had an argument.
Are you working all night tonight?
No.
Got some time off soon.
She said you could just go. And he was just walking around for hours and decided to call me. Pretty much burst into tears as soon as he spoke to me.
I recently had to quit my job through stress.
What did you do?
Recruitment.
I wouldn't have thought that stressful.
No, not compared to working here, I guess.
I remember my mum like unwrapping my presents and taking the labels off and sticking his name on and stuff. He just stayed with us for quite a while after that, maybe a year, I think.
Okay, would you like to put your shoes on, or are you going to take him on the
Sam, do you reckon you can put my shoes on for me? Yeah, go on then. Cheers, bro. Appreciate this.
I mean, it was everything, really, at the time. It brought some stability back to my life, which was important. Without him, I really don't know what I would do. He really is like one of the best things that's ever happened to me in my life.
That's it.
And go through the crutch.
Perfect.
Are you okay?
I just get used to it. I've always needed to project some love out, and it's always been so good to know that I've always got Sam to be loved by.
A few days afterwards, he posted a very nice little comment, which appeared on my Facebook page, where he told his circle of friends that when he last had a serious incident, which was his parents dying, it was me who was by his side. And he's saying it was me again when we were at St George's.
I wanted to say thank you, and I mean, I just wanted to write something that conveyed my feeling at the time and let people know what a good friend I thought he was.
It was a bit surreal because he obviously had had quite a nasty accident, and at that stage I wasn't quite sure how poorly he was and how long we were going to be in. I mean, it did shake me up. Almost as soon as he was out of hospital, he was, when can I have a new bike? And Granny very kindly said she would buy him a new bike for an early birthday present.
As soon as I got back on my bike, I fell off and I sprained my wrist, but it wasn't anything too bad. I did tell my mum about it, but I wasn't too sure what my dad would think, so I told him I just fell over at the park.
Sometimes things are on a need-to-know basis, aren't they? He might need me to keep things quiet a few more times in his life, knowing Tom.
Sometimes she's just like a mum, sometimes she can be a bit more of like a mate. Yeah, my mum's pretty cool.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week.
I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked by a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie! Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
Are you ready to face the day?
Yeah, number 3, please. Thank you.
Monday's our worst day. The bus loads are going to arrive.
Emergency nurse practitioner Craig has worked at St George's for 10 years.
I'm from Western Australia. I grew up in a gold mining town, Kalgoorlie, which is like 800 kilometres northeast of Perth. I remember my first day in London. I got off the tube at Piccadilly Circus and just stood with my mouth open like, oh my God. It was quite overwhelming.
Where are we going, to the canteen? Or...
Oh, I wish. Breakfast would be good. But I haven't looked back, and much to my mother's disgust, I think I'm partly British. To remove a nail is quite brutal.
Nice.
As a nurse practitioner, I do literally everything that the emergency care doctors would do. So just tell me if you get any discomfort whatsoever. 1 minute you're dealing with someone with a skin rash, then you stitching somebody's head up.
That looks horrible. If it was an interrogation, I would have spoken by now. So.
And that's what I like about it. It's fast, doesn't stop, and I love meeting people. You know, that's the key, I think.
Hello, St George's. Yeah, is it medical or trauma? Yeah. Do you have a pulse? Okay. Adult medical priority, 8 minutes.
A 54-year-old legal secretary is being rushed to St George's.
3 LOCs with a low blood pressure. They couldn't give me a pulse or a GCS breakdown.
She collapsed in the street on her way to work.
On the day Mary collapsed, it was actually my birthday. If it was your birthday, Mary would always want to make a fuss of you. I expected to come into work and there to be lots of balloons and banners. I then got a call to say that Mary had been taken ill on the way to work. I actually thought, no, Mary, if she doesn't have breakfast in the morning, sometimes her sugar levels can drop. I felt actually quite a bit guilty that, oh my God, it's my fault that Mary fainted because she didn't have time for breakfast because she was desperately trying to get into the office.
Information from paramedics show that her heart rate was so slow, it almost stopped.
Slip the back of this up a little bit. Is that OK? For now.
Right, Marie's 54 years old. She's had 3 temporary loss of consciousness. She had one this morning at 7:15, another one at 8:15 in the street. She fell and banged her head. Her pulse went down to 20. Her eyes went completely hypoxic. She started shaking for about 10 seconds, and she had a prominent left-sided droop on her face.
Registrar Mevan will carry out tests to find out why Mary collapsed so suddenly.
When a patient comes with a collapse, we need to establish whether it's a simple fainting or something sinister.
If you can sit up for me. Sit forward.
The main worry is whether this is actually the cardiac problem.
What were you doing?
I felt hot and I took off my cardigan, put it in my bag, and I was just getting some water.
Yeah.
And apparently I just went down.
Is that when you got this bump? Okay.
Yeah, so that was about 7:40.
Right.
Yeah.
Any other medical problem, Mary?
No.
No, nothing.
No. So
You don't
just
take any regular medication?
No.
Are you a smoker?
No.
No.
The ambulance picked up your heart rate was going very slow. It should be around sort of 70, but they picked up your heart rate 20. So very slow, yeah. The heart beats every second of every day. It should beat around 60 to 80 beats per minute. So 20 is very low.
So we'll do a chest X-ray and we'll take it from there, yeah?
Mary and I have known each other as sort of work colleagues and friends for about 19 years. We just clicked instantly. We just had an instant sort of rapport. We just kind of bounced off each other, and, you know, I knew fairly soon that we would be sort of lifelong friends.
Now, do you still feel sick, or are you OK? Oh, whose birthday is it?
Yeah, it's my friend Lindy at work.
Oh, Lindy's not going to get her balloon, is she?
Not going to get her balloon today.
Careful it doesn't float away in the back at her.
She'd already arranged a lunch for that day for myself and her and a group of girls we call the Barcelona Babes. And the reason they're called the Barcelona Babes is because we all went to Barcelona for a weekend. So I'm here and they're doing some tests and things. I'm going to let you go, Linda, because the doctor's here, yeah? Yeah. I'll talk to you later. Yeah, bye, Linda, bye. She likes to be busy. She just tries to divide herself up into so many pieces to try to help everyone and keep everybody happy. I often would say to Mary, stop running around trying to do so much. But that's just not the kind of person Mary is.
Doctors take X-rays to see what could be causing Mary's drop in heart rate.
I didn't actually realise how serious it was. I thought she would just have a few tests in the hospital and be sent home. When I found out what had actually happened, I was completely shocked. Because, you know, without her in our lives, it would be very different. Yeah, thank you.
54-year-old legal secretary Mary arrived in A&E after collapsing on her way to work. Paramedics at the scene recorded that her heartbeat was dangerously low.
Breathe in and hold your breath.
Doctors have sent her for emergency CT scans.
Mary grew up on a small farm in County Cavan, in Ireland, surrounded by greenery and rolling countryside. It's about 2 miles from the nearest village. She used to either walk or cycle down to the local shop. It really was in the middle of nowhere. Mary's from quite a big family. There's 6 of them in total. She's got 2 sisters and 3 brothers. Her mother was always a very keen baker. So being such a big family, I think it was always important to get to the table first when there was like apple tarts and cakes being baked, otherwise you might end up with nothing. When you live in the countryside, it's quite quiet. When you hear about the bright lights of London, you have aspirations to go and explore. And she packed a bag and she got on a flight and she came to London. Even though she's a long way from home, her mind is always on home. You know, she's always constantly thinking about it. Her mother is 90 now and sort of needs to be looked after quite a lot. But she can't be there all the time, and she does rely on her sisters to help out. She tries not to talk about it, I think, because sometimes if you talk about these things, then you get upset by them. But I know how much she does worry about her mother.
Mary will remain in resus while doctors assess her scans to find out what caused the sudden drop in her heart rate.
She's got a pair the same as mine, look, but shorter.
I might say, more muscles.
I can see a rainbow.
See a rainbow. Sing along with me.
See what I started.
It's dangerous.
Jessica Young.
I'll make it all right.
All right, see you in a bit.
How are you?
27-year-old Jessica has come to St George's with an open wound that won't heal.
Have a seat for me, Jessica. My name's Craig. I'm going to look after you. I'm one of the nurse practitioners. So, what's happened?
I had a lumpectomy on the 29th of May.
Okay.
Half my wound's closed up nicely, but the other half is open.
Okay. So, you noticed a lump a while ago?
End of March now.
Okay. And you know the results of the...
Stage 2.
Okay.
2 months ago, Jessica was diagnosed with breast cancer.
I've got to go back in a couple of weeks for another operation to remove some more tissue.
Okay.
And then go from there.
How are you feeling about that?
I don't want it done, but I've got to.
It's a bit scary, isn't it?
Yeah, it is really scary.
But it's important to have that done.
Yeah, yeah.
It's not a nice process for you to go through. You know, the most important thing is to listen to what someone's saying to you, and that takes a bit of time. How old's your daughter?
She's 7.
Okay, and she knows everything?
She knows that Mummy's not well, and she knows that I had an operation.
Yeah. Most patients are pretty scared about what's happening to them. Lay down, make yourself comfortable.
I have no veins, so my hands are the best ones.
You're nice and young, you should have nice veins. We'll see. Let's do this wound swab first. Is it quite sore?
Yeah, it's really painful.
But most of all, you want to make them feel safe. So that's the nice part about it.
So why is one half of the wound closed and the other half hasn't?
Sometimes that happens.
Okay. Will it eventually close up? Or?
Yeah, it will.
Yeah.
I don't know why, it just does happen.
Okay.
If you show that you are genuinely interested in that patient, it makes a massive difference. And it may be the difference that helps them survive and helps them get over their condition.
Hello there, hi. Could you get 2 portable chest X-ray to resus, please?
Mevin has been a registrar at St George's A&E for a year.
Yeah, all right. Thank you, man. Thank you. Bye. I moved from Sri Lanka about 10 years ago. education in UK. All around the world it is well recognized, so I thought this is the place I had to be. The lifestyle back in home is they're pretty laid back, relaxed. But it is absolutely fast-paced in London. The way people walk, they are living in a fast lane actually, yeah. I think we need to slow down a bit before it's too late.
By land, yeah? Okay. Adult male, trauma call, 8 minutes.
A 37-year-old IT project manager is being rushed to St George's.
Hems by land, motorcyclist versus car, opposite stable, GCS 14.
He was travelling to work on his motorbike when he collided with a car. The man's injuries are so severe that emergency doctors and paramedics were called to the scene. His colleague Jonathan was at work when he received a call about the accident.
Everyone knew who Rob was. He was a well-known person in the company. Rob would usually be at the office before 9, but that day he wasn't there. So at 9, we started wondering what has happened.
Guys, we are getting the trauma.
His wife had called to the office. She said that Rob's neighbors have seen a motorbike like his on an accident.
On slide, ready, steady, slide.
It was shocking for all of us. People were just coming downstairs asking what happened to Rob.
This is Rob. He was motorcyclist versus car. He T-boned into the side of the car, turning right onto him. He's got possible closed head injury and he's got a complex mandible fracture. He's got a left tibial fracture.
He's got 2 missing teeth at the top.
All right, guys. If you can get the scoop off, please. Yeah.
Keep your head nice and still for us. Keep your head nice and still.
Sit one.
My name's Johnny, I'm one of the bone doctors. We're just going to do a quick examination, OK? Don't shake your head, don't nod, just say yes or no. Can you tell me your name? What was your name? Robert. Robert. Can you tell me what year we're in, Robert? What year are we in now? What year is it?
Right, we'll send him across for CT, yeah.
Doctors take Robert for an urgent CT scan to assess the severity of the injuries to his face and head.
As we were doing the primary survey, we found Robert was confused, and that made me worried about whether he got associated head injuries.
So CT is ready for him.
I remember that the most worrying thing was that someone mentioned a brain injury. For the rest of the day, none of us could concentrate. I remember just wanting to hear some more news.
Like the top of your forehead has gone a bit normal colour now, but your face is still red.
Oh, it's throbbing now.
Yeah. What you've done is you've taken a slice off. I can see that.
I was going to save it and bring it with me.
Legal secretary Mary has been in A&E for 30 minutes after collapsing on her way to work. Whilst doctors await Mary's CT scans, the results from her chest X-rays have come back clear.
I'm going to speak to cardiology.
Yeah.
We need to rule out a possibility of what we call cardiac syncope, which is irregular heartbeat.
OK, yeah, thank you.
Mary would have loved to have children, but unfortunately, the opportunity never presented itself. Whether that was because she spent so much time in the office or she never met the right person.
Oh, hi, Alicia. Just me here. Say hi.
Mary is a workaholic. She's never without her phone by her side.
It's probably best that I cancel both tomorrow and most likely Thursday.
Often we're asked at short notice if we can stay late, so you were coming at 9:30 in the morning and you may not go home till 5 o'clock the following day, but Mary was always happy to do that.
I have an out of office on my voicemail, yeah? But I haven't got an out of office on my emails. It'll be fine. I'll make it fine, Anna. I'll make it totally fine. I'll make it totally fine. It'll be fine.
I used to say to her, you know, you need to slow down, Mary, you know, you're going to be absolutely exhausted, but she never did.
Yeah, I've told Mel where my notebook is, so Mel will get the notebook for you and I'll have his number in there.
I think Mary would have been a fantastic mum.
OK, thanks, Michael. Bye, bye.
She's godmother to 3 children. It's a shame, actually, that Mary was never able to have children herself, just because that's the way life turned out.
Oh, oh God.
She's gone a bit bratty now. You all right there? You all right? Guys, I just have some help. Mervyn, you just come and have a look.
Mary's heart rate has suddenly dropped to 35 beats a minute.
Give atropine. Atropine.
What, 3 or what? That's 3 milligrams.
3 milligrams, yeah.
3 milligrams.
It is very dangerous with a heart rate of around 20 to 30. They can go into a complete heart block, what we call a cardiac arrest.
Fine.
Just going to lie you flat just for a moment, just while your heart's going a wee bit slow, OK?
Early today, 54-year-old Mary collapsed with a low heart rate on her way to work.
Can you speak to me at all?
Her heart rate has dramatically dropped for a second time.
So I've given 2 meals, that will be 600 miles.
Doctors need to act quickly to stop her going into cardiac arrest.
Someone's heart rate is slow means their natural electric circuit is not working and they will not able to sustain the blood pressure they need if it is not time critically treated.
Hold up, there's a bit of oxygen just going on your face. Head forward just a little bit. That's it, just relax back, OK? Take some nice deep breaths. Just come up now.
She's just the best friend that you could ever hope for, really. When myself and my husband were going to get married, we invited only family. But I wanted Mary to be there to share that day with me, so she kept the secret with me. It was very important that Mary was at my wedding because she is my closest friend. So when I heard that she had been taken ill on the way to work, I felt a bit guilty that I wasn't there.
Hello, hi. Just now she had some atropine. It dropped to 32 sinus.
Mary's heart rate is now stable. A cardiologist has been called to assess her condition.
Was she complaining of any other physical discomfort as it happened, or did it just happen out of the blue?
It just happened, and she came round quite quickly. It was probably only 4 or 5 seconds.
Mary likes the fast pace of life in London. She is very sociable. She's always like going off to the theatre, going to the cinema, going for drinks. She would never say no to an invite to go out anywhere, and we used to get a group of people together, you know, end up maybe going in some sort of dodgy salsa club down Charing Cross Road even on a Tuesday night, you know, where margaritas are like £5 for a jug.
So what I need to do now is just make sure that I take some pictures of your heart from the front of your chest, okay?
Yeah, it's just frightening.
I know, yeah.
I've never had any issues at all, you know.
Sometimes Mary would sort of go out 3 or 4 or 5 nights in a trot. I used to say to her, I don't know how you do that. But that's just the kind of person she is. She likes to be busy. I think she would find it quite difficult to adapt. She had to stop running around.
Because this is an electrical issue, the solution also has to match that.
Right.
In the case of the kind of electrical problem that we are dealing with in your case, it's a pacemaker which is a solution for that. Okay. It's like a device, almost of this size, something like a small battery-type device.
Right.
And what we normally tend to do is, under local anesthesia, we tend to make an incision or a nick under your skin.
Right.
We tend to send specialized wires, one of which will be put into your lower chamber of the heart, and another one which gets fixed into the upper chamber of the heart.
Oh my God.
Okay? Do you have to let any of your family members know that you're here, or?
No, I don't really know.
Okay.
My family are all back in Ireland. I don't
Are
really,
they? Okay.
I really don't want to
Bother them at this stage.
strain on them.
No, sure.
Her family are always in her thoughts. We often talk about her family, and I know when she's upset. She probably doesn't like to spend too much time on her own. She just likes to be in the company of others. Mary's friends have become like a surrogate family to her.
But I obviously have no arrangement. I have no clothes for staying overnight.
Don't worry about that, because we've got pyjamas and gowns and things that you can wear, and toothbrushes and everything like that, so don't worry.
So I don't want creating any fuss any place. But do you know other people of my age who've had?
Oh, I've seen people my age have a pacemaker put in. It's less common, it's something more common in elderly people, but it's not something that doesn't happen with people your age.
Mary will be taken to a cardiac ward before surgeons carry out emergency surgery to fit her with a pacemaker.
We're just going to start off by scanning your head and your neck first, OK?
It's been 20 minutes since motorcyclist Robert arrived at St George's after a collision with a car on his way to work.
OK, that injection's starting now, 60 seconds.
He's been rushed to CT for a scan to determine the extent of his injuries.
Breathe in and hold your breath.
Basically, he was my boss. When I first saw him, I thought that he was angry, someone that wasn't that approachable, but it was only the first look. Basically, I required a visa to be in the UK. I went to Rob, then immediately he said, don't worry about that, I'm gonna get everything sorted for you. Through all the stages, he was really, really, really supportive. That was one of those moments that you think, well, this guy, he's a good friend, a good person.
Oh dear.
To be tolerant. That he's done temporal bone, and he's also got intracranial gas on the right.
Initial scans reveal Robert has a bleed on the brain.
Rob is coming from Poland. He was for his family, and they rely on him for all their life in the UK. He always was mentioning Isabella. She's the mother of his daughters, and he adores his girls. It probably would have been devastating for them.
Yeah, morphine, please, yeah. We'll give 5 to 10, yeah.
Some carboxyl.
Oh, yeah.
He's been the engine for that family. He's been the one who has put all of them where they are today.
Robert's partner Isabella and 3-year-old daughter have now arrived in A&E.
Rob, hi. Your family has come and I'm going to speak to your wife, yeah? Is that all right? Okay.
Probably 2-3 days after his accident, he was going on holidays to Poland. And he has bought everything, he has bought his tickets. He was taking his 2 daughters to Poland. And he was really looking forward to do that.
Hello there, hi. I'm the doctor looking after Rob. So he got pretty much multiple facial injuries. He broken a few bones in the jaw. He got a small bleed into his brain. You okay? Sorry. Giving bad news is a very difficult task. You have to be very empathetic and put yourself in their shoes when you're talking to the family.
Yeah, have you ever been in that position before?
Myself personally, yes, I have. When my father died when I was very young. When the news came that he died of a heart attack, it was unbearable. He was a fit man and it just happened just like that. But he definitely need to have surgeries around his facial bones. But plastic, they are going to fix him. We are giving him a clean-up and then you can come to see him later. Give us a 5-10 minutes, yeah?
Okay.
My mother had to shoulder the burden of bringing up 5 children, actually. She's done a wonderful job. How is he at the moment? How is he?
Still the same.
She realized that I am a compassionate person, and so she sort of earmarked that you're going to be the doctor from very tender age.
See, you have to continue to do it until you get these. You see them? Them lumps. Yeah. You have to get them lumps there. Yeah, and the man them say, Zaga. Wagwan. Yeah.
Ring.
It was roughly an hour, and then we might hear something, or it might be longer.
Want to do the crossword? What have you done?
I've got into a fight with a phone box.
With a what?
Phone box?
A phone box?
Yeah.
Rocky.
Okay, so these are some antibiotics for you to take.
27-year-old Jessica had a lumpectomy a month ago, but one of the wounds from the operation won't heal.
It doesn't look too bad, the wound, so that's the good thing. This is the ointment that I want you to put on.
Okay.
Caring is really important. Reassuring them in the best way you possibly can, and if you've been through stuff yourself, that helps. Did you have your tattoo done because of?
Yeah.
When did you have it done?
I had it about 3 or 4 days after I found out. No, it's something, hopefully, that I'll believe in myself. And,
absolutely.
But it's not doing anything at the moment. I'm not believing in myself.
Oh, you've got to. You have to. You've got to be strong.
I'm trying to, but it's hard.
Yeah. I ended up in intensive care in 2008 and had emergency surgery and ended up with an ileostomy, which is part of the bowel coming out of the abdomen, and a bag. Basically, they didn't think I would survive. I remember saying to my partner, can you open the curtains for the last time so I can see the sun? Because it was that serious. It was just petrifying. And have you got plenty of people around you to help you?
Yeah, I've got my mum, my dad.
So they've
got a load of friends, yeah.
Make sure you talk to them.
Yeah, I will.
You know, don't hold it all inside, because, you know, you are going through one of the hardest things that you're going to have to go through. And all that I wanted was somebody to tell me I was going to be okay. From my experience, I had a rectal nurse who, the moment she saw me on the ward, she knew straight away what my problems were. And the thing I found the hardest was, although I am a nurse and I have lots of knowledge, I was no longer a nurse, I was a patient, and I needed reassurance. And she honed in on it and she hit the nail right on the head.
I went through panic attacks.
Yeah.
I had to go on diazepam for the first couple of weeks.
Yeah.
Just to get up to the hospital.
So you've got a lot to face.
Yeah.
But just make sure you do talk to people. Don't sort of shut yourself away, and make sure you talk to your family, because it is really important.
Yeah.
To have an ileostomy has a massive impact on you. And I didn't even want to look at it. And boy, did I have some great dialogue with my colorectal nurse. You know, and I think I put her through a hard time, but, you know, she knew the right way to deal with me, and that's what got me through it. If I didn't have her, you know, it would have been very, very different. You know, you can always come back and see us.
Thanks.
You know.
Thank
Okay.
you.
All right, take it easy.
Thank you.
No problem.
Thank you.
Thanks.
Robert's CT scans are now back. His lower jaw is fractured in 2 places.
Where are both teeth?
His teeth are missing. 2 of them. Not a happy looking jaw.
Was there any mention that he was wearing helmet? Doesn't look like he is.
Apparently it was a half helmet.
Half helmet without...
There's no face guard on the helmet. So there's no damage to the helmet and there's no face guard on the helmet. So basically he went and hit the side and this is the dent in the roof is his face.
Due to the severity of his injuries, specialist doctors from 2 departments have been briefed.
The broken bones and the fragments from the bones and also the blood can clog up your airway. He can choke his own blood and cause airway compromise. Right. Can lay back.
It's been 1 hour since 37-year-old IT manager Robert arrived in A&E. He was riding his motorbike into work when he collided with a car.
Can I stand up?
No, you can't stand up. You can't stand up.
He was wearing an open-face helmet and has extensive facial fractures and a head injury.
Okay. I think it needs to be fairly quickly done because he keeps swallowing blood and been throwing up 3 times with us.
Dr. Timothy is a specialist in facial injuries.
I'm just going to have a look, okay? Can you feel me touch your forehead on the either side? Yeah? Can you feel me touch your cheek? Can you feel me touch your cheek? Can you feel me touch your jaw?
Because Rob, he adores motorbikes.
Can you feel me touch your lip? Right. So I'm just going to come in behind you, okay? Have a look.
He was always like talking about the bikes. When we were asking, why are you during the weekends, he usually told me that he was going outside to the countryside on his motorbike.
Can you open your mouth? Bite down if you can.
I always express my concerns about motorbikes, but I think that for Rob, the motorbike is like one of his arms. Yeah, it's something that he wouldn't be able to live without.
He's got obviously bleeding in the mouth because of the fracture, and he's lost a few teeth.
Okay. All right, yeah. Let us know whether he's going to the theatre or not, yeah?
Robert's partner, Isabella, is in the relatives' room. Doctors have given her the okay to visit him.
Rob, we'll get you some anti-sickness now.
It's the first time she's seen him since Robert left the house for work.
Czemu się parę dni po szpitalu, wiesz? Nie powiedzieli.
Would he end up the same person that I met before the accident? And so I don't know what would happen to those two girls and Isabella if he had like serious consequences after the accident.
Does he have any painkillers?
He's had lots of painkillers, yeah. Some morphine and things. So. You feeling sick? We just suction a tiny bit that away.
He's got a fracture of his lower jaw. He's got a few fractures of the other bones of the face.
Okay.
In most cases, the smaller fractures on the face, those normally rarely need any sort of intervention, but certainly the broken jaw
Okay.
fixed.
Okay.
Specialist Dr. Timothy will now wire Robert's jaw ahead of surgery.
Before his accident, he wants to take his girls out to Poland. He has a plan for them. He bought a piece of land there, and he wanted to build a house. And I remember that I was sad because he was going on and about what he was going to do for that house.
Sorry, I keep touching your top tooth, Robert. I'm sorry about that.
You don't want to think about it, but it crosses your mind that he wasn't going to be able to join us again.
Hi.
I think that's how life-changing that could have been. What can you do? Just sit and wait for the best.
Robert will now be taken to intensive care until plastic surgeons attempt to rebuild his jaw and face.
When I had my collapse, it not only shocked me, but it actually shocked all my friends. When I was told that I was to have a pacemaker fitted, my world just fell apart. My friends call me Blammy O'Reilly.
It's a fun nickname, and I guess I get the name because I'm a fun-loving person. I love life, I love partying, I love socialising, and I love just having fun. My experience has told me to appreciate life. I've been given a second chance at life. I realised I need to slow down a little now and take life in the slower lane rather than in the faster lane.
I was discovering bit by bit what happened. When I looked properly at the mirror in my bathroom, I was like, oh, bloody hell, it's not great. I just want to take it easy, I want to get better. My priority is my family, and I want to make sure that I'm here for them. There are good and bad days, but I think my girls, that's what really matters to me.
How long have you had this ring for?
4 years.
40 years.
They're going to cut the ring off here.
Doing really well, really well. Paediatric priority call.
He stepped out in front of the car and was subsequently rolled underneath the car, getting caught underneath the front axle.
He wasn't flailing around, he was actually very still.
And your dad, do you want to pop in?
I just felt so helpless.
He rolled onto the car and he's got a significant head injury.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week.
I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before. We are there when awful things happen to pick up the pieces.
We have a 2-year-old who was kicked by the horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie! Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
A&E.
Wonder what today will bring.
Yeah, I'm just waiting to be called in.
You don't cry, do you?
No.
You're very brave, aren't you?
I just want a bit of affection.
Yeah.
Don't we all?
Yeah, who's up for it then?
Cuddle.
Yeah.
Anyone likes a cuddle, don't they?
Yay!
Oh, who is it now? Stop ringing us. We're busy.
Welcome. We should make a welcome banner.
Dr. Arash has just started an 8-hour shift in Resus.
Oh, hemothorax. I was told it was a pneumothorax.
No, hemo.
As orthopaedic registrar, he's responsible for any bone injuries arriving in A&E.
When I was younger, I used to take apart and rebuild, repair computers. I taught myself some programming and wrote some websites. So all humans were assumed to have ox anatomy for about 300 years. And then they started doing human anatomy.
Proper anatomy.
Obviously went on my CV because that's not a normal thing for a 13-year-old. Had a job before medical school working for a large IT multinational. I worked on bids for government projects, satellites. For me, there wasn't a reward. You're definitely not the worst one I've seen today, don't worry. But every day here, you know, when you do one little thing, it makes all the hard days worthwhile, all the nights. Don't worry. I've got all the right phone numbers, I'll get you fixed. You see someone the next day and they feel a lot better. There's a different reward, and I think just that's what makes me tick. Every time that red phone goes, your heart starts to race. You know that you're dealing with something serious.
St. George's Emergency Department. Okay, go for it. Is that trauma transfer? Fell out of a tree, yeah. 10 minutes out. What's the name? Yeah, thank you. Bye. Adult male trauma call, ETA 10 minutes.
A 48-year-old man is on his way to St. George's after falling from a tree whilst cutting branches.
Sorry, I've just got one call coming in and one here. Can you call back in like 20 minutes?
His neighbours called 999 and paramedics treated him at the scene of the accident before rushing him to a local hospital.
Is this man with bilateral ankles, one of them open, one of them neurasically not intact?
His injuries are so severe that doctors have sent his x-rays ahead whilst he's been transferred to St. George's for specialist emergency treatment.
Let's have a look at this x-rays. Oh my God, Jesus Christ.
We need to get more x-rays done.
Why has he got two fibulas? It's like one fibula here and one fibula here. Where are the pieces? That one's flipped around too. Falling from a tree is a substantial height normally. How did they land? Did they land on their neck? Did they land on their back? Did they land on their feet? Because that affects the injuries they're going to have and what you need to do.
Andy's 48. He was up a ladder today cutting some trees outside his house and he's fallen off. He landed straight onto his feet. The pain's been a 10 out of 10, so we've kept him on and kept him in en route.
The hospital transfer notes reveal Andy has 2 fractured ankles.
We have scoops, don't we?
Yeah, things because we don't know what's going on with the spine.
But doctors are more concerned that the breaks may have caused life-changing damage to critical nerves and blood vessels in his feet and legs.
Steady. That's 30 degrees, 30 degrees.
I can't forget that day at all because he came in so happy in the morning.
Okay, let's put it back. We should be able to look at.
Andy had come round to bring us a wedding anniversary card.
Okay, so this is the worst part.
Then he went off and said, I'll see you later. And I did see him later, but not in the circumstances I would have liked.
All right, I'm Mr. Farrell, orthopaedic registrar. I'm going to check you over top to toe.
A neighbour came and they shouted, Andy's had an accident, he wants you to go and see him. I can't run that fast, but I did move. I did look up at the tree and think that was far too high to go up.
I've seen your ankle x-rays, they're very broken. We'll talk about that later. Can you feel me touching your big toe?
Which toe?
The right side?
No.
Okay, and underneath here?
No, I can't feel anything there.
Okay, can you feel me pinching the other big toe?
No.
Can't feel it on the right?
No.
And is that normal for you, or is that new?
I don't think it's normal.
You've not noticed that before? OK. Numbness around an injured limb always kind of rings alarm bells when you think about where that's come from. Has that come from an injury to the nerves near where they've injured, or has it come from higher up? Can you bring your toes up towards you, both sides?
Which side?
Have they got injury to the spine or the brain that's making that area lose its sensation?
Definitely feels different, definitely got neurological.
Having lost sensation in his feet, doctors need to scan Andy immediately to see if he's sustained permanent damage to his legs and spine.
Paramedics said to please move away, and Andy said no.
So CT's ready for him.
Oh, my God.
I think he thinks I'm his surrogate mum. I saw him crying in pain, but I felt helpless. And yeah, so it's something I'll never forget.
We'll be scanning from your chest all the way down to your feet.
It's been 20 minutes since 48-year-old train driver Andy arrived in Resus after falling 12 feet from a tree.
Okay, that injection starting now, 60 seconds.
He lives alone, and one of the first people to arrive on the scene was his neighbour, Jean.
And hold your breath. Did he land on his
feet? Like a dunk. Wow. You should have somebody to go with you to the hospital. Unfortunately, I couldn't go with him. I couldn't leave my husband here. He's got Alzheimer's and he's happier in his own home.
Oh, dear. Oh, God.
I don't quite know how long he's lived at the top of the road. It must be 6 or 7 years. I always felt a connection with him. Both my boys live away, and he sort of really took what they should have been doing for me. When my car service and MOT was due, he'd follow me in his car and then bring me home and then take me back to pick the car up. Neither of us good at opening bleach bottles, and I'd leave them on the top and he'd just open them and just leave it so that all I've got to do is turn it.
We are done, yeah.
Done? When my husband spoke to Andy, Andy was so patient with him because he would say something to him 3 or 4 times exactly the same, and Andy would just answer him as if he'd said it the first time. So, you know, he understood. That's the sort of person he was.
I feel terrible.
I'm not surprised.
I think Andy liked to help people because it made him feel wanted.
I was helping my neighbours.
Yeah.
Cutting branches off for trees that are affecting the phone lines and the gutters. As soon as I landed, I knew I'd broken both my ankles.
He has never had anyone to confide in or sort of make a fuss of him.
I used to be an ambulance technician with St John, so I just knew, yeah. Thank you.
He lost his parents quite young. He lost his father at 16 and his mother at 13. He lost all that security from when he was a teenager that most people have at home. Because he often says, you know, your boys are so lucky that they've still got you.
A&E.
Maybe I'll go get you a
salad.
Tuna noir.
Did I hear you say you were married?
Yeah. I've been married twice before.
A bit busy.
Well, I'm 80 now, so...
You're not? Are you really?
Yeah.
Lovely. It's amazing, isn't it?
So musicians don't get old, you know? They just stay forever.
So what I don't understand is all that cosmetic shit they advertise, yeah? There's no cream that will reduce your age. It's impossible. Don't call it an age reduction cream. It's false advertising.
Music keeps you young, you know. Take music out of the equation, what will we have?
It would be boring life, wouldn't
Nothing.
it?
So music is life, like water.
Are you trying to hurt me?
Yeah.
Should we put Nanny's keys back, because you'll end up losing them?
3-year-old Shane has come to A&E with his sister Millie and grandmother Marion after hurting his leg during a visit to her house.
Are you feeling better? No. I hurt my job.
Shane comes to visit on a Friday, and he was out in the garden playing with his other cousins. They decided to get on the trampoline, and Shane's jumped off. I heard a crack, so I went out there to him. His cousins, they're saying, he's OK, look, if he broke his leg, he'd be crying.
Oh, he's faking.
You think he's faking it? You better not be faking it.
Yeah.
But you know, if you love someone, you can tell from their face that something's not right. So I said, oh, I'm going to take him to the hospital.
Has he tried walking on it at all?
No, he doesn't want to.
Have you tried? You want to try walking with me?
No.
I felt guilty because it was while I was looking after him that he done it.
He's the next one to be seen.
Oh. Danielle. Got 12 grandchildren and 1 on the way. You can tell when it's getting mad because all the adults all start leaving. And bye, Mum. See you tomorrow, Mum. We can't touch things.
Look. Why? This is a bit
Don't open it, Millie, because it's got germs in it.
Can I do that?
When he's a dinosaur and he's got his hands and he's like that and doing them noises, it can get on your nerves a little bit. You're lifting your leg up all right, Shane.
It hurt me.
It hurt you?
No.
It's not. I hope you ain't making me come here for nothing.
And she's how old? 59.
So your blood pressure has dropped down a little bit, so we'll just keep an eye on that.
What were you planning to do today?
Well, this all happened when we were having a barbecue yesterday.
Oh,
so,
really?
Yeah.
59-year-old Angela has come to A&E with her husband Anthony after feeling unwell at home.
We was in bed and she said, my heart's going fast. She had a heartbeat normally for her was about 45, and I think it went up to about 150 odd.
So you had some palpitations that started last night?
It started with a rapid heartbeat.
Can I have a quick listen to your heart? Quick look at your hands.
And I said, you want me to take you to hospital? And she said, no, it's all right.
Can you sit forward?
Yeah.
That's great.
If she was anxious inside, she really didn't show it. It was still the same in the morning. It wasn't slowing down and it wasn't going to slow down. And I said, I better take you to hospital. We just got dressed, packed a quick bag, just drove.
Angela has a history of heart disease and was brought straight to Resus after the triage team took a heart reading of over 150 beats per minute.
And you've been quite compliant with you've been taking medications every day?
Yeah.
Cardiologist Dr. Aaron has been called to A&E to assess her.
I definitely really enjoy cardiology, and I've had like a reasonable amount of experience in it. You know, when your heart goes wrong, it goes wrong quickly, and it can quickly offset all your other systems as well. I think I enjoy the pressure, which sounds a bit weird, but it's quite nice.
How are you feeling at the moment?
Tired.
I think the tiredness is the fact that your heart's just been pumping along like for 12 hours.
We're not designed to have a heart rate of 150. Anything over 70 is too quick. So a heart rate of 150 is incredibly fast. That's when you get the risk of strokes. So people could fire off clots to their brain, and that can be permanently disabling.
Do you know anything about the LMNA gene?
Yes.
That's what I've got.
Okay.
I passed it on to my son. He's now got a defibrillator fitted.
Yes.
So my other son's waiting to be tested. They've got me to thank.
Some people could be dying in bed with a cold, you know, and they'd play on it, whereas she'll just get on with life. And just naturally that way inclined.
Blow into this and try and push the plunger all the way out.
Doctors must first try and reset Angela's pulse by increasing the pressure in her chest and naturally reducing the amount of blood entering her heart.
So I want you to try and push it all the way to the end.
First saw her, she was about 16, I was 19, I think. My sister bought a hairdressing shop from Angie's mother in Brixton Hill.
Keep going as hard as you can. Good. See if you can get it all the way to the end.
I pulled my sister aside and I said, "Who's that girl that's working with you?" And she said, "No, her name's Angie. But keep your hands off, she's getting engaged next week." I said, "Oh, fair enough, trust my luck."
That's all right, and just relax.
Then she got married. I got married at the age of 23. I was married 10 years.
It hasn't worked. But sometimes it does.
I had 2 girls, she had 2 boys. A period of years had passed. My marriage had broken up. Eventually I bumped into Angie again in the car park basement in Tesco's. She hadn't changed, she was still as beautiful as ever. I said, "How you doing? How's Terry doing?" And she said, "Oh, we've been divorced for a few years now." And I said, "Oh." Within a few months, we was going out.
That was not big enough.
She's my soulmate, yeah.
It's impossible.
We've been together ever since.
Doctors' attempts to bring down Angela's heart rate haven't been successful. They'll now need to try a powerful drug if they're to bring it down to a healthy rate immediately. It's been 25 minutes since 48-year-old Andy arrived in Resus.
Probably lose my job because of this.
What's your job?
I'm a train driver. I don't have any family, so...
It was just the driving of the trains, I think, that he loved most. And the speed he could go and trying to always to get from A to B on time. It was his life, to be honest. I really think his job was his life.
Hello, you're leaving the orthopaedic registrar on call. Yeah. OK, so I'm in the middle of A&E resus with open fractures that have got compartment syndrome. I definitely won't be leaving here for about 3 hours.
Doctors have received the initial results of Andy's CT scan, but still don't know if his injuries are life-changing.
Yeah. AM.
Their immediate concern is the tissue around the fractured ankles, which has now started to swell.
Just been looking at your images. Obviously, you know already.
Come through already.
Yeah.
Oh, good.
You noticed that you've got numbness on both sides when I was Because sometimes I'm saying, can you feel this? And you didn't know I was even touching you.
Yes.
Some of it is the nerves are bruised.
Yes.
Somewhere they've been banged.
Yes.
There's a possible that it's more than just a bruising and that you've actually injured the nerve. With all injuries, what you worry about is not being able to reverse what's happened. You know, you always want to try and get someone back to who they were, and you never want to say that you can't. So they'll definitely need an operation. It's because all the tissue in there is being starved of nutrient and oxygen because of all the pressure.
Yes.
So the only thing to do is to release the pressure. And the way we do that, big cuts down the side of the legs, probably 2 on each side, 1 other side of the shin normally, but enough to basically release all those pressure areas.
Yeah.
In the worst case scenarios, if not treated, then all of the muscle dies and you could end up having to amputate. Whatever we do to you, you're going to be here quite a few days.
Yeah. A week or so.
Oh, at least. All right, Andrew, see you in a bit. Perfect. I'm going to try and get him up to theatre.
I was worried that he would never be able to walk again. And that, to a young man, is a terrible thing.
I find scrubs quite sexy, but they're obviously so minging.
What do you mean?
No, the scrubs.
They can be awesome, but...
Yeah, they look sexy, but like, imagine all the shit that they've been.
Well, they get cleaned every day. Like, some serious clean as well.
Can my lady come with me? Yes?
Of course.
Okay. Just where I want to be.
Who said you got? She said sit on the bed. She never told you to lie down on the bed.
She did?
No, she said sit on the bed. And I sit on the chair.
Well, I'm sitting on the bed, OK?
All right, hello, sir.
Oh, yeah?
Hi. So the GP gave me a call. They said you're having a lot of problems with your ear.
Yeah.
Good. Let me just have a look. So, it just looks like it's not full blown, but just a few spots.
Oh, cool.
The rest of the ear looks pristine. The eardrum
That's
is
good.
intact. There's no infection.
So, no medication?
I don't think you need to.
Holy fucking yes.
You've done well, so all the best,
Thanks
okay?
very much. A man's a monkey with one in his face. Take one in, dear, but take one in, dear friend.
"59-year-old Angela's heart rate has now been running at 150 beats per minute for over 8 hours.
There'll be a few of us in here,
Right.
and they'll give the injection.
And what is it doing?
So it will slow down your heart rate. The sensation is a bit horrible, and that can make you feel a bit rubbish.
Okay.
It's not very pleasant at all, but it's not painful as such. It's just it's a weird sensation.
Okay.
Okay.
Doctors must now give her an intravenous drug to try and bring it down to a reading of 70 or under.
What would we do without modern medicine, eh?
She's a bubbly person, gets on with anyone. I'm more the silent type.
Yeah, you know what that's from, don't you?
Some people would say it was a boring marriage, but you don't need aggravation in your life, especially at our age.
You all right? You feeling all right?
Didn't come without its problems because her boys were adolescents, so it was hard work with the boys. But we're two parts of a jigsaw that fit together, and as far as I know, we're happy.
Right. Here we go.
Here we go.
Yes. Gonna get some adenosine. Okay.
Already, yeah.
Right.
She doesn't really need my support, or gives me that impression. She's quite a strong, independent woman, a bit like my mum.
So I'm gonna give it very slowly.
Okay.
Life is precious. My mum, she'd been admitted in the hospital. Following day, she had a major stroke, and then she lost speech.
How did you feel?
Yeah, I felt like an ache in my heart muscle.
You've got a very resistant heart, it turns out.
It's not very well, I know that.
My mum, she was bedridden when she got released from hospital, so I was there to keep her company, to keep my blind stepfather company, because he couldn't look after my mother.
So the first one hasn't worked, is that right?
No, so we're going to give a bigger dose now.
Doom and gloom. With a headache to match.
I was next to my mum. I just said, I'm going to nip to the bathroom. I'll be 2 minutes. And as I'm walking out the door, she did the sign of the cross. And I thought, why are you doing that? You must be saying a prayer. Anyway, I came back 2 minutes later, and she'd passed, so she must have known she was going.
OK, we're going to go again. OK, yep, it's coming now.
But it's a different kettle of fish with Ange. I've still got to think positive in that way.
I felt that then. Did you see anything on there?
Yeah, it pauses a little bit. It's trying its best to work, but it doesn't look like it's worked. Sorry.
Whilst Angela's heart rate remains at this level, she's at risk of stroke and other complications.
After a few hours of trying all the different medications, I realised that everything wasn't working. I was worried.
With 2 failed attempts, doctors must now try the final resort of shocking her heart.
There we go. Do love a Kit Kat.
Oh, man.
Ah, perfect.
Standard.
See you in a bit.
They drive you crazy, drive you insane.
What's all the harassment about today, anyway?
Listen, we like harassing you.
Tell me about your personal life, then. Have you got kids?
My life isn't interesting.
Everyone's life is interesting, you know? You can never say.
Not everyone's.
Nan! What? Nan? Sit still, Shane. No, don't, or she'll end up hurting your other leg.
I'll tell you when someone's coming. Lay down.
3-year-old Shane is waiting for doctors to assess his foot and leg after falling off a trampoline at his grandma Marion's house.
Shane wasn't due till the beginning of January. Don't you fall asleep? Would have been Christmas Eve. I got a call from Alicia, Shane's mum, and she'd been getting pains through the day.
No! No,
Millie, don't put your feet up there.
Lay down.
She left it till 12 o'clock at night to say that she's in agony. Can you come over? She was only up the road. All right, all right, all right, all right, all right. Having a big family and everyone comes for Christmas dinner. I was in the middle of doing the potatoes. Didn't tell my husband. I just thought, oh my God, I better get over there to her because this baby's not going to be waiting around. She can move that one about. So we had to get the shower curtain, put it on the floor and just put her on the floor. And I ended up delivering Shane. So I was like the nurse for the... So I delivered him and brought him into the world. And he's our baby Jesus. Yeah.
Hello there. Is this Shane?
This is Shane, yes.
Hello. I'm John. I'm one of the doctors here in A&E, and this is Tom, one of the medical students. Can I have a look? Is that all right? I'm going to press. You tell me if it hurts.
Is it hurting, Shane?
Can I see if you can walk on it? No? Let's give it a try, and if you can't, we'll do some x-rays and give you some pain relief. If you walk towards me, so he's limping on it. Okay, fine. It looks like he's probably sprained it, so we'll just get an X-ray, rule out if there's any break there. This is Mr. Trumpeter, who's the consultant who's in charge.
Hello, thank you.
Luckily for you.
What I'd like to do is I think we ought to get you up to the operating theatre.
Okay.
We might need to unzip your legs in the calf area or on the inside and the outside of the leg. It sounds barbaric, but it will give you the relief from the pain.
Yeah.
48-year-old freight train driver Andy is being taken for an emergency operation. Surgeons will cut the skin on his calves to relieve the dangerous swelling that puts him at risk of losing all function in his legs.
He never asked for anything from us except, really, our friendship. He used to like coming in because I used to make homemade cakes. I said, I haven't got any cakes today. Oh, well, you better make some tomorrow then.
We're going to do bilateral external fixators of his lower limb injuries, a debridement of his open injury on the left side.
He used to knock the back door. I say to him, I don't want to keep getting up or shouting out, come in, just come in.
I don't understand that piece of bone. This is a disaster, this ankle. Half his talus, half his distal tibia is down the side of his calcaneum.
He said once that he wished he'd had parents like us.
So, down at the ankle bone on this side, please.
I kept saying to him, you're our third son. And I've always said that about him, because of the things he's done for me.
Oh, this is so wobbly, he might need an additional pin.
I just worry what his future's going to be. Perhaps I took him for granted, because he was always there.
Andy will be taken to an orthopaedic ward where doctors will monitor him to assess whether or not the operation has been successful.
You're back.
How are you feeling yourself?
Just tired.
Your blood pressure's a little bit low, but that's because we've given you quite a lot of medication. Have you ever had a cardioversion before?
No.
Okay, fine. So you've had a lot of new experiences today. So we're going to give you a bit of sedation and shock you. And then we'll start with a kind of low voltage, and you'll feel a shock. but they're going to sedate you before. So we won't.
So I'll be awake.
You'll be awake, but you'll be sleepy.
After unsuccessfully attempting to regulate her heart with medication, Dr. Aaron has decided to try and bring down Angela's pulse by electrically shocking her heart.
If it doesn't work, then we'll go up a voltage, and we'll do it again, and we'll probably do it up to 3 times. Yep. Happy with that?
Yeah. Will I jump off the bed like they do on TV?
No. There won't be. No, none of that. Right, so we'll get ready and we'll come back.
All right.
If you get it wrong and you do it on the wrong part of the heart rhythm, you could put them straight into a life-threatening heart condition. It is more dangerous than just simply giving medications.
You'll be all right because it'll straighten your hair for free.
Ha 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 ha.
I've been brought up, the situation is boys don't cry or men don't cry. Very hard to let yourself go. You try not to be affected to that point. My eyes fill out, but they don't. And then I get on top of the situation.
If you go to the... But you're not connected, are you? Pads are not connected now. Okay, fine. So you select your energy. So you're going to go down to 70.
70. Is it in joule?
What we might do, depending on what the doctor's about, we might just get you to wait in the waiting room. Shall I, if I show you where it is now, I'll make you a cup of tea as well.
I'll come back, but if not, then...
Yeah. It's in a minute.
So I'm just going to give you some oxygen now.
Angela will be sedated before the charges apply to her heart, which doctors hope will temporarily stop and then reset her heartbeat.
You want to select the energy?
Yeah, so we're going to start at 70, aren't we?
So that's your energy there.
You have to sedate them too heavily and their airway may be compromised. If the oxygen's still attached, you can cause a fire. You can, it's a dangerous thing to do. So if you're on the defibrillator, you've got the responsibility of making sure that the patient's safe and your team are safe.
Charging. Everyone clear. Okay, oxygen away. Shocking now.
It's been 23 seconds since 59-year-old Angela was given an electric shock in an attempt to reset her dangerously high heart rate. If it doesn't immediately start to fall to a rate of 70, doctors will need to shock her again.
We got what we want.
God, I kind of wish we'd done this 4 hours ago.
Thank you, everyone.
We've just got to get on the best we can. If I disappeared out of her life, pop my clogs or whatever, we just got to get on.
Hello, you're waking up, okay?
It's
Everything's
all done.
gone, and it's come out well, okay?
It's all done.
Okay.
You all right?
Life is short. You've got to make the most of life while you have it. We don't know when it's going to be taken away.
All done. All sorted. Your husband's just in the waiting room. We'll give you another 5 minutes or so just to completely come around from the anaesthetic. Job done. Job done.
You love for your children, love for your wife, love for fellow men. If you don't feel compassion towards people, then, you've got no hope, really.
Say 8 p.m. Sunday to chest pain. Upstairs as well.
Angela will be taken to the coronary care unit, where doctors will monitor her heart.
Hello? He's had an X-ray. I'm waiting for them to come back from the results, but he's walking on it now. Yeah, OK then. Right then, bye.
Hey. So, the X-ray has shown he has got a little bit of a break.
I knew I knew he had done something to it.
It's very small, but we will need to put him in a cast.
OK. Yeah, I love being a nanny. It's nice.
I want to cuddle you, Nana.
You get a lot of cuddles. You do get a lot of cuddles. But Shane's special. Are you kissing my hands? He was named after his uncle, Shane, my eldest son. Now what you doing? He was 36. He was on the roof and he fell. He landed on a hard surface. The force, when he hit the floor, ruptured his aorta and he bled from within.
Yeah?
What do you, mate? Lenny? I just run. I just run. I was just running to be with him. I did get there with him, but he kept dying and then coming back. They kept losing his heartbeat and then bringing it back, but he died there on the scene. Hello.
Are you falling asleep there?
Alicia conceived Shane around the same week as my son passed away.
That's it, ready to go.
And then when she named him Shane, it just made it that little bit more special. Baby Shane, it's not actually took the place of Shane, but it's getting better for me. He gave me back the part that I was missing in my art, if you know what I mean. There's kind of a part that's missing, and he put it back. He just filled that gap there a little bit.
Okay.
You look after him, yeah? You look after your brother, will you? He's hurt his leg.
God, that's just added more weight to me, that cast. Come. On Mondays, your mum's got to come back with him. I can't even remember where I've parked the car. And I've got to do the machine, the paying machine. Can you hold that, Millie?
It's definitely my rock. They're thick and thin. Darby and Joan. Sometimes I say we're like Darby and Joan. When we first met that day in the hairdressing shop, that was an opportunity missed. Now we're making up for lost time.
There should be a few good years left in her yet. I won't trade her in for a new model yet.
Andy was sitting in his wheelchair and he goes, "Oh, here comes my surrogate mum." And then I got the biggest hug imaginable. He suddenly realised, you know, what the connection is we've got.
Do you love him?
Yes. It'll make me cry.
It's been very difficult trying to cope with the injuries. And it's been quite tough trying to walk. You know, I've obviously trying to start walking again. I'm on the Zimmer frame, doing 10 minutes 3 times a day at the minute, but it's very, very difficult. It's great to be able to walk again. I'm progressing a little tiny bit every day. You know, that's good. One of my goals was to be able to walk to Jean's and have tea. She's really important to me. She's like my surrogate mother. There's not many things that I could ask Jean she wouldn't do. You know, she's always there for me if I need her.
I said to him today, "Andy, what's going to happen next year when my car's due for a service and MOT?" "Oh," he said, "I'll be up and about by then." See?
You're going to have a chest X-ray.
Execution squad, by the look of it.
Hello, St George's. Cyclist versus a car.
On my count, ready, set, lift.
I felt dread. It was really frightening that I couldn't get hold of him.
For a bicycle to make that big a dent in a car, that's quite an impact.
If somebody's got a nasty fracture to one of the bones in their back, it can be really serious. I mean, it could mean the difference between someone walking again and somebody not walking again.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response. You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week.
I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before. We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked like a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie! Down below. Too slow.
love
Such a good boy.
So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
What's your name? Ben.
Ben.
Ben. All right,
Benjamin,
Ben.
if you're
Benjamin.
Do you know what I fancy? I fancy you.
What time do you finish then?
Sorry?
What time do you finish?
Oh, midnight.
Oh.
Just begun. And you?
Oh, 7:30 we go home.
Oh,
we start.
really?
We do 7 to 7:30. They want to know if he's married now.
Are you married? No, I'm not married.
No.
Julia and Jane?
Take care. See you soon. Bye.
Overseeing Resus today is consultant Neil.
I relish that feeling of going from being calm to utter madness. Okay. In here, guys. That kind of adrenaline rush. That's one of the reasons I chose to work in emergency medicine. Okay, guys, this is the handover. I don't see it as a stress. I see it as a perk.
Okay, so where's you going to put that one?
I can go in 5.
In 4?
4, sorry, yeah.
And then the COPD?
Sometimes you don't get your break, because sometimes it is that busy. You do sacrifice a lot to do the job, particularly time with your family, my partner, parents, daughter. But actually, the greater good is that you're helping people that need your skills and expertise.
St George's A&E. Yeah. Sorry, say that again? Okay.
Peds priority, 10-year-old playing football, twisted her ankle, query fractured femur.
Paediatric priority call, 15 minutes.
A 10-year-old playing football twisted her leg and they think she's got a fractured femur.
That would be one hell of a twist.
A 10-year-old girl is being rushed to St George's after an accident playing football. After twisting her leg during a tackle, Paramedics are concerned that the impact may have broken her femur.
The femur is the bone in your thigh. It's quite a big, thick bone. So in order to break it, you've got to have some force.
Sorry, yeah, there's a trauma coming in.
You can lose a reasonable amount of blood from the break in the bone. And the patients are usually in excruciating pain.
The girl's mother travelled with her in the ambulance.
I was in the kitchen with my mum, and she went outside to play, and about 5 minutes later, a little boy knocked on the door. I could hear the screams from inside the house, and the neighbours said as well that they could just hear this screaming. I panicked and just called the ambulance straight away. As I walked towards her, I could just see, like, the leg just looked completely deformed, and it was in a really unusual position as well.
This is Ashley. She's 10 years old. Playing football this evening, went to kick the ball, fell over the ball, but as she landed, her left leg basically twisted awkwardly. Had instant pain, left upper leg, femur area. There was significant deformity to the femur.
Okay.
It was good, you know, sort of 10 centimetres shorter when we moved her. She's had 3 milligrams of IM morphine, 1 gram of oral paracetamol.
Okay. Sorry, Ashley. You know, when you break a bone, it can break into several bits, and it can injure the surrounding tissues, the muscles, the nerves, blood vessels, and it can start to cause problems. You'll be fine, all right? But if you feel uncomfortable at all, tell us now.
Doctors need to X-ray Ashley immediately to assess the extent of the damage to the bone and surrounding tissue.
You automatically think, are they going to need an operation? Will the bone heal properly? How is it going to affect them when they're older? You automatically think the worst.
Ten-year-old Ashley arrived at St George's after injuring her leg playing football. She's been brought to X-ray to find out whether or not she's broken a bone.
My heart just broke for her because I just thought that she must have been in so much pain. I think it's just, that's part of being a mum. Since she was born, she's always been very clumsy. I've always tried to wrap her in bubble wrap, but it hasn't helped. When she was really young, she managed to open the stair gate and she fell down the stairs. She climbed out of the high chair and cut her head open and it had to be glued. She wants everybody to be happy and play together. I had Dolly quite young. Her dad, he was a couple of years older than me. We were all at school together, but he was in my sister's year. And then just, then used to hang around with each other and it just happened from there, really. It was just before I was 18, I had her. So it was all, I think it was quite difficult for everybody, really, at that age. The day that she was born, it just changed everything. Everybody was just so happy. My mum walked in and she just thought she was absolutely beautiful, and she just looked at her and said, "Oh, she's a little dolly." And that's all she's known as now.
I can wait on my own. I've got my iPad.
I know you do, but
play Scrabble.
Your first day, having just arrived, I'm not going to leave you on your own.
Watch that. This one.
No, just
Do this one.
If you're happy and you know it's happy, If you're happy and you know, clap your hands. If you're happy and you know that you will always stories. If you're happy and you know, clap your hands.
Well done.
3-year-old Lola suffers from febrile convulsions, a condition that causes her to fit intermittently. She's come to A&E with her dad Quinn after having a seizure earlier today.
We're going to put the wood in the fire, okay?
Oh, brilliant. I love this game.
I was in my early 30s when I became a dad, when Lola arrived. I went from 0 to 3 kids in the short span of 14 months. We were keen to find out as soon as we could, both of us really, so that we could start planning and, you know, painting rooms and buying the right colour clothes. So yeah, we did find out at 20 weeks, at the 20-week scan.
Since we're in the hospital, let's play with this one, because it's all about hospitals.
The sort of traditional South African man is this firstborn son thing that some guys carry with them. I had none of that. I was absolutely delighted when I found out it was going to be a girl. She's full of energy. You know, the only time she ever really hurts her brothers is from over-affection.
Do you know any songs about bees?
Lola and I enjoy a good dance or a good sing-song together. Sometimes I'll pull the guitar out and we'll make up songs.
Do you know any songs about butterflies?
Fly, 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 la, ba, la, fly.
She's a great little songwriter, actually.
Are you feeling tired? I'm feeling tired. I think I want to have a little sleep.
Come sleep with me. Sleep with me.
Parenthood isn't what I imagined it would be.
Thank you, Lola.
I guess the reality is more of a challenge, but it's a glorious challenge. It's the systematic sort of handing over of yourself and your own priorities and putting someone else right in the center of your life.
Oh, Lola, that's great. That's fantastic.
But in every possible way, it's much better than what I imagined.
Oh, Lola, this is really special.
Hello, A&E, can I help?
Blew into my eyeball.
No.
Huh? Yeah. Oh.
You touch your ear.
I did touch my ear.
Okay, Clarence?
That's me.
Yeah, would you like to come with me? Do you want me to carry that for you? Would that be
Yes, please, if you would.
Oh,
so I had to
okay.
Retired nurse Clarine has come to A&E with pain in her right foot. 2 months ago, she had surgery to remove a bunion in the same place.
Follow me.
Hello. Hello, my dear.
How are you? Mrs.
Reasonably fine, thank you.
Miss, OK. My name's Craig. I'm one of the nurse practitioners. I'm going to look after you. And this is Beth Ann, who's one of the student nurses who's sitting in with me.
Nice to have you.
Yeah, good.
Is this your practical experience, or you have to go back to college?
This is my final placement now, so I qualify in the summer.
Oh, good for you. I'd never forget, in my time, you couldn't wear wedding rings. You had to strap it over your around your neck.
Oh, really?
And that engagement ring that I had on a chain around my neck, went to the toilet one day, and as I stood up, I thought it was sitting right on the crotch of my panty.
Oh.
The chain came undone. Honest.
You nearly lost it.
Yeah, I did.
Oh. So what's happened?
I had surgery on that right bunion.
Right. When did this happen?
On the 27th of April.
OK.
And the big toe is very, very uncomfortable at the moment.
Is it?
Mm-hmm.
Shall we take this off, then?
Yes, please.
All right, let me just go and get the saw. I won't be a second.
I had a pair of clippers at home, but they were basically for taking off Bandages?
Yeah.
If they're a little bit bigger, it would have been off at home, I tell you.
Oh, you weren't joking?
No, I'm not joking.
It was...
My saw. Now, you know that this thing doesn't cut skin.
Doesn't it?
No, no, no.
Why not?
So, although it's a saw, well, we don't want it cutting your skin.
That's a clever one, then.
It makes a noise, but if I hold it on my skin, it won't cut. Okay. Is it tickling? Sorry. You know it's going to smell a bit.
Is it?
Yeah.
What of? Dead skin?
You'll have to put a bit of fragrance in it.
Nearly dead.
Dead?
Because it hasn't moved for quite so long, you know what I mean? It doesn't feel as if it belongs to me.
Oh, really?
It's not part of my body.
Okay. Love you.
Yeah, just because there's no neck, you know.
So clumsy, Dolly. It's horrible. It was literally sticking out. I was like, oh my God, I'm going to lose my leg.
Doctors have received the results of 10-year-old Ashley's X-ray. She's been joined at St George's by her cousin and grandparents.
They said that it's measuring like 10 centimetres shorter than the other one now. But that's what the paramedic said, yeah.
Because of the break.
Brilliant. Yes, please, yeah, thank you. Look at it, Mum.
Have another look. Glasses.
Yeah, go and have a look. Go on, Jan, you're
See this? So then when you get together, till you get a little bit together.
Oh, my God.
Oh, God, I can't believe this at all. Yeah.
The scans reveal a clean break to the largest bone in her thigh, and doctors will need to quickly decide whether to operate or realign the bone by putting Ashley in traction.
I tell you what, Dole, no kidding, you've got a long road ahead of you.
No, I'm not playing football no more. I think hospitals are quite scary for her because she spent a lot of time with her dad in hospital. He was a car mechanic, so he had his own business, and he's just always really been into cars. And he got her like some little pink overalls when she was quite young as well, so he loved her being there. She just adored him and he adored her, and I think that made her feel special. And he would always take her out to nice places and they would enjoy their time together. And he had spent some time in St George's. He spent like a year at the hospital. But we didn't know that he was like palliative. We didn't know that he was dying of leukemia. We had a phone call to say that he possibly had a couple of hours to live, and she was at school at the time. She was 7. So I had to go and collect her from school, and I had to tell her that he was going to pass away. And she just like looked at me and said like that he can't leave her, and she was just crying. And I think it was just really difficult for her that he could just be taken from her like that. And then it was a week later that he passed away. I needed to put my emotions aside a bit, I think, because I think Dolly was the most important person. She was so young and she just needed everybody's support, and my main thing was just to make sure that she was okay, because when I told her, I just looked, it just felt like I lost my child that day. And there was just no happiness in her eyes anymore.
A&E. Yeah, go ahead. Is it medical or trauma? Okay. Yeah. Yeah. Anterior lateral STEMI, yeah. Alrighty. Adult parents call 10 minutes.
A 91-year-old woman is being rushed to St George's with severe chest pain.
When the red phone goes off and you hear a 91-year-old with severe chest pain coming in, my mind will automatically kind of think life-threatening. The problem is, chest pain can be caused by so many different things, not just to the heart. You've got, problems with the lungs, it can be something in the tummy. Chest pain is such a common symptom, and it can be something very benign to something extremely significant.
The woman's niece, Anne, travelled with her in the ambulance.
We were sitting in her sitting room, and we were both sewing. And we were talking, and she suddenly went quiet. I asked her a question, didn't get an answer, and I looked at her, and she was sitting there just holding her chest.
I'm going to take your shoes off, all right? I'll pop them over there.
She likes to be known as Betty.
Betty.
She's 91 years old.
OK.
Today at 17:30, she was sitting in a chair, having a chat with her niece, and sudden onset central chest pain.
Yep.
We have given her aspirin, GTN 2 sprays,
OK.
Morphine 5 milligrams.
OK.
Cool. Yeah. Thanks very much for all you've done for me.
No problem. You take care. All the best.
Yeah. Come again next time.
Betty, my name's Neil. I'm one of the consultants.
Oh.
Hello.
Hello.
Have you ever had this type of chest pain before?
No.
OK. Just going to examine your heart. Is that all right?
Can you do what?
Just going to examine your heart. Is that OK?
Oh, any old thing. One more.
We're just going to do some blood tests, all right?
Doctors need to test Betty's blood immediately to look for a protein that will confirm that she's having a heart attack.
Right, let's get this dripping.
Betty, I'm going to go get... I'll put a needle in your arm.
Another one?
Yeah, I like doing that.
Oh,
we love bloods here, that's the thing.
Doctors are awaiting the results of 91-year-old Betty's blood test. They're keen to find out whether anything in her medical history will help them determine the cause of her chest pain.
So, have you ever smoked? Do you smoke? Ever smoke? OK. And have you been feeling more short of breath recently?
No. I'm not feeling anything particular. I mean, getting a bit sort of dicky on my feet. And,
yeah.
You know.
Do you live on your own?
Yes.
OK. And do you have any carers that come in to help you?
Normally, I look after myself quite happily.
Betty's niece, Anne, has been waiting to see her in resus.
I'm back. You're getting a chair sitter.
Have you got a chair sitter? Yes.
All the junk in the house.
But all your clothes and your handbag.
I probably just as well have that.
Yes.
That's a good idea.
Betty lived in London. We moved up to Cumbria in the early 60s. But every year we would go down to spend our holidays sailing on the Solent, and we would call in at my grandparents'. We often saw Betty and any of the others then.
How many more things are going to...
Just some water.
I lived to 91, that's what I'll be like.
Yeah.
I saw more of her once I'd grown up because I went down to work in London. She was always interested in us. That was the best bit. She was always interested in what we were doing and where we were doing it. Great fun. She was just fun to be with.
Just asking your date of birth, Beth.
03. 0424. 04. Yeah, 3424. Nice easy one.
Nice easy one, yeah. Betty and her 3 younger brothers were brought up by a nanny and all went to boarding school because my grandfather was a solicitor. She was a daddy's girl. She adored her father.
Do I have to keep this thing on?
Because they want to know what your heart's doing. They're keeping a check on your pulse. Yeah. Nobody told her when she went to boarding school that it was all girls. She said it was the best surprise of my entire life. No boys. Boarding school was probably the best training for the services you could possibly have. Because, of course, when she came out of school, it was wartime. And she was straight into joining up. She joined the Wrens. And once she was in the Wrens, that was it. She had to stay there till the end of the war. You are talking to an ex-nurse here.
Oh, really?
No, I'm not a fully trained one. I did about a year and a half when I started, and I got food poisoning during the war. I got food poisoning, and they wouldn't let me go home, so I walked out.
She went up to the Orkneys and was a telegraph operator, translating from Morse to English and writing it down as it was coming in, and doing the same again as it went out again, to submarines and ships and everything out in the North Sea and the Atlantic, the North Atlantic convoys. After that, it was a case of she did what she really, really wanted to do, which was to travel.
It's definitely, the pain is definitely going off a bit.
Going, yes. We had a fair chunk of morphine through into you in the ambulance, which will have helped.
Yeah.
Yes.
Although doctors have been able to manage Betty's chest pain with medication, they're still waiting for test results to determine the cause.
Ever heard such a palaver?
I don't want them, I can't eat.
They dissolve in your mouth. They're like the easiest thing you can eat. Next to soup, this is the next best thing.
Plonk it in there for me.
Yeah, that's cold. Have you got any warm water? That's cold.
Not that cold, is it?
That's cold. I like comfort.
Retired nurse Clarine has come to A&E with pain in her foot after having a bunion removed 2 months ago. Emergency nurse practitioner Craig has decided to rebandage the wound.
Does that feel good?
It's living again. I'm going to put some olive oil on that.
Good quality one, I hope.
Oh, yeah. Makes the dead skin separate quickly. Got a new foot?
With a bow.
Oh, lovely.
OK, hopefully that feels better.
Well, thank you very much.
And any problems, come back and see us.
You take care and all the best.
Thank you very much.
Thanks ever so much.
It's nice to meet you.
Bye-bye.
Take care.
You take
All
care.
right,
Thanks.
bye-bye. See you later.
Bye.
It's a lovely day.
It was quite nice. When I get home, I think I'm going to have a glass of wine with lunch to celebrate. The waiting time is always the worst.
OK, I'll do it like this. OK.
Casey, do you want anything more to eat? Are you OK?
No. I'm okay.
You're OK? You're not OK?
I want to see.
Don't eat them all at once.
Can you please this?
Should we play I Spy?
Yes. I spy with my little boy. Something together with
Lola.
Is that you? So that's me.
3-year-old Lola has come to A&E with her dad Quinn following a seizure at home.
This way, puppy.
After being diagnosed with febrile convulsions a year ago, her dad is worried that her recent fitting may be the result of another underlying concern.
My name's Peter. I'm one of the doctors.
Say hi, Peter.
Hello. What's brought you to see me today?
And Daddy too.
Oh.
And the name is Quinn.
That's my name.
And his name is Quinn?
Yes, and Mummy's name is Melanie.
Oh, wow. Can I ask Daddy some questions? Is that okay?
Yeah.
Thank you. So what happened today?
She had febrile convulsions. She's had, this is the 7th.
In sort of what time span are we talking? When did they first start?
Last October.
All right.
The first couple of times were a lot more severe, violent convulsions, eyes rolling back, stopped breathing.
And was she sort of shaking her arms and legs?
Yes. One was here, and they had to sort of take her to resus, and
Okay.
she stopped breathing for a few minutes, and they cut her clothes off, and that was the worst one.
And in terms of her behaviour normally, I mean, she was sort of hit all of her milestones on time, walking, talking, all at the right times?
Yeah, she started walking a little bit late.
Okay. Talking, you feel that was all on time?
Oh, yes, yes, absolutely no problem with talking.
Sure. Can we pop you on the couch so I can have a little feel of your tummy?
Yeah.
Oh, fab. And we'll lay you down nice and flat. Can I have a little feel of your tummy?
Yeah.
Are you ticklish?
Yeah.
Are you sure? Are you sure? OK. Can you sit up for me? And I'm going to have a little look in your ears.
Oh, Nana, what is he going to find in your ears? Since October of last year, she's had 7 of these episodes. These febrile convulsions.
I'm just going to come around the other side and have a look in the other one.
She was just sleeping in my arms. And I felt my lap go warm and wet. She wet herself, at which point I obviously took notice and her eyes started to roll back and she stopped breathing, and it's just awful. Naturally, when you see this sort of thing, you go through all the worst case scenarios, as we do. My wife's brother had a tumour, and the sort of climax of it was a fit. He'd had a major seizure.
Can you close your eyes nice and tight for me?
We're still trying to get to the bottom, really, of what it is that she's going through, whether it's just febrile convulsions or whether perhaps it could be epilepsy or, you know, God forbid, something more sinister.
Say, ah. And again.
You do sometimes think, why does she have to go through this? You're thinking, gosh, what if this happens again? What if it happens and we're not with her? In that moment, there's nothing I can do. I think that's the scary thing. Wow, I wasn't expecting this. So, yeah, the man in me says, I'm out of control. That's a very uncomfortable place to be.
I just want to have a look at her old letters and bits and pieces, and I'll come back and have a chat with you again.
Thank you so much.
That's all right.
It's been just over 90 minutes since 10-year-old Ashley arrived at St George's after breaking her leg. Orthopaedic doctors have arrived in paediatrics to discuss how they intend to treat the split femur.
Hello, hi, I'm Michelle. Hi, nice to meet you.
It's quite a severe break that she's got, so usually it will involve us doing a small operation for it.
Okay, yeah.
It'll involve us putting 2 small sort of what we call nails, so little wires which go through from near the knee and go up all towards the hip. And 2 of those are put in just to stabilise the bone and let it all heal up.
Yeah, okay. Thank you very much. Thanks.
Do this no more.
I know.
Why does it always happen to me?
Because you're so clumsy, that's why. I felt like she definitely had to grow up quickly with everything that had happened. But on the other hand, she's still very babyish in the things that she does. And I really like to see that, her playing with the little dollies still and ponies and things. And it's just nice to see her getting back to normal now and just being able to kind of have that childhood back again, really. Gulliver can wipe your lashes off. One of the most important things for her was to take her teddy bear with her that her dad had taken around all of the hospitals with him. And I think that she just felt that he was there then. When she was growing up, everybody would say that she was just like him and looked like him, and I could never see it. But I think it was the day that I had to tell her that he was very unwell, that I just looked at her and I could just see what everybody had been saying, and definitely since he's been gone, it's just like she's completely got his soul, and it's just like looking at him. Good girl, keep breathing.
Have you ever stayed in hospital before overnight? You don't think so? It's the first time for everything, isn't there?
It's definitely made us realise how precious life is now, and that we just try to enjoy as much time as we can together.
Ashley will be taken to an orthopaedic ward before having an operation to realign the pieces of bone in her thigh. It's been just over 15 minutes since 91-year-old Betty arrived at St George's with her niece, Anne.
Elizabeth?
Yeah.
Hello, Elizabeth. My name's Chris. I'm
Yes,
one of the
try
nurses.
Betty.
Betty, I do beg your
Yeah.
pardon. My name's Chris. I'm one of the nurses here. We have some tablets for you. I'm afraid we have quite a few. Would you be able to take these for us?
I expect so. That's...
Excellent.
I can't swallow the whole lot.
I'm afraid so.
She absolutely loved travelling, and she would maybe work 2 or 3 years, usually in London, places like solicitors. And then she'd drop the job, because she'd been saving like the clappers, and go off travelling for a year.
I don't think I'd get them all down at once. I don't think I've ever been asked to swallow 8 tablets at once in my life.
She visited South Africa several times. She went to India. She had friends and family in Delhi. She went to Singapore, Hong Kong. Certainly Australia and New Zealand and Canada were very big favourite places to go. She buzzed around and did her own thing.
Well, I'm glad I was here.
Yes, I'm glad you were here too, I must say. Coping with all this by myself would have been difficult. I mean, not impossible, but difficult.
Difficult, yes.
I think she was ahead of her time, certainly. I mean, don't forget, when I was little, getting married and having children was still the sort of thing you did. Betty showed that it didn't have to be like that. And yes, she was probably trailblazing in a small way.
Doctors have received the results of Betty's heart reading.
When you're telling someone such big news, one of the key things that I try and do is to not kind of beat around the bush and tell them.
Oh, sorry, Betty.
Betty, the tracing of your heart shows that you're having a heart attack.
Well, I thought I was,
Yeah, quite a large one, it looks like.
Oh,
okay.
that's bad.
It can be, but you're in the right place.
Oh, good.
Which is good.
Glad about that, yeah.
So the heart specialist, the cardiologist, are going to come down and see you.
Oh,
okay.
Oh, I like it.
Yes, again, that looks very different.
Yeah, so print that.
Done another one.
Perfect.
God knows what they're all doing. These are what you might call the rather high-powered medical whatnot.
Hello, Betty.
Hello.
Nice to meet you. I'm Dr. Shag. I'm one of the heart doctors. So the heart attack is caused by a blocked artery, blocking the blood supply to the heart. And the treatment for that is to open the artery up. OK, we'll take you up to the lab now. The doctors are waiting for you there, Betty.
Oh.
Can come up with her? Wait. She's not going to come back.
Betty now faces life-saving surgery, where doctors will attempt to unblock the arteries in her heart.
It's all right, I've got it on stereo.
It's all very exciting, the whole thing. Charging her up. Hospital, nothing but a pair of pants and a bra on, I ask you.
Yeah, round to your left.
Are you singing a song?
You twinkle, twinkle.
Yes, please.
Twinkle, twinkle, little star, how I wonder what you are.
3-year-old Lola suffers from febrile convulsions. Her and her dad Quinn are awaiting the results of a test to see if her most recent fit was caused by something else.
Lola, you've been very brave today. So good. High five. It's been such an adventure today. You saw the big doctor.
So, 3-year-old, noted to have a fever today. He's had a subsequent seizure. I was going to see if I could expedite her paediatric appointment.
Yes.
There's a strong family history of brain tumours, and that's what their big concern is, essentially.
I think she just needs to go to the clinic early and maybe penicillin for the throat.
Yeah, for the throat. That's what I was thinking.
Lola's tests haven't revealed anything significant that could have caused her latest fit, but doctors have decided to refer her for a specialist appointment.
We feel that the fever's coming from the throat. When I have a look back, it's quite red. On the left tonsil, there looks like there's some exudate there as well, saying she's got a sore throat.
Yeah.
Imagine potentially in the sort of next 24 hours, it might be start getting sore.
Okay.
But we'll give her some antibiotics for the throat, because I think that's what's provoking the fever.
Fantastic. Thank you so much.
That's all right.
Hello. So they say the back of her throat is inflamed, and I think that's probably what brought on the high temperature, which then brought on the convulsion.
Daddy,
She wants to talk to you. You want to talk to her?
Can I talk to her?
One sec.
Hello. I'm in a hospital. Yes, I'm coming soon. Bye.
Okay, babe. So I'll.
Okay.
Should we take a bus? Her and my relationship, it is different to my relationship with the boys. Lola loves her fairy tale books, and so she's getting to grips with the prince-princess scenario. So just the other day, she bounded into the room, jumped into my lap, grabbed me at both cheeks and said, "Daddy, true love's kiss," and plonked her face against mine for the longest time. And certainly at the moment, I assume that role of prince in her life. As long as I possibly can, I want to assume that role.
Follow me. Daddy, should we get an ice cream?
We're gonna get an ice cream.
Okay.
As a dad, I spend my life arranging the furniture around her life to ensure that all the corners aren't sharp and that the landings will be soft. That's going to be the rest of my story with bouncy little Lola, arranging the proverbial furniture.
You can hold my hand if you want.
Thank you.
She'd been really excited because she was bridesmaid for my sister's wedding. It was like a week until the wedding, so she had the dress and everything. And I think her biggest worry was that she thought she'd be in a cast and wouldn't be able to wear her new shoes. But yeah, she looked beautiful and it all went to plan in the end.
In the mornings, I would take my cup of coffee and go and sit, and she'd have her breakfast in bed, and I'd sit on the stool and we'd talk for an hour or so, sometimes more. She'd sit there and say, "I never thought I'd reach 91. She had a couple of very bad days. Friday in particular was not good. Then she died on that Wednesday afternoon. We gave her a darn good send-off. We went to Wimbledon crematorium. Even one of her New Zealand friends got the news and come over. And we told everybody to wear colour, because she loved colour. And then we went and had food and things in the hall where we'd had our 90th birthday party as well. Yes, we gave her a jolly good send-off.
Are you ready to face the day?
Adult male, trauma call, 8 minutes.
Motorcyclist versus car. They said the dent in the roof is his face.
You slide.
T-bone into the side of the car, turning right onto him.
Can you tell me what year we're in, Robert? What year are we in now? What year is it?
I think we need to slow down a bit before it's too late.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before. We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked by a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
Amy, selfie! Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
That's it, big breaths, well done. Let your arm go all floppy. Good man. I was lying about how much it would hurt, because you wouldn't have done it otherwise.
No, it did you.
It's one of my favourite things to do. But yeah, you've made my night.
I've always had a quirk wherein I can play the fool at times. On paper, when you become a leader, you should leave that part of you behind. However, I find that quite difficult to let go of.
Tonight in Resus, Simon is a senior nurse on duty.
Yes. Okay. Yes.
At work, I'm very together. As soon as I put the uniform on, I get into that mindset of being in control. Whereas in my real life, it's a different story, really. I'm coming up to 30 now, and I'm very much single.
Ooh.
Hello.
It's the gay consent for touching a patient.
Trying to find the right person, quite a challenge. Sometimes, you know, you do get hurt. We just spent 20 minutes talking about that. Obviously, you didn't spend 20 minutes doing it because the patient would be dead. I think the bravest thing we can do is to put ourselves out there, to love other people and allow yourself to be loved, because bad stuff happens. And when it does, you really want somebody there by your side. St. George's Resus. OK.
A 78-year-old man is being rushed to A&E with breathing difficulties.
Our priority call ETA, 7 minutes. When you hear that patients coming in and they have breathing problems, you really want to know straight away, is their airway intact? Anything that affects your breathing has the potential to kill you.
The man's wife, Irene, called 111 and has accompanied him to A&E.
He was very short of breath, and I can normally find a pulse. I couldn't find his, and I think it was because it was so erratic.
Just relax back.
Barry didn't want me to call an ambulance, but he had a bacterial infection and only out of hospital for about a week. That's why I was so worried about him.
Barry's 78 years old. He discharged recently out of hospital, and he's been continually short of breath. He does have a history of a right-sided pneumothoraces, which have been drained in the past, so that was our concern. He does have a cough, but it's non-productive. There are some cognitive issues. There is a diagnosis of dementia, so his conversation might be confused at times.
Can I listen to your chest now?
Over this summer, Barry's been in A&E 5 times. He has quite a complex medical history. Barry was diagnosed with emphysema 10 years ago. He'd had a stroke as well, and now he's got dementia.
Hello, sir. My name's Simon. What we're going to do is get you set up on the monitor with ECG monitoring and blood pressure, and we're going to take some bloods as well. Do you know where you are at the moment?
Yeah.
Where are you?
St. George's Hospital.
Do you know which department?
Well, it's on the end.
Concentrate, Barry.
It's OK, take your time.
I'm just on the reception.
Ah, the A&E, yeah. If the patient is older, they're not as robust, which means we can't treat them as aggressively as you would someone 20 years their junior. And part of you knows that potentially they're not going to make it out of hospital.
Can you sit up and I'll support you? Come on, you can't lay down like that. On the previous occasion he'd been in hospital, they drained over a litre of fluid from his lung. And the same symptoms were there, so I was worried that it was happening again.
Doctors have prescribed a nebulizer to help Barry's breathing. And they've requested a chest X-ray.
So all you need to do is take some nice deep breaths.
Oh, slipping down. It's your nose that's at fault.
It's been 20 minutes since 78-year-old Barry was brought to A&E with breathing difficulties.
Hi guys, take a quick chest X-ray if that's okay. Just bring the machine down in front of you there.
He was recently hospitalised with a chest infection, and doctors suspect it's returned. Barry also suffers from dementia.
Can you tell me your date of birth, please, Barry?
24th of the 4th, 37.
That's great.
He can't always produce.
No worries. Okay, very deep breath in. Hold it there. Excellent. Breathe away.
Barry was quite a bit older. He was my brother's friend. And when I was doing my O-levels, he came and sat with me while I was revising. Embarrassing to say, it was biology I was studying. He walked me home once. I didn't realise he was walking me home. I thought he just happened to be going that way. I was naive as well, I suppose, because I never had people falling over themselves to, you know, invite me out or anything like that. So it was very refreshing to have someone like Barry who talked to me. And he said, oh, well, you're the kind of girl I would like to marry. And I said, well, you've never asked me. So he said, will you marry me? I was really excited, but more than anything, it sounds strange, I was amazed because I never thought anyone would ask me to marry them. It seemed such a big step to take. But we were happy because we were both looking for somebody who would be just the one person that we'd stay with. All right.
What I want to know is if there had been a breath test at the football.
I hadn't even had a drink before.
No.
The only person that was drunk was the stag.
I've heard everything. A bunch of late 20-year-olds on a stag weekend, and the only person drunk was the stag.
Well, no, we all got drunk after that, obviously.
Well, you got drunk while you were waiting to get your arm done.
No, I got my arm done and then went out drinking with everyone.
Life must go on.
I wonder why I had a service when I got it out of my handbag and I haven't now.
If you put it to your forehead, you normally get better reception.
Don't be stupid.
Try it, I bet it sends.
I can pick up a signal easy, there's nothing in there. Oh.
St George's Resus, adult or paediatric.
A 75-year-old man is being brought to St George's after falling down a flight of stairs.
Adult trauma call, ETA 15 minutes. When you have an older person coming in with falls, you're worried straight away. They're more at risk of breaking bones and internal injuries. And their recovery sometimes isn't straightforward.
No more moving. Right, this is David Lowe. He's 75 years old. He's fallen down a full flight of stairs. He's fairly comfortable while he's still, but any coughing or deep breathing, he's got pain in the left side of his chest.
Hello, David. How are you doing?
I'm rather deaf, so you have to speak slowly. I'm sorry.
OK, no worries.
All
right, David, just put this around your arm, OK? To your chest.
David's wife, Jane, has come to hospital with her brother-in-law and sister.
That paramedic, he said, are you both independent at home? Do you have any carers come in? I wanted to say, no, I can still do a handstand. We were up to visit and staying with my sister, but David is not familiar with Linda's house. And he got up in the middle of the night, in the dark, didn't put his glasses on, didn't turn the light on, and he mistook the top of the stairs for the bathroom door. We were worried about him. You could tell he was in a lot of pain. He couldn't move.
Very good, thank you very much.
It was just sad, really, because he didn't have anything on. I can't help it. It was funny. Linda, she's a nurse. You know, she's seen it all before. But she did get a little towel out of the downstairs bathroom and just cover him up, which made it look even sillier.
To ease David's chest pain, doctors have prescribed some morphine.
Yep.
They suspect he suffered internal injuries during the fall.
Any pain in the ankle?
No, that's fine.
And the here? Oh. Well, what was that?
No, sorry, that was my toe that I kicked.
It looks very bruised down there.
Yeah, I think I broke it.
How did you do that?
You can't believe this, but I have dreams where I fight people and punch and kick.
Oh.
And 2 days ago, I was so frantic in my sleep that I actually kicked the wall.
Oh, that's a bruise. I'm quite sore.
I'm a good sleeper, and I normally have a very good night's sleep, and often very pleasant dreams as well. But I do have occasional dreams when I get into sort of aggressive situations. I punch, clench fist punching, and I kick out with both legs. And sometimes I've just punched the pillow.
Do you remember when he first hit you?
He was kicking me, really. He'd be cuddled up fast asleep, and then suddenly this person lying beside you would kick me really hard. And so I'd wake up and start kicking him back. So we'd end up kicking each other.
We've ordered x-rays to see if it's broken or not.
Well, that's why my wife has to sleep in a separate bed, otherwise I kick her.
I don't blame her.
They weren't regular every night stuff. It was just every now and again this stupid thing would happen, and obviously, you know, it was mortifying to think that I'd just thumped Jane.
I don't know why I have that aggression when I'm asleep. Yeah. I'm normally quite a peaceful chap, you know. Yeah. Going back to my school days, it's usually kids that are misbehaving, so I go in for the kill.
So how long have you been having these dreams? Since you were a teacher?
No, the teaching were anxiety dreams then.
Okay, yeah, I can imagine.
When I was teaching, I always had dreams in the summer, which were anxiety dreams about going back into teaching. One of them, which did recur, and it was always the same one, I had to assemble the whole of the school onto the playing fields, which I had to do when it was fire drill. But I had to do it this time and teach them Romeo and Juliet with no clothes on.
What did I do? That bit of paper?
Should have been at work an hour ago.
Well, it is not my fault.
It's your fault.
How?
Because you're the one who got me pregnant.
Takes two to tango. And I mean tango.
What did he do?
He had an electric saw and he dropped it. Gee.
82-year-old Bob has been brought to Majors after a DIY accident at home. His wife, daughter-in-law and grandson were out when the incident happened.
Did you have to?
What bloody hell's he playing at?
Did you have to?
Now, what have we told you? What have we told you? If you didn't want us to come round tomorrow, you only had to say. You pillow.
What are we going to do here?
Do what?
Next time you want anything cutting down, you ring me.
Yeah, all right.
Robs, I'm not having you in here with cuts.
I'd rather be me than him.
Do you like a saw?
Saw? Yeah, I do, depending on the saw.
You're not having the key to the shed anymore. It's gone.
Honestly?
We're cutting off the electrical supply.
So that's hanging off the wall anyway.
Do you know what he was up to?
Yeah, I think he was trying to cut down a tree stump, trying to make it smaller so he could extend the shed. The circular saw was broken. I think the blade attachments or something wasn't working, so he did it himself somehow.
I was using that grinder with that new blade I put on it, and you can't stop it once it starts. So I thought it would make it easier to do the job I wanted to do. It went wrong. That toe, I think they're hanging off.
No, it probably is, knowing you. If you're going to do it, you'll have done it properly.
Yeah.
I've been banned from ladders. I had one or two instances, I fell off a ladder out here, you know. I'm banned from everything by the family, but I don't take a lot of notice of it.
Blood pressure went down to below 100.
Oh, it would do.
Because he'd lost so much blood.
They thought it could be a suicide attempt. That's what the police said, because he was on his own, he was at home, and there was a lot of blood.
More than suicide, does that sound right to you?
Nah, not at all. He loves life.
Good job you didn't see it all.
It was bad enough seeing what was left.
Oh, it's terrible.
The policeman said, good hose down would be all right out there, he said.
Every day in work, I see family and loved ones rallying around a patient, and it's hard not to get affected by it. Sometimes I do worry about ending up alone, but love isn't easy. So hopefully one day I will find someone really, really special. You know, deep down, I think that's what everybody wants.
In Resus, doctors are waiting for 78-year-old Barry's X-ray results to determine what's causing his shortness of breath.
Put this in my bag so I don't forget it.
I would forget everything.
So you married me, is it?
Me my Mary.
Not much use for anything else. When we were first married, Barry definitely wanted to have children, and I didn't want to wait. I was really excited, looking all the time to see if I was pregnant. I thought it was as easy as that, but it seemed a great deal of time when you're waiting. We were both investigated, and we found out that we weren't going to produce a child. It was just very distressing. I just wanted to have a child.
Barry's X-ray results are back. They show he's got another chest infection.
His X-ray confirms that he got a build-up of fluid back again.
Oh, not again. I keep my hand there so you know I'm here. Sonata. You looked quizzical. Was that something you were seeing or because of yourself? Right, why did you look quizzical?
Yeah. Okay.
You're feeling what, Barry?
Oh.
Breathless?
I've got a steroid injection that I'm going to give you.
78-year-old Barry has been brought to Resus with a recurring chest infection.
With the fluid collecting there, it does start a process of inflammation and irritation there, so it's helped to bring down that swelling.
Right, thank you.
No problem.
Okay. Anti-inflammatory, basically.
To clear up fluid on the lungs is difficult, and putting a tube inside somebody's chest is very invasive. You need to weigh up whether that risk of causing suffering is worth putting them through it.
Doctors will closely monitor how Barry responds to a course of treatment that should reduce the fluid levels in his lungs.
Could open your cards, I brought them with me. Want me to open them? Happy Father's Day. You're one in a million as a person. And totally awesome Happy Father's Day. And you put kisses. Don't know when you're going to collect them. When we had the diagnosis that we weren't likely to produce a child, we just decided that we would adopt it. We did say if we could, we'd like a baby, because we'd never been through that experience. And we had Rebecca when she was 4 weeks old. Magic. I remember the first time I picked up Rebecca, I said to Barry, I can't go home without her. You know, she was mine straight away. Someone asked me if she ate the same as us. Somebody else asked me if she would speak English. You feel sorry for people like that because they haven't grasped the essence of this is just a little human being, you know. We applied to adopt again and we were turned down. That was traumatic. I can't tell you how awful that was. We went to appeal and we took a picture of Rebecca with us to show, you know, our lovely daughter, and look, we could do it once, surely you could trust us to do it again. And she said, she's irrelevant. And I looked at Barry and he put his hand out onto my knee to keep me calm, because no one was going to call my daughter irrelevant. When we calmed down, we just applied to other places. And happily, we had Anthony. And that weekend, my greatest delight was to take him out and buy him a pair of shoes. And it was such a joy. And the first time I bathed him, he was ours then, and even smelt like our family, if you know what I mean. Admit it, you only had me for the free tech support. That is so true, isn't it?
Was it hard being a mum of two?
I was feeling really tired. Really tired. And I thought, oh, this can't go on, I must be anaemic or something. So I made an appointment at the doctor's. She sort of checked me over and said, you seem to be okay. The only thing I can think of is that you're pregnant. And I went, no, we're the people you saw for medicals for adoption. She said, well, we'll do a pregnancy test just to rule that out. On Barry's 44th birthday, I came home and said, I'm pregnant. I said, sit down. I'm pregnant. When Nathaniel came along, people said to us, you must be pleased now to have one of your own. In fact, we used to find it quite offensive. We never thought of either of our two adopted children as not our own. We had to tell the children, and it went very quiet. Rebecca looked at us and she said, you needn't have had us then. I don't think in the next 5 minutes they were under any illusion that we would have done anything other than had them, but I couldn't believe that a 6-year-old could work that out.
Despite medication, Barry's condition is not improving. His x-rays have been sent to a specialist for further analysis.
Just tickle my left nostril on the bottom.
Have the tissues there.
Just tickle it. Okay, sorry, my left eyebrow's itchy now. No, keep it in a bit. That's it.
Are you looking for me to hold it for you as well?
No, I'm an independent person.
Yeah, that's why you rang me and goes,
Okay, 1, 2, 3. Well done, sir. Rest back there. That's it. Well done.
Last night, retired Deputy Head Teacher David fell down a staircase. Doctors need an x-ray to determine the full extent of his injuries.
I was born in a small cotton and coal town in Lancashire. I was as a child quite ailing, rheumatic fever, German measles and this, that and the other. When my younger brother was conceived, my mum couldn't cope. And as happened quite often in those days, I was passed over to my aunt.
Okay, David, breathe in, hold your breath, and breathe away.
I was allegedly going to stay with my aunt until I got better, and there was one particular day etched in my memory. My father and my mother came to my aunt's house to take me home, and I had my little suitcase packed upstairs in my bedroom. And they came and I was asked to go out to play, which I did. And when I came back, they just said quite simply, "We've decided you're going to stay." And so I grew up believing that I was bad.
Ready? 1, 2, 3.
What was your aunt like? Was she loving?
In a northern, distant sort of way, yes. We never had any physical affection. We didn't kiss each other and hug each other, which I guess as a small child I missed. I became quite hard. Not very sentimental, I guess. It turned me into a rather aggressive bully, if anything. I was good at boxing, so I took up boxing and like hitting other boys. It was good.
Now, David, just do your toes.
What's it like to sort of admit that?
I didn't at the time. I thought I was perfectly justified. But obviously, as I grew up and looked back, yes, I thought that wasn't very nice, was it?
Oh, David, we're all done.
Thank you very much indeed.
Hi, sir. Mr. Payne, is it?
Yes.
Hi there.
Here they come.
I'm Jonathan.
Here they come.
I'm the plastic surgery registrars. What I need to do is take down the dressing and have a look and see what the damage is. And
Retired coach driver Bob had an accident at home doing DIY. His multiple injuries were dressed at the scene by paramedics.
Just tell me if I'm causing any pain, sir, OK?
Will do. I met my wife while I was driving coaches. She was one of my passengers.
Mum had treated us to a trip to Ramsgate. We were in the back seat. He was looking in the mirror as he was driving along. Quite nice looking, actually. His hair had got blonded because he'd been down on the beach a lot, and he kept looking. That was why I noticed him.
I can't remember ever passing a driving test, to be quite truthful. When I was coaching, it was a great life. You were on your own. You didn't have anybody peering over your shoulder. It was fun. If we weren't in Hastings in the pub, drinking our first pint by 12 o'clock, we were late.
Now, that plaster's from yesterday.
And how did you do that yesterday?
With a saw.
OK.
I'm sensing a theme.
On this hand, you've cut through the tendon which straightens the finger. You've cut through those...
No, what made me laugh was I've done the same thing.
Did you?
With
When did you realise this man has a few more accidents than most?
When I met him, he followed us down on the beach and he was smoking a pipe. He went along the breakwaters, but he slipped and he crunched his chin on the pipe, so he ruined his front teeth. So he really fell for me, poor bloke.
The foot will need to be stitched, and then on the toe, you've cut through the tendon as well. You'll be fine with walking. The main issue is going to be that you won't be able to use that hand normally for several weeks.
That means you can't roll a fag.
Oh, that's a shame.
Bob will need surgery to repair his severed tendons.
What are we going to do about you, eh?
I'm sorry, kids.
Don't be sorry.
Just don't do it again. No electricals anymore. No electricals, full stop.
Is your pain okay now?
I feel okay, you know, with the morphine, do a bit sort of woozy, you know.
Yeah.
Last night, 75-year-old David fell down a flight of stairs. His x-rays reveal a cracked sternum, 6 fractured ribs and a broken toe.
Are you able to take deep breaths?
I keep trying to make sure I do.
Because the problem with rib fractures, sometimes because of the pain, people aren't able to take deep breaths.
I know.
And then you can end up getting
That's right.
chest infection.
I was a scholarship boy, got into a posh school in Bolton, and not allowed to do science and maths, because that was for the clever people. I had to do the easy subjects like English, French and German, you know, which any fool can do, they said. University knocked all that nonsense out of me. That opened my eyes to the fact that I was actually as clever as the others, really. I knew that I was going to do teaching. I really felt that that was what I wanted to do, because I just felt that education and schooling could make complete difference in people's lives. I seemed to take to it like duck to water, really.
David was at the school when I started teaching there. He was quite scary when we were at school. The kids were terrified of him, and so were the teachers. But he was a really, really good teacher.
So being a bully as a child stood me in good stead as a teacher and deputy head, really. I was able to say to parents in all honesty that there was no bullying in this school, only from me. And they quite liked that, you know, they felt secure that there weren't any other bullies. Because at least I could restrain myself then, I didn't hit anybody.
Ow!
Sorry. Is that better?
That's brilliant, thank you, yes.
Okay.
Doctors have decided to admit David onto a ward to continue his recovery after fracturing 6 ribs.
Ah. Oh dear, you poor things. Honestly, there's bugger all that's happening, and
So we might as well go.
you take some x-rays of my toe and my
your
shoulder.
toe as well?
So how did you do that?
Did that scare you, did it?
Yeah.
Did you
I
tell
said
them?
I kicked the bloody wall. What do you think I did? Oh, don't do it. Oh, you bugger. Oh.
I'm sorry.
Oh, dear. I feel that I'm just in a bad dream, really. I'll wake up and I'll only kick the door.
Did you ever miss your real family?
Not at all. From a young age, I never felt too strongly about the pull of family.
I need something, though, to boost my confidence.
Oh, there you are.
Bloody thing.
I think I look back now with regret that I didn't show my aunt and uncle close affection. They would do anything for me and spoiled me rotten. You know, nothing was too much trouble. When my aunt died, my uncle eventually got dementia and came to live with us. And I remember with gratitude that I was able to physically nurse him in his final years, clean him and wash him and things like this. He didn't know me, but I sat with him when he died. I was able to link with him emotionally very powerfully. Did me a lot of good, you know, it made me feel that I'd made up a bit for my coldness earlier.
"78-year-old Barry arrived in A&E earlier today. He's being treated for fluid on the lungs. Geriatric specialist Dr. Shabazz has compared Barry's recent x-rays.
My name's Shabazz. Nice to meet you.
Nice to meet you.
I'm sorry you've come back into hospital.
So am I.
Yeah.
Sorry.
No, it's not very nice for you. You've got a build-up of the fluid, I'm afraid, in your lung again.
Yeah.
But ultimately, we need to put this drain in to drain off that fluid. I know. How are you feeling?
mean?
Concentrate, Barry.
Ah.
Okay, all right.
All my married life, I have lived with this very intelligent, knowing man. He was just a font of knowledge. He spent some time in the RAF, and then he used to work in research and development. And eventually, by recommendation, he got a job at the MOD, and that's all I can say about that. It started to be that he wasn't remembering things. He forgot my birthday. I'd opened my cards and I was expecting him to sort of produce one, and he didn't. And in the end, I had to say, "Oh, did you get me a card?" And he said, "Oh no, I didn't get out to get it this time." I suppose that's when it registered quite strongly. But I didn't want to broach the subject because it's a hurtful thing to have to say, isn't it? That, you know, I don't think you're the person you were.
I'll show you the X-ray. The fluid's reaccumulated. Oh.
I'm sorry.
Do you want to sit down?
Sorry.
So that's the crux of the problem, basically.
Oh, dear.
You definitely did the right thing bringing him in.
Doctors have discovered dangerous levels of fluid in Barry's lungs and have decided to insert a chest drain. His wife Irene has been taken to the relatives' room.
So I'm not sure why it's reaccumulated.
Right.
It could be pneumonia which hasn't quite gone away, and we'll look into that when we take some fluid off today and make him more comfortable. What I wanted to also ask you is about, in case this has been brought up before in the past, with resuscitation status as well. I know it's not a very nice chat, but it's something
I don't know what Barry would feel.
He hasn't expressed any wishes? Or...
No, not really.
OK.
If his heart stopped, is there anything you can do, and what would it be if you could restart it?
It's variable, the outcome. Quite a lot of people who end up going to ITU, they don't come back the same condition that they were before they came into hospital.
Yeah, I understand. You're being very pleasant about it, and I'm going to be upset, but you understand.
I do apologise. I wasn't sure if this subject had been approached before.
I'd let him decide. I would talk to him about it because he's... There's no nice way of saying it. Sorry. I don't want to waste your time by just crying, but I can't help it.
That's perfectly fine. You're not wasting time.
Have you any idea of the likelihood of that happening, just for my peace of mind or absence?
I'm not anticipating it's going to happen today or tomorrow or immediately.
If it were, you just want to not have to bring all this up at the time.
Yes, because it's quite...
I respect that.
Would you like me to speak to him about this?
Selfishly, I know he cares for me and he would want to do what's best for me, believe it or not. But I can't.
When I think about the fact that I'm going to see my family going through all of these issues that I've been witnessing for the last 10 years of my career, that worries me more than myself getting old. I think you just have to hope that when you are old, you've got plenty of people around you to support you and to love you.
Give me a hand, as I need to talk to you about this. They said, have we talked anything about resuscitation? I said I would talk to you about it, not because it's going to happen now, but you can make the decision now when it's your decision to make. If anything happened and your heart went or your lungs went, do you want to be resuscitated?
If I was resuscitated with not very good
Quality of life. Yeah.
I see no point in coming to life again without...
Having some life.
You wouldn't like that, would you?
I would do whatever you wanted. But if you weren't going to be communicating with me, then they can let you go.
Yeah.
OK. Thank you. I'm sorry, then. And I will. Shall I say now, and then we don't have to have the conversation again?
Yeah.
Were you comfortable with the answer?
Yes. Yeah. He wouldn't want to be a burden to me, and I wouldn't want to be a burden to him. It's different if you can talk and communicate in any way. But if you can't communicate and people are just spending time with you in sadness, you're just making it worse for them, aren't you, really?
This has been a very salutary lesson in the complexity of the brain and how wonderful it is, really. And I just find it a little amusing that after all this time I can be just as daft as anybody, you know.
What do you think has given you the greatest happiness in life?
My children and my wife. There's a lot of people I can thank for this. If I'm well enough, I'll be happy.
St George's Emergency Department. Fell out of a tree, yeah.
Andy's 48. He landed straight onto his feet.
Oh, my God. Jesus Christ.
In the worst case scenarios, if not treated, then all of the muscle dies and you could end up having to amputate. Can you feel me touching your underneath here? No, I can't feel anything there.
I was worried that he would never be able to walk again.
Oh, my God.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there
when awful things happen, to pick up the pieces.
We have a 2-year-old who's kicked like a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
Amy, selfie!
Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
Try and do the waves. Look, watch. Boom.
What's the next one? Beautiful anime lover I saw on the number 75 Bristol bus. Did you put that in? It's from Bearded Guy. No, I don't think we've made it in this one, mate. No, I don't think so.
Let's just staple his head first. He's got a lac on his back of his head, which we're going to staple. Okay. Once we've stapled that, we'll basically get the NG tube down. Are you happy with that? Or you're not happy with that?
Yasser first came to St George's as a medical student 17 years ago. Today, he's the consultant in charge of Resus.
At the moment, probably okay, actually. But you can thank Manny for the gesture. It was probably about 2 seconds after the cord was clamped when I was born that my parents probably decided they wanted me to be a doctor. They didn't really give me any subliminal messages when I was young. They said, we want you to be a doctor, we want you to work hard at school. Do you know where you are at the moment? Do you know which hospital you are? I'm a doctor, my wife's a doctor, my brother's a doctor, and his wife's a doctor. No problem, don't worry, you're at St George's Hospital. Yeah. I'm going to just have a feel of your neck. My mum's a doctor, my dad's one of 11 siblings, of which 7 of them are doctors. I think it's just one of those things in Asian families in particular that there's a sort of, this is what our family does. Hi, it's Yasser. Who's that? I think in the back of my mind, me and my wife would probably both want our children to be doctors. My son probably wants to work for Lego. I'm sure they need a doctor. Just give me a second, I'm back with you.
Hello, St George's A&E. Adult medical, paediatrics, trauma or medical? Yep. Thank you, bye.
Paediatric trauma call, 15 minutes.
A 5-year-old boy is being rushed to A&E after being hit by a car and trapped underneath it.
Is it a trauma?
Yeah, 5-year-old low speed RTC, but he rolled under the car and they've said he's got a significant head injury.
I think with children it can be very emotive. From my point of view, personally being a parent as well, you'll tend to think of your own children. Amber, do you want to do primary survey or do you want one of us to do it?
You do.
The family members may be very, very upset and anxious. That's much more exaggerated when a child comes in as opposed to an adult.
Witnesses at the scene of the accident had to lift the car off the child for paramedics to treat him. His dad is travelling with him in the ambulance.
My boys, they go to the mosque after at 5 o'clock, after school basically, and it's just to brush up on their Arabic, learn how to pray and stuff like that. Normally they get dropped back home, Their like bus driver takes them to and from the mosque.
It's a trauma, paediatric male trauma.
Sadiq's son, Isa, was waiting to be collected when the accident happened.
My sister called. She was like, "Are you sitting down? Isa's been in a car accident." It really kind of hit me for six. I wanted to be there. My son needs me right now.
Amber, do you want to do primary survey or do you want one of our team?
Your dad? Do you want to pop it?
Do you want to do primary survey? Is that all right? Thanks.
Okay, this is Isha. He's a 5-year-old gentleman. He stepped out in front of a car and was subsequently rolled underneath the car, getting caught underneath the front axle. The car has been lifted up manually and Isha has been withdrawn manually as well. On our arrival, laceration above his left eye and around the left temple. Injuries from top to toe. He's complaining of difficulty in breathing with pain in his chest on the right side.
Do we know if the wheels actually went over the...
I don't think the wheels went over him. He's gone in between the two wheels and he's subsequently rolled underneath the number plate and the front axle.
So tell me what's upsetting, what's worrying you the most? What's hurting the most? Your chest. Okay, darling, okay.
Right, should we get him off the scoop and get these collars out of the way first, guys?
Doctors suspect that the impact from the car may have caused Isa serious internal damage, as well as a significant head injury.
Your normal expectation of a young child is that they want to get up, they want to sort of fight or resist you. And actually, he wasn't flailing around, he was actually very still. You're automatically more concerned that there may be more serious injuries. We'll do a chest and pelvic X-ray and basically assess from a head point of view.
Oh, my journal. You can hear me, yeah? If anything hurts, you tell me, yeah?
Isa's mother is yet to be informed of the accident.
I couldn't actually fathom telling my wife. She was pregnant, and to see her son in that situation, it would be devastating for her. So for me to break that news to her, I just could not say it.
We need a bomb, please. Yeah, ready, steady, roll. Okay, sweetheart. And we'll just stay in that position if you feel sicky.
Well done, well done, well done.
I just felt so helpless. And I was just praying to God, I was like, if it's all scars, it can be healed, but just make sure there's nothing else that he may not be able to recover from.
X-rays, both arms.
It's been 14 minutes since 5-year-old Isa arrived in A&E, having been knocked down by a car, trapping him beneath it.
What is going to happen, though, is we just need him to stay really still during the scans bit. We'll get you to come, just be with him whilst he's there.
He's been X-rayed, and doctors are sending him to CT to scan for any head or internal injuries.
Okay, he said they're just going to move you onto another little bed, yeah? But you have to just be still, okay?
Isa's mum, Tara, has been informed about the accident and is on her way to A&E.
Ready, steady, slide. There we go, well done.
I'm blessed in the way that I've got a wife, I've got 5 kids, and they all bring their own little touches into the family. With Isa, you'll be sitting there, and he will just walk into the room, and he will just come and kiss you on the cheek.
They're going to put you in this machine that's going to check you, okay? All right, they're going to check all your head and body and everything, okay? Isa, just don't move.
And fortunately for my boys, they're in a lot better off position than we were when we were growing up.
Don't be scared. Daddy's in the room, okay?
My mum and dad came over from India. They came from a kind of a poverty-stricken background. My dad had his qualification, but he had to do like the T-boy, the paper, sort of like dropping the letters in an offices and stuff, and work up the ladder. He was really grounded about, you've got to work hard, because of where he came from. Because if he didn't work hard, you wouldn't have not made it.
Breathe in and hold your breath.
And the biggest thing I've understood about growing up in Britain is seeing the opportunities and the vast opportunities that are available. And I want my kids to grow up making the best of everything that is available to them.
Can't see any fractures of his skull. Oh, hang on. What's that?
Well done, champion. Well done.
All right. So we're going to take him back to Resus. We'll wait there for the reports to come back, and then basically we'll have a look at him after that.
Specialist doctors will need to examine Issa's scans to identify whether he has any life-changing injuries.
Pool? In Dorset? Yes, I'm near there.
I'm going Saturday for 2 nights.
Oh.
Yeah.
What are you doing in pool?
I don't know. I just decided to go somewhere in pool. It looks really nice.
Oh, I cannot tell you like how happy I am just bringing out all these memories. So, where you should go is this.
Donald.
Retired actor Donald has come into A&E complaining of pain in his bladder.
I'm Dr. Nanjani, one of the doctors here.
Yeah, oh, good. What's your name?
Fahim.
Fahim.
Yeah.
Thank you.
I grew up during the war. When I was at a very good school, I was at Harrow School.
Will you be able to get on the trolley for me? And
you want me to get on the bed?
If you can, please.
I remember I was actually given 3 swishes of the cane for talking too much. Of course, all that is now out. You don't get beaten at a school, but I got 3 of the best.
How can I help you? I'll take that stick.
Thank you so much.
Keep it here.
Well, at the minute, I've got a problem with my...
Catheter, yeah.
It was last changed, but not so long ago, by the nurse yesterday.
This was put on by the nurse yesterday?
I think it was yesterday, I'm not sure.
Can I ask you a few simple questions?
Yes.
Do you live on your own?
No, I live with my wife.
How old are you?
I'm... I'll be 86 in October.
And can you remember this address, 42 West Street? I'm trying to check your memory.
Yes,
how good it is.
I've done this one before.
You've done this before.
42 West Street.
Ask you to recall it at the end, okay?
Yeah, sure.
I signed on to go into the Army and do my national service in the Royal Army Medical Corps because I knew if I signed on, I would stay put in the depot because in the meantime, I'd been getting myself involved in amateur theatricals.
When was the Second World War fought?
Second World War was fought from the 3rd of September 1939
Brilliant.
And ended in the middle of 1945.
Wow.
Singing in the Rain, that's it. Yes, I think watching Gene Kelly in Singing in the Rain has been one of my goals. It was a lovely thing to watch, and I used to think, oh, I'd love to do that. I really became involved with the stage, and I love doing stage work.
Do you know what year are we in?
2015.
My very first solo work was doing Old Deuteronomy in Cats, sitting on my throne in the middle of the stage.
And who's the monarch of this country?
Who's the monarch? Queen Elizabeth II. I was in Phantom the Opera. I enjoyed Phantom, but my happiest moments were in Cats.
And the address I asked you to remember?
42 West Street.
Okay, good.
I owe a lot to Andrew Lloyd Webber. He really has been my guiding star.
We've sent some bloods as well, and that would give us an indication if you've got infection or not. Now, one last question. You don't feel unwell in any way?
No, I'm feeling just slightly nauseous, but that's because I'm had anything to eat.
Would you like something to eat? You can have sandwich if you...
I'll have a sandwich if you have a sandwich, yes.
Fine. OK, I'll ask the nurse to get you one.
Thank you so much.
Not at all, pleasure.
Just relax your leg down, well done.
Good boy, honey. You are an absolute superstar.
Doctors are running further tests on Issa, as they suspect he may have sustained damage to his head and internal organs after being knocked down by a car.
Is the pain a bit better? Huh? Issa? Issa? Where is it hurting you now?
Chest.
In your chest still hurting?
Issa's mum, Tara, has arrived in A&E. It's the first time she's seen him since he left for the mosque after school.
Don't worry, does it hurt in your fingers?
Okay.
That hurts here, does it?
Yeah.
All right, OK, fine. OK, let's have a call.
Does
Does it hurt over here?
No.
Is this mum?
Yeah, this
Yeah, OK.
I heard that you're super brave, aren't you? It's okay, it's normal. I just don't like to see you like this.
Issa, he pulls at certain strings in my heart I don't think anyone has ever done. He really genuinely makes me smile from inside.
I'll obviously speak to Mum and Dad. It is that all the injuries he has on the initial report.
You have to stay, you know what it is, you have to keep that around your neck.
I mean, I've always wanted to be those people that, you know, I did want to get married, I did want to have kids. But my life was always work, work, work. I loved what I did. I was a makeup artist. I was happy, but there was always a little something missing.
He's just had his CCT scan and stuff for all the head and all the chest because of his breathing and stuff.
Then I met Sid.
Do you know what's happened? Has anybody filled you in with what's happened?
I didn't know anything. I should just, and then Aisha said to me that he got run over. I only knew that from there, but is he okay, Sid?
Tara, alhamdulillah, alhamdulillah. I really didn't want you to come see this now, Tara.
Obviously, I approached her, and because she's Muslim as well, we don't have like that girlfriend-boyfriend type scenarios. It's kind of like you got to talk to the parents and stuff and get the A-OK. I spoke to her dad. He wasn't too impressed initially, but yeah, we have a little meet-up. She had this feistiness in her.
I found somebody that's very similar to me in the way he was raised in terms of morals, principles, faith.
We're inseparable, and we've been nearly married 10 years.
You know how you do it?
I love her with all my heart. With all my heart.
Aisha rang me and said, look, Issa's been in an accident. Get yourself down there as soon as possible. Dropped everything, shut down there. He was underneath the car, between the two wheels underneath the car after the accident.
Is his chest okay? Yasser is concerned about the impact to Issa's chest and is looking at his initial x-rays.
So the issue is there is a question mark as to whether or not he may have a small collapse of one of his lungs. And if that's the case, it may need us to sort of put a small drain into him. But let's just take one step at a time. I'll wait for the formal report and then we'll go from there, OK?
Doctors will need to treat Issa's punctured lung, but his CT scans are being examined by specialists as there are signs that he may have further internal injuries.
I think my heart just sank. You know, is it going to be like a lifetime effect on him? How is it going to affect him as a person?
Once we've got all this sorted out, we'll have a closer look at things, exactly what else is needed. All right?
Okay.
Is he going to be the same? Is he going to be the same Issa? I was just petrified.
like a lion. That's fine. Very good.
They're going to cut the ring off here.
Oh, I misunderstood that. If they can't cut it here...
They're going to cut it off here. This is why you come to a hospital to get it done. It'll be all right, Mum. Just keep it elevated. Rosette.
Yes. It's swollen.
Yeah.
Right after Pilates.
OK, fine. You were doing Pilates at the time?
Not at the time, after Pilates.
Did you injure it during that?
No, this is it. I think...
How long have you had this ring for?
4 years.
40 years.
You don't mind it being cut?
Well, no, I don't know.
The choice between your finger or the ring.
Exactly.
First time I'm doing this with this machine.
Don't scare me.
It's fine, look, you're going to be all right. Is it hurting a little bit?
It's not actually doing much.
It's like my old can opener.
Just bear with us, Rosette. No.
They're working.
A 26-year-old man is being brought to St George's after slicing through his leg with a circular saw.
Do I want a trauma mattress on or not? This is going to be messy.
When there is a deep wound to the thigh caused by something like a chainsaw, irrespective of how deep the wound has gone, actually the rotation of the blades may cause much more serious damage to the bones, the nerves, the blood vessels. It's important to try to control the bleeding first of all, but also to try to assess what damage has taken place.
Ready? Yeah. On 3, 1, 2, 3.
One here. Tom, he was cutting some wood, inadvertently lowered his arm, circular saw into his leg. It was a little bit tangled, we had to take the whole saw apart, pull it out. The leg laceration was probably about 20 centimetres long and probably about 5 inches wide. Tom, you ready?
Yep. Oh, Jesus.
Staff need to urgently assess the damage caused by the saw blade while stemming the bleed from the wound.
I had the labourers round. They were building a lean-to for me. They were using a disc saw. I was showing them how to use it. The blade kind of caught into the trousers I was wearing because they were a bit baggy and just pulled its way through my leg.
Hiya, I'm Louisa. What's your name?
Tom.
Tom.
Nice to meet you.
Where's the pain? Just around the leg or...?
Just locally around here.
Okay. Is it throbbing?
Yeah.
Wow.
He's got green access over here.
That's into muscle belly.
Yeah. That's why it's so painful, isn't it?
That's going to be sore.
Can you lift it back up the way it was?
Doctors fear that the blade may have cut deep into the muscle tissue, starving Tom's leg of blood.
It's important to make sure that there's good blood flow in the blood vessels further on down from the wound.
You wiggle these toes for me. Good man, OK.
If there has been significant damage, that can result in impaired blood flow and, in worst-case scenarios, may result in an amputation of the leg.
You're on the side here? No, I can't feel anything. Well, do it again. No, I can't feel anything there. It did start to hit me. You know, I'm in trouble here.
There's nothing down here.
No, I can't feel anything there. I was thinking, if this is the worst case scenario, I've got to be prepared for it.
Speed it up, otherwise we'll be here tomorrow, mate. Yeah. All this fuss for a sprain, I might as well just walked home.
back of my head really hurt. Does it hurt, honey?
The back of your head now?
All
okay.
right, pocket.
It's been an hour and a half since Issa arrived in Resus after being hit by a car. Initial scans revealed that he has a collapsed lung.
Isaac, hi, it's Yasser, how you doing? I've got a child in Resus. He had a CT head to pelvis because the surgeons were concerned about his abdomen and plus of the mechanism. And
Yasser will need to determine whether he has other serious underlying injuries.
Issa, oh my God, I can't believe how brave you are.
Is he your youngest?
He's my second. I've got two younger than him at home. All my life revolves around my kids. And I've got that from my mum. She's sort of taught me to be strong. She was a very strong woman. She kind of like raised us on her own. She played, you know, a massive role in my life. Yeah, look, because we're just literally just waiting for some results. And as soon as the results come, if everything's okay, you can sit up and then you can have a bit of water, yeah? 3 months prior to being pregnant with Issa, my mum got diagnosed with leukemia. And through my whole pregnancy, I took care of my mum. I was, you know, doing daily trips to the hospital to be with her. You'll get water in a minute, okay, John? In a minute. My whole life revolved around caring for her, spending that time with her. And I remember every day of being there with her. I remember every single day. I remember the day that she passed away.
John, I have to go home. Not tonight, honey, but you're going to have a sleepover.
You're going to have a nice sleepover in the hospital.
I'm so jealous. I think it does play a big role, the fact that I was pregnant with him when my mum died. I felt he kind of like went through that journey with me.
Does it hurt now a middle bit? A little bit. A little bit, okay.
I mean, that void obviously will never be filled, but he did a very, very good job in terms of helping me move on. I love you. He just has this something that really connects me to my mum. He was, you know, one of the best gifts I've ever had.
he's vomited now 3 times in total, once since the CT. The reason I'm calling you is because they're not sure if it's a small extradural.
Any child that's been hit by a car, you know, because of the height of the child, it might hit them in the head or neck, chest, and actually that may lead to much more significant injuries than it would in an adult.
So I'll just give an update to have a closer look at the images now. So there is a concern that whether there is a small subtle bleed around the brain, okay? You know, is this something potentially, because it's difficult to say 100%.
As well as like a collapsed lung. Issa was found to have a small bleed in his brain. There was a concern about a critical head injury.
I'll speak to the neurosurgeons, they'll have a look at it, and we'll go from there, all right?
The parents, they want to know, is my child going to be all right? And it's difficult to be able to give them an accurate answer very early on.
You've been such a brave boy.
Of several kinds of cat, and my opinion now is that you should need no interpreter to understand our character.
Retired actor Donald came into St George's earlier with pain in his bladder. Dr. Fahim has been assessing whether the pain stems from an infection.
We do a bladder wash. I'll just check if you've got any urine in the bladder, okay?
During my life, I have been blessed. And I'm very happy that we've got 2 lovely children, a daughter and then a son.
Okay, nothing in there.
It's all right, is it?
Yeah, it is.
Thank you, dear. Both my children are in the film business. My son providing equipment, and my daughter is in the British Film Institute. She vets scripts and to say, yes, that's a good one, no, that's not such a good one. Our daughter's down at Cannes at the minute, at the Cannes Film Festival. We had a lovely house in Sheen with an attic, which I made into a cinema. Even had a projection room, you know, with projection holes, so we used to put on shows up there. We hired the amazing Mr. Blunden, and this was a film which we hired for my daughter's birthday. And I enjoyed doing that with my children. And it's nice to think that as a result of seeing that film in the attic, my daughter went off into the film business. I may be wrong, but I got a feeling that might have been one of the many things that helped her to do that.
Your blood tests are all fine.
Blood tests all right, okay,
Yeah.
fine.
After your tea, I think you can go back home.
Right.
Yeah, what I would suggest is drink plenty of fluids.
Yes.
And if you get pain, then just take a couple of paracetamol.
Thank you very much. I like to think I've done the right things with my children. They are my greatest joys.
With no sign of an infection, Donald will be sent home.
Take care. Pleasure.
It's been less than an hour since 26-year-old railway worker Tom was brought into resus after cutting through his leg with a circular saw at home.
I lost concentration. The disc was still spinning after. Just brushed into the leg and ate into the leg.
Is it the pain's a bit better?
Yeah, I've got it in the right position.
Yeah, it's because it's gone through your muscle, so any movement of the muscle is going to be sore.
Yeah. Thanks guys.
The wound is so deep that doctors have ordered a CT scan to see whether he has any life-changing injuries.
And have you contacted any family or anything yet to let them know you're
Not
here?
yet, I don't want to worry them. I don't want to worry. It's my family, they don't take stress well.
Do they not?
No. My family from Colombia, South America. That's where I was born. I came over when I was maybe a year or 2 old.
Oh, look, you're doing very well.
Thank you so much. Colombia, in the 80s, it was probably at the worst time. And they didn't want us being in danger. So my family wanted to come to England to have a better life and to have a better life for their children.
Very nice. Yeah, he is.
What's happened to the second orange?
Yeah.
My parents are originally farmers, so they had to sell their farm and everything to come here. It's a big sacrifice. It's the country where they lived and grew up. Could you lift my arm up?
Yeah, certainly. All right.
Thank you. My mother didn't speak English. She had to start from a very low-paid job, working in kitchens in schools. And then my dad, he was looking to be, for farming work. So it was a struggle for a while. It makes me feel a bit emotional because I felt very appreciative for it. Yeah.
All right.
Thank you very much.
You're welcome.
You've been great.
Can we do it the other way, my love? Try and get it off with some gel. Come to the sink.
Yeah.
How long has it been swollen like that for?
Now 3 hours, 4 hours
Okay.
now.
sure you don't cut them off easily.
No.
No.
Oh, man, that's...
Are you okay there? Do you want to sit?
Yes,
Nice deep breaths, OK? You're doing really well, really well.
Oh, I'm sorry.
That's it.
Has it moved a bit?
Concentrate on your breathing. Forget about what we're doing.
OK.
See this ring cutter, sweetheart?
Keep breathing.
The baby would have been born by now.
Yeah. Do you know what you might have to do, Caroline? Is just ring, I know it's strange, but ring the local fire brigade and ask them if they've got, just ask them if they've got a small ring cutter, they could come and do it for us. There's so much.
It's swollen now.
Yeah, look, I think it was swollen before.
It's Yasser, how are you doing? I've certainly cleared his neck, so I've got him sitting up now, giving him a drink of water. But yes, he's awake, he's orientated.
Earlier today, Issa was hit by a car. He has a bleed on the brain and a punctured lung.
Did you like that drink? Do you want to have another little sip?
So I'll give an update. We're just going to observe him overnight. As there potentially query is there, so whether there's a small bleed. Again, it just needs observation. We'll give him lots of pain relief overnight. I've spoken to the paediatric surgeons who are going to admit him overnight, and they'll just keep an eye. OK, cool. That's fine.
I've got 4 boys over the age of 2. I want them to grow up humble, loving, be thankful for everything that they have, and have a good impression on society.
Daddy, I've got a tummy ache.
You've got a tummy ache? OK. You've got a lot of medicine in you. You did get hit by a car as well, so that must be hurting a bit.
When my mum and dad came over from India, they had to build everything from scratch. And now we are successful in our lives. Like, I've got my own building firm and my family.
I'm so proud of you, so brave you are.
Champion.
I look at my dad's commitment as a foundation to see his children and grandkids growing up and succeeding in life and what they're doing. I think that's the biggest, accomplishment for them.
You're gonna go upstairs now and you can have a nice little sleep, yeah? I love you so much.
Issa will be admitted to a ward for further tests to determine whether his injuries could be life-changing.
Hi there. Are you waiting for the ring to be put on?
We are, yeah.
Can I have a quick go as well on Paul? Hello. Oh, bless you. Sometimes we can get it off with some gentle...
I know, she was trying, the poor thing.
Can I try?
It's not coming off, for Christ's sake. Oh, you are an angel. I'll take you to... Shall I bring you some wine? I'll take you to dinner.
Do you know what? Your thanks is enough.
No. Thank you so much.
Yours.
Bye-bye.
Is it meant to make that noise?
Yeah, you're meant to. That means it's working.
26-year-old Tom came into resus earlier, having sliced through his leg with a circular saw.
No, but it's gone through all that muscle, belly. What muscle would that be? Rectus.
Doctors are examining Tom's scan results to determine the damage to his muscle, nerves and blood supply.
How's it look in the scan?
It is down all the way down to the bone. We've got a little spike of metal in there as well, so we need to get that out, wash out all the bone, and keep you in for antibiotics after that. So
Okay.
I'm just going to leave you with the infants and
are you just going to stitch it together?
It looks like it's going to be a bit too large to stitch, so you might have a vacuum dressing over it for a little while. So it's lucky you didn't get your artery, that's the main thing.
Tom will be taken to theatre, where he'll have emergency surgery to his leg.
It's not easy, you know, coming from nothing. When my family came to England originally, my mum, she had to learn English and study. And at one point, my mum had, I think, three or four jobs. And then she's now an accountant, so she's come a long way from where she was. The main thing they taught me is the value of hard work, really.
You're waiting for them.
No worries.
Not ready for you yet.
I don't want to hold up anyone.
You're not holding up anyone.
Immigration is inevitable. People have to make these choices, go different places to better things in their life and better things for their children's life. It's part of being human. Yeah, you've all been really good.
Oh, that's nice.
Fantastic. I really hope David Cameron has mercy on everyone. Because I really don't think there's good things coming. But I will protest for you guys. I'll protest.
Thanks very much.
I will. I'll be there. I'll protest against Cameron.
Oh, this shift has just flown by. This shift has just flown by. Just suddenly looked up the clock and it's like, it's nearly home time.
St George's Hospital's had quite a big role in my life. My father was a patient here for many, many years. In fact, he had the first ever kidney transplant at St George's. He passed away a few years ago now. There's certainly something very emotional about coming back and working in that same hospital. And I think for me, because my father was always a very, very strong influence on my life, I try my best to sort of think about all the things that he taught me and try to do the same things with my own children.
Gee, all right, fine. Let me just finish.
Yeah, no, it's just that.
If I end up being half the father that my father was to me, I think I'll have gone a very long way and my children will be very, very happy with me.
I'm very grateful to be coming up to my 86th birthday. I won't get up and do a tap dance, but I think the answer is keep going at all costs. That's my motto, keep going at all costs.
I'm the first person in my family, immediate family, to buy property. And I've basically raised all the funds myself, worked very hard. Coming to England, it was the best decision they could make. And as you know, I'm a good testament to show that they made a good choice, I hope.
It was scary at that time. It was scary because it was just sort of a waiting game. You know, is it going to be permanent? And it was heartbreaking because there's nothing you can do. There's nothing you can do.
I believe that when you have children, you're not living for yourself, you're living for them. And when I sort of see that they're going towards a certain goal, I will then sort of like 100% be behind them and committed to them in whatever it is they're doing.
What do you want to be when you grow up?
A doctor.
Why?
Because they help people.
What will you tell your brothers about cars?
I said, wait. I said, be careful around the road and look side to side.
Crack, I heard it.
Keep breathing, Dan. Good boy, keep breathing.
And how often do you fall? Never.
You never fall?
No.
Hello, St George's.
Really got to be quick here. The heart rate of 250 is a genuine medical emergency. We're going to electrocute him. Everybody clear? We shot coming up, sir.
I thought, my God, this is bad.
Boom.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before. We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked by the horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie!
Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
A&E, can I... Oh!
I'm 22 and I'm playing with a train.
Nice.
Hang on a minute. I can feel something on my toes.
Resus.
In charge of Resus today is Melissa. She's been a consultant at St George's for 7 years.
Yeah, if you could come down now, I can take the handover with you, and if there's no other concerns, we'll just leave you with the leg, if that's OK, obviously with patient attached. OK.
Half my family are doctors, so when I was little, I always said that's the last thing I'd do. But I just started thinking about it when I was probably about 15, 16, and realised I did actually want to do it. I was just being stubborn.
Hey, Pickle, can I have a look at you? Hey? Look, what's that?
If you've had a really hard day, you can't take it home with you, otherwise you go nuts, really.
I think it's got slightly reduced air entry at the left base. Nothing else.
Obviously, talking to your friends and your family does help. I tend to go to the gym a lot or go to, I don't know, I'm into salsa at the moment. I'm completely incapable of doing nothing. I sometimes have to actually write in my diary, do not go out. It does look like I'm just sat here on my expanding backside, but that's not true. There's some things I wouldn't do, like I wouldn't ever ride a motorbike because I see awful things all the time. And I certainly would think twice about cycling in London. But it shouldn't stop you doing things, knowing that anything could happen at any time.
Hello, St George's. Is it medical or trauma? Cyclist versus a car. Yep. Intubated. Yep, thank you, bye-bye. Adult male trauma call, 10 minutes.
A 43-year-old man was cycling home from work when he crashed face first into a car.
Did I just hear something?
GCS3, cyclist.
Ooh, that's bad.
Not suitable for direct CT. Because of this hemorrhage in the face that they can't really control, yeah.
Doctors at the scene had to put him into an induced coma as his airways were blocked by serious facial blood loss.
How long have we got?
10 minutes.
We obviously want to get a patient through CT scanner as quickly as possible. That will give us a much better idea exactly what their injuries are, but you can't send them if they're not stable. You're not in the room with them when they're having the scan, and it's not the best place to resuscitate someone.
Are we having the other anaesthetist come down? Because we've got a GCS3 with a facial trauma, so that's probably quite a good one for an anaesthetist.
Fall from bicycle. Another bicycle day.
His wife Suki is at home 15 miles from London and is yet to be informed of the accident.
I just had this sense that something had happened.
Can you grab the lead apron?
John was going to try and come home a little bit earlier that day because my son had been on a school trip, so I'd made an early dinner. He was quite late. I thought that was really weird because whenever he was late, he always called. I rang him, kept ringing him and leaving messages. It was really frightening that I couldn't get hold of him.
It's a 4th cyclist we've had today.
About 10 minutes later, the doorbell rang, and I could just see the silhouette of a policeman's hat, and I just knew.
Oh, that's a very gory one. Oh, God, he looks very unwell. Cool. Can we get the curtain shut? Jeez, that's a good going from a bike.
Ready, set, lift.
Everyone ready to listen? Yeah. He was cycling, wearing a helmet, coming down a hill when a car has turned and he has T-boned the side of the car with significant damage to the side of the car. He has significant facial injuries. He's got lacerations to the frontal face and nose. His nose is completely destroyed. He's got dental loss as well. He's had a significant lot of suction, 3 bottles of blood out.
Okay, great, thank you. With a cyclist, if someone was coming with head and face injuries, you'd worry about whether there was a bleed in his head, whether he had bruising in his brain. But often there's other injuries as well. And you need to constantly monitoring them and reassessing them because things can change really fast.
Okay, great. John, primary survey, please.
Symmetrical breathing.
Blood pressure, I can see your head.
139, 136, 98. Heart rate is 46.
Can someone check pupils, please?
Pupils, minimal response.
If you've got increased pressure in the brain, the pupils won't react so well. That can be very serious.
John will need an urgent CT scan to determine the impact to his brain and spine. But there are concerns that he's too unstable to be moved out of resus.
You're max fax, are you? I wouldn't want to take anything off until he's had a CT. I just want to make sure he's stable enough we get him around to scan it.
Even before I opened the door, I was thinking, how do I manage this and protect our children?
Have we got family here?
His wife is going to come in.
Everyone happy?
Okay.
I felt dread. Your whole stomach's just scrunched up. I thought, not like he was dead.
"43-year-old John came into A&E after crashing headfirst into the side of a car.
You're happy with the tube, the top end, and the vent settings and all of that? Fine.
He's been stabilised, but needs an urgent CT scan to assess the injuries he sustained to his head, neck and spine.
That's the...
Fine. So go to CT now.
A head injury can be anything from just a minor bump on the head to a huge bleed and a catastrophic brain injury. And depending on what you find on the scan and how the patient is, it depends on whether anything needs doing, whether the patient needs an operation or not.
Cyclist going downhill, I mean, but for a bicycle to make that big a dent in a car, that's quite an impact. Because it's two windows, both side windows have gone on the near side, and the whole two panels are really dented in as well. We were going to get a full scan.
Breathe normally.
John's wife, Suki, is on her way to St George's.
We met on a blind date. He and his friend had been single for a long time. They had a deal with each other that they set each other up with one date a month.
Breathe in.
And I'd said in my text, you know, how will I recognise you? He said I'd be the one with the homegrown rose on my dashboard. And I thought that was quite sweet. He drove 2 hours by car to pick me up. It was really old MG, I think 1972, convertible. And he just got out of the car and he's very tall, obviously very athletic looking and sort of slightly loping, a bit clumsy, just with these, you know, big smiley eyes. It just was just so easy straight away. I knew pretty quickly, I think, just because he was so kind and gentle and very, very bright. John was a geophysicist. You know, he loved physics, got a brain the size of a planet. Quite soon after I met John, he said, oh, I didn't sleep very well last night, and he'd been trying to calculate the density of the Earth. I mean, how many people do that in their free time for fun? But there was no bragging about it, and it was just really attractive. My brother once said to me, John makes other guys look bad. There's just so many lovely, happy memories. He'd cycle over from where he lived and put something on my doorstep, so when I woke up in the morning it was there, and instead of ringing the bell it would just be there as a surprise. It was just really romantic.
Doctors must wait for his scan results to confirm what further injuries he may have sustained to his head, neck and spine.
Oh my God, Sam, you never did that. She did, she just saw her.
apple pies again. Nikki done the banoffee. Mary done the peach tart.
And the treacle cake came out okay, you know?
Yes, it was grand.
Patricia?
Oh, Michael, Patricia. Watch Dad's feet and watch my leg.
68-year-old Pat has come to A&E with her son Michael and one of her grandsons, Darius, after injuring her leg whilst on holiday.
My name's Claire, I'm one of the nurse practitioners. Tell me what happened. My grandson, one of them, had kind of threw himself backwards and knocked my legs out from under me.
So you had all the x-rays, there was nothing broken?
No.
Is the pain getting better or not really improving?
No.
Okay. And who do you live with?
Myself.
It was the first time we'd holidayed for a while. We'd always holidayed together as one big family. I talk to my mum every day on the phone. I see her most days. For her, family is everything. I remember growing up as a young child. She was working 2, 3 jobs at a time. She always wanted better for us and was always there. She was a very, very loving mum.
How was it getting up and down the stairs?
Very difficult.
Is it a 2-storey house?
Yeah.
I remember one year we went on holiday around London because my father was in the 2nd Battalion Grenadier Guards. He'll show us, you know, where he stood guard at Buckingham Palace, where he was at Westminster, all of these things that happened. We, as young kids, thought it was great.
Ah, yeah, it's bruised at the back as well.
We never had big cars and big boats and big houses and big beds or anything. We had each other, and we discovered that later on in life that how important that was.
Is it painful down this side?
Not so much, but... Oh, yeah, that hurts.
Well, we're going to have to redo the x-rays. Do you want any painkillers just now?
Yeah, I could do with some. I got married at 16, and I suppose I was a bit of a rebel. But my husband, Frank, he was calm to my storm. When we got married, people said 16 and 19. They thought I was pregnant, but I wasn't. I remember there was an old lady where we lived up the road, and every time I went past, I could see her eyes following me, and she's just looking. And after about a year, I saw her watching me, and I turned around and I went, this pregnancy's really taking a long time, isn't it? And she just, boom, shut up.
Thanks. Appreciate the leg.
I knew that I was marrying for life.
Patricia?
Yes.
Hi. Porter's just going to take you down for an x-ray.
OK, see you later.
Pat's x-rays will confirm what damage she's done to her knee.
We had a lot of ups and a lot of downs, but we never ever went to sleep on a row. And we never went to bed without telling each other we loved them. Together for 49 years. Whoa, don't you drop that on my knee. That's all I need.
Do you know what we used to love? The Marks and Spencer's chocolate fudge cake.
Oh, yeah.
With fresh cream. Wasn't it lovely?
It's like a space shuttle, yes.
It's been 15 minutes since John was scanned in CT for brain, neck and spinal injuries.
So, once you're happy, I'd like to take this off.
I'll come and hold it.
Yes, please.
Whilst doctors wait for his results, specialist surgeons must assess his facial injuries.
No, pelvic binder can come off.
His wife Suki has arrived at St George's.
We were married within a year. You know, I was looking for someone that was kind, gentle, funny, intelligent, you know, fit, sporty like me. You just get to a stage in life where you just know. I don't think I've known him go more than one day without exercise. Yeah, it was his passion, you know, he just loved it. Occasionally, he'd get up early and take his bike to work. So that was about a 2-hour ride. I always tried to get him to take his phone. I mean, you hear about so many, you know, accidents in London on bikes. I worried about him all the time.
So I'll leave you to deal with his facial injuries. I'm going to go back to CT and speak to them as to see whether there's anything on the primary report. His wife is aware, and we'll get her in a little bit.
Radiologists have John's full scan results.
Hello. Ah. It's lots of writing.
Yeah, lots of problems.
The abdominal organs look fine. Yeah, in the brain, he's got some small contusions. He's got multiple spine fractures.
Are they all?
They're unstable fractures. But it's really probably the worst thing he's got this.
The scans reveal multiple fractures to John's face and spine, and a bleed on the brain.
If somebody's got a nasty fracture to one of the bones in their back, it can be really serious. I mean, it can mean the difference between someone walking again and somebody not walking again.
That's a horrible looking T5 fracture.
God.
Really most concerning.
Cyclist John has a spinal fracture, facial injuries, and a bleed on his brain after crashing headfirst into a car.
So if you want to come and see him just now.
It'll be the first time his wife Suki has seen him since he left for work this morning.
No, we're not going to be waking him up for a while. He's on medication to keep him asleep. Okay. This is fine. So I know it's a lot to take in. He's got a bit of bruising in his brain. We will speak to the neurosurgeons about it. He's got some broken bones in his neck and his back as well. I'm going to speak to the spinal surgeons about that.
And could that result in any paralysis? We just don't know.
What you worry about is if there's bits of the bone that's sort of sticking out the back of this, what's called the spinal canal. In his case, there is a bit sort of sticking out a bit, so we need to wait and see at the moment. Okay. Is there anything else you want to ask at the moment?
Well, if Tracy's coming in.
Will you be able to hear me? Just chat to him, yeah. He should be able to hear you, hopefully, so.
I knew 2 people who had died as a result of brain injuries, people my age. So I knew how serious this could be. It was very shocking seeing him like that. I mean, it really does go into slow motion. Whenever anything bad used to happen, if you had a tricky day, you know, the person I'd want to talk to was John. I just want to tell John about this. He was my source of comfort and reassurance, and the person that would wrap you up in your arms and say, it'll be okay, but he couldn't do that.
Is he coming home from work? What does he do? Oh, right. It's very clever. Have you guys got kids? How old are they? 8, 6, oh, bless them. Oh dear. He needs to be, he will be. Might just be a bit of recovering time.
Doctors are waiting to hear if John will need urgent facial surgery. They still don't know when they'll be able to wake him from his induced coma. Only then will they find out the extent of his brain and spinal damage.
A&E St George's. Yep.
An 89-year-old man is being rushed to St George's with severe chest pain.
Adult priority ETA 12 minutes.
Chest pain is probably one of the commonest things we see in the emergency department. If someone's young and fit, you wouldn't be too worried usually, but you're more likely to have something significant like a heart attack if you're 80-something.
His wife, Anne, has travelled with him in the ambulance.
Right, Libby, this is Adrian. He was sitting having his lunch when he got acute left-sided chest pain, as if somebody was sitting on his chest with pressure.
Okay.
He has a pacemaker, but he's never had chest pain before.
Adrian doesn't like being in hospital. He's had every possible operation. He had a pacemaker put in, so I was determined to find out what was wrong with Adrian.
Do you have pain in your chest at the moment?
I do, just there. As if it's a heart failure or something feeling.
And if you take a really big breath in, how does that pain feel then? It increases. Okay. Now, I'm just going to uncover your chest completely just to put some more sticky labels on, and we'll get an ECG.
Health problems? Yeah, I don't want to think about them because, you know, it's been a very hairy time. We're absolutely exhausted at the moment. But then he doesn't make a fuss about anything. He's very brave. He's supported me and I've supported him.
The medical team need to take a reading of Adrian's heart and do a blood test to confirm whether or not he's having a heart attack.
Hi there.
Hi.
I'm Dr. Newfer. So you have been experiencing chest pain, is that right?
I've got it right there. I can still feel
there.
it.
Okay. How long has this been going on?
Since lunchtime,
Okay.
it came on.
Yeah.
He was sitting down with the tray on top of his knees, watching television, and suddenly warm.
Yeah.
He never finished his salad.
Okay. What we're going to do is I'm going to have a look at your ECG. We'll await the blood result. Yeah? I'll be right back.
Right. No. It's come as a shock for you, I'm sure.
Yeah.
And I feel the same.
Yeah.
Parsnip, sweet potato and beetroot. At least, you know, they're
very unusual taste, isn't it?
Better for you.
Yeah.
Big fish, a little fish, cardboard. You're doing it too fast, dude.
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 Dude. It's like big fish, little fish, cardboard box.
I'm really thirsty.
On Friday, how do you do?
Shut up.
68-year-old Pat came into A&E with her son Michael and grandson Darius, having injured her knee whilst on holiday. They're waiting for the results of her earlier X-ray.
Can I ask one of you guys to go down to the pharmacy to pick up a prescription for her?
Yeah, he's enjoying it.
No worries.
I don't know if I could say she was independent. My father did a lot of the physical parts, like the driving, the shopping. He'd open the door for her. He'd help her in the car. He was a gentleman. To me, he was just a loving, caring father, but a friend. I mean, he was more to me than a father. You'll have to fill out the form, but Nan doesn't.
I don't pay.
Yeah. Because she's a pensioner.
Yeah, because you're old.
Shut your
Mwah.
I think it was 1969. Frank was at Northern Ireland for 5 months, and their job was to go over and disarm the B specials. I didn't know who's going to get shot or is he going to be hurt, and that if anything happened to him, there'd be the 2 boys and I. You know, what would I do?
If your family's relying on that more and more.
I always look forward to him coming home.
I'll x-ray the whole lower leg.
In every letter, he told me he loved me. Oh, you're too good for me. No, I loved him. Still do.
Jesus, lady, my knees
You're
hurting.
winding again?
My knees are hurting.
Yeah, that's because you broke it.
I haven't broke my knee.
Emergency nurse practitioner Claire has got Pat's X-ray results.
Hello.
Hiya,
Not good, what?
Well, you have got a fracture.
I have. I've got a fracture.
So we'll put you back in the brace. I know, sorry, that knee needs to be kept immobile. And then we'll get you seen by our physio, okay?
Okay. Yeah. I've got to go stir crazy being stuck indoors.
Dad began to not be able to do things that he enjoyed. He would say, I just haven't got the energy. So he went to the doctor and they'd sent him to the hospital quite urgently. I think it took a few visits before they diagnosed that he had bowel cancer. But he was very positive. He was, you know, fine, quite accepting. He never said, why me? But my mum's confidence was shaken. All right, I'll see you in a minute. Yeah, I'm just gonna
Okay.
He died in my bed. And I've still got the same bed. I won't get rid of it, you know, because it was ours. I still sleep on my side of the bed. I quite often wake up in the night and do this, pat the side of the bed, you know, and there's nobody there. It's been 3 years. He wasn't just my husband, he was my best friend. He was everything. If it hadn't have been for the boys and my grandchildren, I would want to go with him. Because I didn't want to be without him. It's like losing part of you has gone. Maybe with me, my best part had gone.
Are you in pain now?
No, I know it's there.
Do you?
89-year-old Adrian has come to A&E suffering with chest pain. His wife Anne is with him.
Has it upset you?
It's worrisome, isn't it? When you feel it can't, it has to be the heart.
Doctors need to find out more about Adrian's medical history to see if he has any underlying conditions that could affect his heart.
Okay, any heart problems in your history, in your past medical history?
I don't think I have, have I?
This is not a surprise.
Angina, anything like that?
No, in fact, I've always felt I'm extraordinarily fit.
Okay.
You know.
Do you smoke at all?
I did, up till what, how long ago?
Just a few years ago.
It's appalling. I can't remember any of these things.
Well, it's a good thing you have such a nice wife then that can remember
right.
stuff.
Before I met Adrian, I was married to somebody whose hobby was music. And I'm a bit deaf, so he married another musician.
A couple of deep breaths.
And I'd been bringing up my three sons for years on my own. I was invited to a party at a doctor and his wife's home. I saw Adrian across the room, and I said to my friend, "Who is that gorgeous man over there? I'll introduce you if you like," she said to me.
Any shortness of breath when you lay down?
We got on very well, but he was going off for a year. In fact, I never asked him where he was all that year, actually. I could do that sometime.
Okay, so what we're going to do, my colleague already did the special blood test, so we're going to await the results, and we're going to do a chest X-ray as well.
Right.
Yeah?
Where's the bar here? That's
The bar? I haven't found it yet myself.
Oh, dear.
If you find it, just come
I'll
tell
let
me.
you know, yeah.
Okay.
Sooner or later. So we're thinking of doing that. We've achieved good results.
Specialist surgeons have come to discuss John's surgery.
The face, we'll see how
I was very focused on the practicalities, but still, you know, my stomach was churning.
From my supervisor, the question was, it had been treated as life-threatening or life-changing?
Life-changing. We need to look further at the scans. He will need more tests at some point.
John will need to go to theatre for extensive surgery to reconstruct his face. He'll be kept in an induced coma until it's safe to wake him up and assess the extent of the damage to his brain and spine.
Children are kind of like the heart of our family, really. They're sort of everything. You know, he just sort of lit up when he was around kids. I was thinking about, what does this mean? What if he doesn't get better? We're a family and it just wouldn't be the same.
While doctors wait for Adrian's ECG and blood test results, they want to give him an X-ray to see what has been causing his chest pains.
So, you're going to have a chest X-ray?
Execution squad, by the look of it.
I know, it's quite something, isn't it?
Quite soon after meeting, I didn't see him for a year. The next time I saw him, he rang up and he said, you know, can we have a meal together? And so I said, yes. He was obviously back from whatever he'd been doing. It just went from there.
I think you ought to know I've been in prison.
In prison?
Yeah. So you better watch out.
Uh-oh. Okay, I will.
I was in prison for really 30 years,
as a governor of Pentonville Prison, which is certainly for serious prisoners, sometimes murderous, but you've got to try and get round 400 prison cells every day to make sure they are aware that the governor is keeping an eye on them. It's a very difficult place to run, really. And therefore, my family lost out on time available with their father. It does take an enormous toll on family life.
Thank you.
I'll just get everything. I'll be back in a minute.
Adrian's full test results have come back, showing no evidence of a heart attack.
So, you're a bit too good for this area, and you're going to come with us. OK. So we're not leaving you along the way or anything, don't worry.
I don't want to get married again, no.
Oh, that's nice, isn't it?
My second wife, Anne, fortunately came after I'd almost finished my career.
Oh, I'm trying to persuade mine to even ask me the first time. I know. What can you do with them, eh?
Do you miss it?
No. I think my wife has replaced the prison quite well.
We've got a lot in common, and we never stop talking, because he's such an interesting person. We're absolutely right with each other. Adrian's greatest love of my life.
30 years retirement has been a very happy time. And now, at the age of 90, I can't complain at all.
Adrian will be closely monitored on a ward, where doctors will decide if he needs to stay overnight.
I'll never be a sportsman. Oh.
You okay?
No, I've got pain in my knee.
The x-rays of Pat's leg have revealed a broken bone in her knee. Physiotherapists have been called to see her.
Oh, is this the hospital's one? Is there anything interesting?
Yeah, will you stop it?
Have they mentioned how large her nose is? Oh, yes. They say, it's one page here, it says, huge nose. Yeah.
Hello.
Hello.
Hi, I'm Sarah, one of the physios. Hi. How are you? The doctors obviously come to us to see you about the knee, so they do know that there is probably a small little break there. But with the type of injury you've done, could well be some involvement with your ligaments in your knee.
Yeah.
But the X-ray won't show that exactly, so I think you're going to go to a clinic appointment tomorrow.
Tomorrow, yeah.
Here. So why don't we get you in the new brace?
OK.
And then we'll see whether we can get you up.
Family to Frank and I meant everything. Still does to me.
Come out straight, well done.
Whichever son, my Michael, my Brett, my grandchildren, the last thing I will ever say to them is that I love them. Even the boy, 28 years old, the eldest one, and I still tell him I love him, and he'll tell me the same thing.
Pat will be referred to the specialist fracture clinic at St George's to decide whether or not her knee requires surgery.
You know, we'll all pull together. It's how we survive.
Oh, weather's good.
Life is hard. It's hard. We've got no silver spoons in this family. No one was born with one. Barely a wooden spoon. But we've got each other, and that's important to us.
Oh, that's it. Run away. Run away from me. I'll try.
JJ? What is it, a boy or a girl? It's a girl! It's a girl! I was expecting a girl. Oh, I'm sorry. No, I'm so sorry.
John didn't seem to be coming round from the sedation as quickly as they had been hoping. And then he went for another scan, and that's when they told us that he'd had a traumatic brain injury. And at that stage, they couldn't tell me what that meant. There are so many unknowns, and it's a waiting game. They told me it could mean personality changes, difficulty in speaking, he'd have any memories of anything. I didn't actually know who this person was going to be anymore. Potentially could have been a completely different person to the person I'd married.
The first thing I can remember after the accident, which I suppose is probably a few weeks later, was watching the nurse take down the cards from the previous occupant because they were on a very high string and she couldn't reach the string. I had to relearn some ways of talking. It's a strange feeling in a way. The lips, you can send the message for them to move. Just the sound of the words coming out is a bit different to how it was before. And having Suki there made all the difference. She's my strength, and she's my one of the main reasons for being here, I would say. So she means everything to me. So my nose is a slightly different shape now than it was, and I used to have a full head of hair. Not really.
Oh, your finger's out. Oh, idiot.
George's resus.
And me and George was just riding down to the motorcycle shop. A car driver sort of just pulled out, and before I knew it, just was bang on the floor.
44-year-old kicked by a horse.
Why didn't you phone me?
Oh, God, that fucking horse. Excuse my language.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked by a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie. Down below.
too slow.
Love.
Such a good boy. So proud of you.
And loss.
I'm still here.
Unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
Did I tell you about the time I had laryngitis? I woke up one morning, I couldn't speak at all. You don't sound at all worried about that.
No.
You sound quite relieved.
You speak way too much loud, so there's no, like, it would be nice.
100 ambulances can arrive at St George's emergency department every 24 hours. Consultant Will is in charge of resus today.
Yeah, that was it. I was just going to pick the brain. Hello, A&E? When I was a little boy, what did I dream of being? I don't think I could make up my mind. Astronaut, fighter pilot, superhero. Same as all little boys, I think.
No obvious long bones.
Well, he's got long bones, but no obvious fractures. I was really interested in dinosaurs when I was little, and then realised there weren't any more of those around. But I got really interested in biology. I thought it was fascinating how living things work. You've basically got cells that can no longer utilise oxygen. So what will happen to your heart?
We'll just stop. No.
Eventually, yeah, but that's again something that happens to us all eventually, isn't it? I'll go away and read about something for work, and then I'll just find myself shooting off on a tangent, just trying to learn the most obscure random bits of information just because they interest me. The only nation-state that had papal compensation to do dissection was Venice. I'd definitely describe myself as geek without the chic.
Hello, St George's. OK.
A 75-year-old man is being rushed to St George's Hospital with a dangerously high heart rate.
Yeah. Yeah.
When you're waiting for that patient to arrive, you've got a lot of things rushing around in your head.
Yeah. 10 minutes. Bye.
You draw up a little mental checklist of problems, and then, of course, you've got to figure out how to fix it.
He's being brought in from his home in Wimbledon, a few miles away.
Can you take that one into one?
The man's wife, Julie, has accompanied him in the ambulance.
Jerry wasn't feeling very well that week, but he kept saying that he was all right. On the Friday, I went to work in the morning. I got home about 5:45 in the evening. I said to him, "My God, Jerry, it's so hot in here." He said, "I'm frozen." He said, "I feel so cold." And I was thinking, I've got to do something. So I rang 999. They loaded us all in the ambulance, and when they listened to the heart rate, it was through the sky. and I thought, my God, this is bad. This is really bad.
It's been 7 minutes since Jerry left home, and his condition deteriorated further in the ambulance.
Gerald, basically since last Saturday, he's been feeling unwell, short of breath. He's got AF.
AF, in really simple terms, is when your heart starts to beat quite quickly and irregularly. If your heart is beating really, really, really quickly, it can lead you to have a cardiac arrest.
Do you want to pop the pads on? Can I just check your pulse on your wrist, sir? And, oh, you've got a second hand on your watch, that's handy. Okay, you tell me when you're ready to go with that. Now that'll explain why he looks rotten.
A heart rate of 200, 250 is a genuine medical emergency. That's an unsustainable rate for your heart to beat at.
With his heart rate peaking at 262 beats per minute, Consultant Will urgently needs to give Jerry an antiarrhythmic drug in an attempt to return his heart to its normal rhythm.
If it slows you down enough, then we can see exactly what the problem is. So if you're ready, we'll go ahead and do that right now. So it'll feel a bit funny. Just nice slow breath, see if it does anything at all. Boom. Oh, it nearly worked. It slowed right down and then it went nuts again.
Doctors must now deliver an urgent electric shock to Jerry's heart to stop it beating so fast and prevent him from going into cardiac arrest.
We're going to electrocute him.
20 minutes ago, 75-year-old Jerry was brought into A&E with an extremely high heart rate. Doctors have been unable to slow it down using drugs. Now their only option is to try and return his heart back to a normal rhythm with an electric shock. Jerry's wife, Julie, travelled with him in the ambulance.
We've been married 15 years now. I had been working at a construction company and Jerry was working there as well. And I knew Jerry, you know, because obviously you just see people every day in your working life.
So pads on, but monitoring through the leads. So we need to put the 3 leads on from there.
He used to come down to our office. I worked with my friend Anne and, you know, everybody used to just be very, very friendly there.
Right, we're gonna get on, give you some sleepy stuff. Get on and do this. Is it all right if I take your glasses away just now?
Yes, of course.
All right, matey, we'll get this all sorted for you.
They were having this quiz at a pub and it was for the company, you know, everybody who worked there. They had to get teams together. Anne at that time was single as well, so she said Jerry wants to go, so we could make a team. We were having such a good time that Jerry got hold of my hand. But it was sort of like to do with the competition because, you know, we're doing well, we're doing well. I must admit, Jerry holding my hand, it was such a lovely feeling. It was like a warmth. When you're on your own, nobody ever cuddles you or you've never got anybody to put your arms round because you're totally on your own, so you don't have any of that physical contact with anybody. You just don't. And then for somebody to hold your hand, it's a lovely feeling.
Check patient. You feeling sleepy at all, sir? This is really got to be quick here. If you're going to provide somebody with electricity in that sort of situation, there's a danger if you do it incorrectly, you can make things worse. So sync on. If you trip the heart into the worst rhythm, the main pumping chambers of your heart won't beat in any sort of coordinated fashion, and that is not compatible with life. Okay, so charging. Okay, everybody clear? Okay, we shot coming up, sir. And we're fixed. All done, sir. All finished. All done, okay? Your heart's going back to normal now, okay? Still feeling quite sleepy. Okay. We still haven't got past the other issue, which is that he's got underlying chest sepsis.
Yeah.
So we're not better yet.
We're just going to check your blood pressure one more time now. This is going to get a bit tight. We need to figure out why your heart did this and see if there's something that we need to treat. Yeah. Possibly an infection.
Good. I'll go and have a quick chat to his wife.
Can you lift it up and down and bend it at the knee? Yay.
Give me your croissant. Your croissant is what I want. Thank you. Bitch.
I wish I put makeup on. You look pretty without it. Pretty ugly. No. Never going to bag me a doctor with looking like this when I come in A&E. Actually, this is quite nice, isn't it?
Not bad, is it?
Well, it's not, you know, how you imagine A&E.
92-year-old Margaret has come into A&E with her friend Yvette after falling over and hitting her head.
Let me have a look. Nasty, nasty.
Is it?
Yes.
I joined a class, a day class on Italian art, and I ended up in the front row sitting next to Margaret.
It does hurt when you touch it.
I don't touch it.
No.
We hit it off immediately.
Crack, I heard it. Oh, horrible.
We go out to lunch. We go to exhibitions sometimes.
I'm a mage. You must have a really tough skull.
I'm a tough old nut.
A tough old bird.
We do have a birthday on the same day. It might have had something to do with it. Exactly the same day, just a few decades apart.
Margaret.
Oh, there you go.
Hello there.
I was an only child, so friendship has been very important to me all my life.
My name's Tom, one of the doctors here. Come on through.
Right, thank you.
I'll just go around here.
And it's lovely having somebody younger, too. It's what I need.
Can we pop you on that bed? Is that OK?
You're right. Can you get up?
What's the advantages of having a younger friend?
Well, she's not going to die before me.
So, walk me through what happened last night.
Well, I went to put the thing for the milk out on the step.
Yep.
And I must have turned and either the mat tripped me or my shoe stuck on the tiles.
OK.
And I went flat on my back.
OK. And how often do you fall?
Never.
You never fall?
No.
OK. Well, don't take it then.
She doesn't make a habit of it.
Margaret is hugely independent. She lives alone. She goes out. She does all her own shopping. Oh, she's hugely independent.
And how much alcohol do you drink?
1 a day,
one of a bottle or a glass?
Oh, a drink. A gin and tonic or a glass of wine. Occasionally, sometimes two.
If you act old, oh, I can't do that, dear, you know, my knee won't let me, then of course people are going to react to you differently. But if you're just you, then people take you as you present yourself.
Can you put your arms in the air like that for me? Super. Keep them there and close your eyes.
What am I supposed to be doing?
You keep them there. That's all. Can you just stand up for me?
You haven't even looked at my head yet.
No, no, no. Well, we'll do a full MOT for you.
He knows what he's doing.
Well, you'd hope so, wouldn't you? I can see where you've done it.
You can, yes. I can't, you see.
You got a very tiny cut. It's probably only 2 or 3 millimetres.
Really?
Let me just throw this away. We may need to scan your head.
Oh, really? Why is that?
Well, the examination is completely normal, which is really good. And it's just, as you get older, we worry about things. So we worry about things like bleeding in the brain. I don't think it is anything.
Can we get a sandwich or something here?
Yeah, I can ask one of the nurses to get you a sandwich.
Really? Don't you think, will you...
What a cheek. This is the NHS.
Well...
I'd like a sandwich, please, and a G&T. If you don't ask, you don't get.
No, you don't.
Who wants sweets? Jaluka, do you want sweeties? Daniel, do you want sweets? Daniel.
6-year-old Daniel has come to A&E with a blister on his foot. He's here with his mum and 3 siblings.
Daniel. Hi.
Thank
Hi,
you.
come through. You got all your bits.
Sorry, yeah.
Right, it's fine. Come in, have a seat. So you must be Daniel. So my name's Shalini, I'm one of the A&E consultants. Your mum?
Yeah.
And who else have you brought with you, Daniel?
My sister, my little brother and my big brother.
Wow. So you brought everybody?
Except my dad.
Except your dad. Well, it'd be quite full if he was here as well, wouldn't it? So what's been...
So he got a splinter last weekend from the decking, and we got it out.
Yeah.
But it started to get very swollen. It's just got bigger. He's not walking on it properly. He won't let you touch it.
Can I have a look at your foot? Yeah? Right, then. Do you want to lie down?
Yeah, lie down. It might be easier.
Do you want to put your other leg up as well? I'm just going to take the sticky off, OK?
Do you want to hold my hand?
Good. This yellow bit, I think, is a blister with pus in it, and it just needs to come out. So I make a little hole here, and we get rid of all the nasty stuff.
Is that OK? So it's not as bad as we thought.
You're going to go home with your foot, definitely. Yeah? So I'm going to go and get a few more bits, and then we'll come back.
It's been 40 minutes since 75-year-old Jerry was admitted to A&E with a dangerously high heart rate. An electric shock delivered directly to his heart has successfully slowed it down. Doctors now need to investigate the underlying causes of his racing heart, so are continuing to do tests.
Is it possible to see my wife in a minute?
Yep, I'll just get you settled and then we can bring her in, all right?
Right, okay, love.
We fixed the problem with his heart at the moment,
Yes.
so we've put that back into a rhythm that we're happy with.
I can't believe that you've done that so quickly.
We needed to, because it wasn't really well enough for us to wait today, so we just got on with it.
I see.
Because doing it in A&E is it's obviously a bit more risky than doing it in a nice, controlled way, but it's worked.
Thank God I called the ambulance. He was saying he didn't want me to, you know.
Well, you did the right thing, so it's a good job you did. So we'll
thank you.
You're very welcome. We'll get you in to see him in a wee bit, OK?
Do you want a cup of tea or anything?
No, all right.
OK,
All right, thank you.
We'll come and get you
You're very
shortly.
welcome.
All right, no problem.
Thank you.
husband had cancer. Initially, it wasn't too bad, you know, and he could get up, but as it got steadily worse, he was bedridden. It just went beyond control. They were giving him blood transfusions. On this particular day, they said, he can't have any more blood transfusions, it's impossible. He said, I'm afraid that is it. So I said, well, what do you mean? They said, well, about a week. And that will be it. The horror of John's death took me a long while to get over. It was so horrendous. I did write a poem. Just one more day. Let us have just one more day to talk. One more day to say that we love each other. But he can't. I was 49 when John died. People used to say to me, you're relatively young, you'll meet somebody else. But you think, I don't know whether I will.
Come on in. Yes, please do, yeah.
It does make you treasure things. Very much so.
Pop yourself over there.
I was really worried about you.
Sorry.
Oh, it's all right. I'm so pleased that I brought you God in heaven. If I hadn't have got you here tonight. I feel dreadful, really. I think we should have done something about this last weekend when you started feeling ill last Saturday. Left it.
A&E won't kiss it better. Well, they should.
Love you.
Love you too.
2 hours ago, 92-year-old Margaret came into A&E after falling over and hitting her head.
Hello, my name is David.
Yes, what are you going to do to me now?
A lot of things, plenty of things for you. Now, if you don't mind to lie down for me, let's do that ECG.
Doctors need to carry out a series of tests to check there is no underlying issue which caused her to fall.
Actually, it looks a bit like Dr. Frankenstein's experiments. All you need now is the lightning, and everything goes up in flames, and you rise from the dead, except you're not dead yet.
Not quite.
The years have gone by very quickly.
I think you'll live forever.
I was born in 1922. I feel now that I'm out of this world. It isn't as I knew it.
Okay, now we need to be still and quiet. Well, no, wait. Shh.
It isn't the same, and people go around the street buried in their heads in mobile or whatever it is and talking. I often think they're talking to me, but they're not at all. It's changed entirely. Electronics has taken over.
So you're not on Facebook?
No, no, I'm not.
Margaret's ECG results will be reviewed by doctors to check her heart is beating in the correct rhythm. She will now have a CT scan to rule out any injury or abnormalities in her brain.
I had a very happy childhood.
We just go for a CT scan.
Then I'll hover around outside.
Yes.
I was closer to my mother than my father. My father had been badly wounded during the First World War. He had shrapnel and his hand didn't work properly. He couldn't hold a pen.
Oh, look at this. Looks very lethal.
My mother had to put his boot on every morning and take it off at night.
Right, have a lie down there. Great, that's perfect. Good.
Looking back, she must have had a difficult life.
Sounds a bit like a washing machine in there, okay?
Breathe in and hold your breath. Breathe normally.
I hope that I won't need somebody to look after me. I can't do certain things now that I could do. I don't run for buses. My great-granddaughter, whom I adore, I find difficult to lift onto my lap even. I do it, but it's with difficulty.
Thank you. Thank you very much.
I am scared of losing my independence, very much so.
I could have walked this.
"75-year-old Jerry came into resus just over 2 hours ago with a dangerously high heart rate.
How do you feel?
Doctors suspect it was triggered by a severe infection, which is causing his organs not to function properly.
How are you doing, Jerry?
It's really hot.
Really?
Really uncomfortably hot, yeah. I don't know what we can do about it, really.
A specialist cardiology doctor has been called down to investigate.
The patient in there is quite unwell. He came in with a pulse of 240, 250. 250? Yeah.
Was it real?
Yes. So we fixed that with some electricity. Got cardiology to come and have a look at him because he may have been in and out of this dysrhythmia for a week. I'm worried. He feels clammy. He feels like...
This sounds like septic shock.
I wonder if it is. At one end of the spectrum, you might have a bit of a urine infection. It burns a little bit when you have a wee. And at the other end of the spectrum, you'll have that infection, but you'll also have low blood pressures that we can't put right with fluids and high temperatures. And at that extreme end of the spectrum, that's what we would term septic shock. And if that's not treated aggressively and quickly, then that can become life-threatening.
You're more breathless.
Is he?
Yeah. Then you have a little bit of fluid on your lungs. I think we need to weigh up giving you medicine to clear the fluid off the lungs. Maybe even a mask to help with that. Okay.
Dad, do you feel...
6-year-old Daniel came to St George's with a blister on his foot. His mum, brothers and sisters are with him. Doctors have given him gas and air to help with the pain, so they can cut out the infected area.
OK, are we ready? Shall I clean your foot? Not yet.
On your lip.
No? Should we get you a book to look at as well?
Oh, there's some on that trolley, actually, just over there. I bought them.
Why don't you have a read of a book with Amy? Am I tickling your foot? Is that what it is? There we go. Right then.
And all the creatures shiver and shake and crouch in their hollows, wide awake. And
Keep breathing, Dan. Keep doing it.
Deep breath in.
That noise.
Try and stay still for me, sweetie.
There comes a dream of warmth and food and a place
Good boy,
to
keep
sleep.
breathing.
6 more steps. Good boy. I think the doctor's all done, isn't she?
All the burnt stuff's out. There's a big hole. No, it's all right. That's just the top layer of your skin that's come off.
Should we put a bandage on it as well? Should we make it look really dramatic?
Yeah.
Let's have a look. Turn your foot round.
Thank you.
Right?
Yeah, that's great. We got everything.
She's lucky. They didn't have to cut my down.
Really lucky.
Lovely. Now, what do I owe you?
Make it 5 stars. You owe me a hug.
How much?
Nothing. You owe me nothing.
Really? We
Of
get
course
these for
not.
nothing?
Oh, thank you.
One for you on the way.
Hug.
That's very kind.
You're
Thank
welcome.
you.
No problem.
Oh, thank you.
Doctors are waiting for test results to establish whether 92-year-old Margaret has an underlying problem which caused her to fall.
What stage in your life have you been the most happy?
My marriage was very happy. Birth of my daughter was very happy.
All of a sudden, life has become rosier.
I met my husband at the age of 14. I went to school with his sister, and I met my husband through her. I used to go to parties, and he sometimes used to pop his head round, and I thought he was gorgeous then.
Hello there.
Hello. Back again?
Back again, I'm afraid. So everything's come back normal so far, which is really good. I've asked this...
What am I here for, do you wonder?
Because we're waiting for the scan to be reported by the experts, we might take you around to the ward, which is called CDU. Is that OK?
Margaret is being taken to the clinical decisions unit, whilst doctors wait for the results of her heart examination.
Shall I take him? Is this the last?
Yes.
I was 22 when I got married, and he was 29. I had a white wedding, borrowed the dress, because we were on coupons, and tottered down the aisle.
Can I have the feet thing, the foot?
Which one?
The foot thing.
Oh, yes.
Please.
Did you have a happy marriage?
Yes, I did. I did, very happy, until my husband got Alzheimer's, and that was very difficult. In the end, he got aggressive and didn't know me, put his pants on his head to dress himself. Oh, it was terrible, terrible. I wouldn't wish it on my worst enemy. You don't have anybody to talk to, and you don't have anybody to tell where you've been or to share experiences or to go on holiday with. It changes vastly. But you've got to accept this. In the end, I had to put him in a home, which I didn't like doing, but I had to because I was losing sleep, and I thought if I'm ill, who's going to look after him? He was in the home for about a year, and I got there just in time before he died, which I was very, very glad about. I just kissed him. He couldn't speak. I just kissed him and called the nurses.
Bye-bye, and I hope you enjoy your evening, and I hope you don't miss him. Thank you.
Because her life has been long and not particularly easy, she inspires me.
Many, many thanks. You really are a darling.
She never ever says anything like, why me, why did this have to happen to me? She just does what she has to do and carries on with her own life.
Dr. Tom now has the results of Margaret's ECG test.
With the lady that's going to the CDU with the CT head.
Yeah.
So she's known to have AF, but it's a bit fast. It's 127.
Oh, that's pretty fast.
Yeah.
It's too fast.
Yeah.
Doctors are concerned her heart rate is too fast and irregular, and she needs emergency treatment.
Has she got any infection anywhere?
No.
Nothing at all?
No.
Am I going to be able to go home? No.
Sorry.
Right.
Recess. Recess 4. Yeah, sorted.
You just have to get this heart rate under control.
We are going to give you something that's going to slow your heart rate down. But we need to do that while you're being monitored so that we can watch what it does to your heart rate and keep a close eye on you. Right, so unfortunately, you're not escaping.
What's back there? 152. 152. Okay, sweetheart, let's pop up the legs. There we go.
Thank you.
Okay.
Wonderful.
Because he can't really see very well.
Jerry's abnormally high heart rate is now under control, but doctors have discovered other complications. He has a severe chest infection and fluid on his lungs, putting further strain on his heart.
So I think we should try this mask treatment.
What is the mask?
It's just a mask that forces air down into the lungs.
Yeah.
And tries to force the fluid in the lungs out. Because if we don't do that, then you could run into some bother.
It's not going to be very comfortable, this.
No.
Unfortunately. Do you want to hold on?
Okay. Things go by so quickly and life passes you by so quickly, and you should make the most of everything that you can have. And Jerry and I have both been quite aware of that.
There we go. So if you lift your head forward for me, that's perfect, and rest back. So there we go, bridge of the nose.
We would always go away on holiday. Sometimes we'd have 2 holidays in a year. Well, we did. Sometimes we had 3, I think.
Clip it in. And then we'll do the bottom ones up at the same time.
We said all the time that we're well enough, we're going to do it, because you don't know when you won't be able to do it anymore. And this year was the first year that we couldn't go.
So here we go.
Try and close your eyes and relax, and then let the mask do its work.
Yeah.
Right.
Jerry will be taken to a specialist ward for further tests and treatment, so doctors can try to bring his infection under control.
Bye-bye. Bye. And to you. Bye.
Seven hours after arriving in urgent care, 92-year-old Margaret has been moved to Resus for emergency treatment. Doctors are now concerned about her dangerously high heart rate.
This is monitoring me, is it?
It is, yeah, it's right, it keeps beating.
Yes.
Your heart's going like the clappers.
Is it? Can't think why.
I've got some good role models in my family. They've grown old, you know, relatively gracefully. My grandmother on my mother's side lived with us and actually, you know, sort of looked after us when my parents were out at work. So yeah, she was a big influence on my life. There is a point, certainly, when you see those people you're related to suddenly seem a bit older. And it is a little bit of a realisation that you know, that happens to everybody. No one's around forever.
Is there anybody you want us to tell that you're here?
Well, yes. My ex-son-in-law, my daughter, very unfortunately, died. I had one child, and I'd have liked two. But unfortunately, I didn't have any more. She was very pretty, with curly hair. She was absolutely fine. I mean, naughty, of course, sometimes. Which child isn't?
Hello, Maggie. I'm Will, one of the A&E consultants. Has this happened to you before, where it's gone far too fast?
I really don't know. That's my clothes.
I won't get rid of them. Can I sit you forward a little bit? We'll just have a listen to your breathing.
When her father was ill, she used to come and see him and take us out. Oh, she was very good, very good.
You got a cut on the back.
Yes, well, that's why I came in.
Because you fell over.
Yes.
Nice big breaths. Perfect.
She died of cancer, of the breast, which spread all over her. At the time, I thought it should have been me. But it wasn't, unfortunately.
What's it for, heart?
To slow your heart rate down a little bit, I'm only going to give you a small amount.
Right.
And then we'll see how that works. OK, I'll see you in 15 minutes.
Right. Thank you.
It was a great upset. I miss her terribly.
Hello, good evening.
Hello.
My name's Simon.
Oh.
I'm one of the other nurses.
I've had a selection of them today.
You have. Yeah. They saved the best till last. Your heart rate's come down quite nicely, yeah.
Oh, good.
Still a little bit naughty, but we'll keep an eye on it.
Good, good. I'm very pleased to hear that.
So what we'll do, we'll wait for another 15 minutes or so, and then we will be able to take you to the ward.
I don't feel lonely. I have a granddaughter, a grandson, a great-granddaughter.
Do you think anybody could get me a sandwich? I haven't had anything to eat. If you could.
They come and see me, or I go there, mostly once a week. They laugh at my funny ways. So I'm very lucky, very lucky.
You know where we're going?
Yeah. I've been there like a million times.
I'm sure you have.
Margaret will be admitted to a cardiac ward for constant observation and to ensure her heart rate returns to normal.
Rock the road, the clock tonight.
Nice to hear somebody enjoys their job.
Check, everybody. Roll, everybody. You're safe now, you're safe.
Thank you.
How do you define something as abstract as friendship? It's sharing. Sharing, I think, is my definition of friendship.
It really did frighten me. I was just so worried about him.
The very fact that you've got someone who loves you and cares for you, it's like a big comfy blanket round you. And as you get older, you understand that more. This last 12 months or so, I've realised what a comfort that is.
So you're not playing Candy Crush, then?
Good God.
I'm on level 438.
Vertical, 5 minutes.
If a child comes in with a significant head injury, what I'm worried about is internal bleeding.
Cannot remember anything.
I could hear him in the background and he was clearly distressed.
His facial bones need CTing.
His whole side of his face was completely distorted and he had blood coming out of his nose and his mouth.
Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week.
I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before. We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked like a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie! Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
Hello, Resus, Simon speaking. What is it you know so far?
Nurse Simon is just starting a night shift in Resus.
Yeah.
You're walking into the busiest time that the department experiences. It tends to be when you've got the most patients.
Fitzy, do you want to do 5 and 6?
You literally coming running.
Could David come to Resus, please? Ask David to Resus.
And then you eventually slow down as the night goes on. Although I do enjoy working in the night shifts, they definitely have their drawbacks. You don't get to see your friends and family so much. They've gone to work before you come home in the morning, and by the time they come home from work, you're getting up and going to work.
I woke up at 2, I couldn't sleep. So then I watched like 6 episodes of Orange is the New Black, and then got the chicken shop chicken they got it delivered to me at about 4.
When it's quiet and patient care is all done and you've got those downtime moments, you do find yourself getting into a little bit of mischief with your colleagues and finding ways to entertain yourself.
I did used to be a hairdresser, not just randomly.
Oh, gorgeous. Yeah.
Yeah? Yeah, I feel hairy, though. I know. Sorry, I can't do anything about that.
It may look like we let our guard down and relax on the night shift, but you never do. You're always prepared and always anticipating something happening.
St George's Resus. Priority, adult or paediatric? Okie doke.
A 31-year-old male is being rushed to St George's after collapsing at home during an epileptic seizure.
Charlie Foxtrot. Thank you very much. Bye-bye. Adult male priority call, ETA 7 minutes.
It was his 4th seizure of the day, and he is yet to regain consciousness.
When you get that phone call that tells you someone's been having seizures, you need to make sure that you protect their airway, and you want to figure out how to stop the seizure.
Hi, can I have an adult trauma call to A&E Resus? Thank you.
You always need to be prepared for the next seizure that may happen with you.
The man's wife and mother have come with him in the ambulance.
We'd had a nice day, had a fun evening. We'd come back home quite late at night. We were just going to sit down and have some food.
We were watching TV, sitting on the sofa, and he just sort of went. Started to shake, then he like flew back and he stopped breathing.
Hello.
This is Liam, 31-year-old man.
Yep.
Since about 1:30, had 4 tonic-clonic seizures.
Seizures can be described in many ways, but the tonic-clonic are definitely the ones that put the patient at the most risk.
He is non-epileptic, but he wasn't really coming out of it.
Any family?
Yeah, a wife and his mum's here, yeah.
Perfect. Thank you very much.
He's had 4 fits, really bad ones. He can't take another one.
Epilepsy is an illness which is unpredictable. It just turns up when it wants to turn up.
They've told me today. They've said his head can't take it anymore, and his heart can't. His body could not take it anymore.
It's always in the back of your head. I could lose Liam through epilepsy.
So, Liam? Liam? Can I have some help, please? Oh, he's having another seizure. Can you get me on this?
Is he known epileptic?
Yeah, he's had 4 seizures today. He's had 15 milligrams of IV diazepam with LAS. He had a post-ictal phase. GCS came up to 15 with me. Literally just stopped. Here you go, Liam. I'm just going to pop this back down. Yes, please.
A seizure, when you experience it, is very, very scary.
1, 2, 3.
Liam. Pupils all over the shop.
It can be life-threatening in a very real way.
Liam, can you open your eyes?
Is he still fitting?
Open your eyes, Liam. Yeah, he's rigid.
Yeah, you can get wet. I'm getting wet.
31-year-old Liam came into Resus 10 minutes ago after having 4 epileptic seizures at home. He has since had another. Nurse Simon is giving him an anti-seizure drug to stabilise his condition.
To have a seizure when you're up and about talking and, feeling good, to then having one when you're already feeling unwell and you're already knocked off from a previous seizure, that's when things can become very dangerous for a patient. You can't communicate with that person. You can't understand what's going on because they simply can't tell you. So it's the unknown entity of seizures that is the scary aspect.
Hello. Are you with Liam?
Yes.
Yes, hiya. My name's Dr. Krish. I'm one of the A&E consultants here.
Hi.
Are you his...
I'm his wife, and that's his mum.
Oh, hi. Nice to meet you. He's had another seizure with us here. We've started a medication called phenytoin that will hopefully prevent him from having another seizure. He'll need to come into intensive care because they need to keep an eye on his airway and everything. OK.
Sure, thank you.
What have I let myself in for coming round here? I do not know.
But you needed to get your foot sorted. If it's fractured, I think it's worse than a break, isn't it?
It's quite handy having you mirrored sunglasses because then I can use it to fix my French.
No mirrored sunglasses is going to be able to fix your French.
Nurse Sophie has been working shifts at St George's for 15 years.
The hardest bit is changing from night shifts to day shifts, and a lot of people find that it's very, very difficult to swap back to do day shifts. Somewhere along the line, you've lost a night's sleep. I do like 12-hour shifts. I do like having days off in the week. I don't understand why everyone has the weekend off and go shopping. I find it amazing when I go off and it's all crowded. I love going when there's nobody there. Any reasons, how can I help you?
How does it affect your social life and your personal life?
I don't have a social life. And I have no personality, so that's fine. What do you want? That was my posh voice, but now, yeah, what do you want? George's medical trauma.
An 89-year-old woman is being rushed to St George's, suffering from severe chest pain and difficulty in breathing.
Thank you. Hello. Let me grab my bits.
Right, my love.
1, 2, 3. Did you enjoy the ride?
The woman's daughter has come to St George's with her.
She was staying here and we left her a little bell to ring if she wanted to go to the loo in the night. Her chest was completely rattling and I really was very worried about her.
8, 9, French was breast at 9 o'clock last night. Learned to have heart failure. I was here about 2 months ago. Was admitted. I was here for about 6 weeks.
Hello there. I'm Anna. I'm one of the other nurses. Yeah. Do you mind if I take a blood test from you?
Is my daughter there?
I think she's in the relatives room, so we'll get her through in just a moment.
She was the oldest of 6. They were all born in the same house in Wales, which my uncle still owns. It was quite a theatrical sort of childhood. From 3 years old, she said we were encouraged to sing, dance. I know that everybody gets super dressed up and ends up on the stage. And I think that's why my mum's so confident.
Can you straighten your arm? That's it, lovely.
She would have probably fared well as an actress, actually, I think, my mum.
Right, then, if you stay nice and still, sharp scratch coming up, all right?
When she was 21, she moved to London. She wanted the bright lights, basically, but she did get terribly, terribly homesick when she was in London, and she wanted to go back to Wales. And she said, I was determined to stick it out because everybody told me I would hate it.
I've done one blood test, but I need a bit more.
She was working for the telephone exchange. You couldn't make an international phone call without going through the telephone exchange those days. And she was chosen to open the lines after the war, which she found very exciting.
OK, stay nice and still, sharp scratch.
It was France, actually, that she spoke to first. This is France here speaking, and she said it was lovely, an amazing moment.
Right. Are you with my lovely... Yeah, we just get some bloods. She's doing great, it's lovely.
My grandfather's sister, she had a hotel in Hastings, and she met my father in the hotel. My father said the minute he saw her, he fell in love with her. She's...
Right. I'm going to put you back a bit. Right, lean back. How's that? More or less?
That's lovely.
Yep.
Lovely, thank you.
Keep you decent.
I think they married after about 3 or 4 months of knowing each other, registry office wedding. So he must have been pretty bowled over with her, I think.
Here you go.
Feeling a bit better. I know, more blood tests now, yeah. They work well together. Well, they were married for 60 years, so they must have worked well together. You know, they, thick or thin, they got through it.
They've taken me off the oxygen now.
Yeah, but you're so much better now for breathing. You had to have that because you were feeling so terrible, weren't you?
Doctors will carry out further tests to find the cause of Maya's chest pain and breathing difficulties.
Would you like to open your mouth, love? Let's have a look. Let's have a look and see if I can see your brain.
You've got what's known as it's called a stress fracture or a march fracture. But it's due to the fact of walking. So it's more common in people like police officers, army, who are marching. And you need to give it the best possible opportunity to heal, and that is putting it into a plaster.
"31-year-old Liam was brought into Resus just over an hour ago after having multiple epileptic seizures. Doctors have given him medication to try and prevent further episodes.
Liam. How are you feeling? You had another seizure. You told me you weren't going to do that. What's your wife's name? Alice. Good stuff.
Liam and I first met in a nightclub in Ipswich. He had a sheepskin coat on and some really not good shoes, which I thought, might have to change that possibly. But I remember my sister and I saying to each other, oh God, he's so good looking. And I remember Laura saying, Alice, if you don't go over there, I am. And I was like, no, you're not going over there, Laura, I'm going.
Just you and Alice at home, is it?
Yeah.
Good.
There was a moment, I think, for both of us where we felt like this bubble around us. I don't know what it was. There was something really special there. We both remember that really clearly. He proposed on a beach in Cornwall. We were going on our little caravan holiday. He knows that I don't like public, emotion very much. But I don't think Liam could really guess that I was going to react the way I did. You expect someone to cry or someone to, I just didn't react like that. I just reacted like, oh, yes, Liam, get up, get up. Yes, of course I will, for God's sake.
Have you ever been admitted here to St George's?
Numerous times.
Numerous times, OK.
When I first met Liam, he'd already been having seizures. His life is on tenterhooks with his epilepsy. When he has a bath, I have to make sure that I'm checking on him every few minutes, every 5 minutes, or at least calling out to him, just so I know he's not had a seizure in the bath and is drowning. He's hit his head on sinks. He's had a knife near his face when he's fallen.
When he was at uni, he was at the top of those stairs, and he was lucky that he didn't break his neck. Oh, I dread that phone call one day where I might get a phone call from Alison. Maybe he's not going to pull through. Don't worry, every day. Every day.
I was at my friend's 40th birthday party on a boat, and my other friend turned into an animal, and I was asked to restrain her, and she bit me.
You need to come down the bed a bit. Keep going. That's it. This is driving me mad, this is. Shove it in the trolley. Oh, don't do that. Bad foot. Dearie me, I've come off and hit the other foot.
I'm afraid we need to keep you in the hospital.
Oh, no.
You can go out for fresh air if you want now and come back.
Can I go for a cigarette and a glass of wine and come back?
Wine? No.
A Guinness?
No. No, just you can have fresh air and come back here, please.
Thank you.
All right.
Thank you very much. Thank you.
You're welcome. See you in a minute.
George's medical trauma. One small second.
A 12-year-old girl is being rushed to St George's after collapsing whilst playing rugby.
Thank you. SP. Bye.
The girl's mother and stepdad are on their way to A&E from West London.
John and I had been in London the night before, and we were just taking a very leisurely stroll back through Hyde Park when my mobile phone went.
It was a shocking moment. She just screamed.
I just had to calm down a little bit, and then my first thought was, I need to be with my baby. She needs me, and I know she's going to want me. cuddle, and so she knew her mum was there.
Paramedics have given Lauren gas and air to ease her pain.
Deep breaths, because when you blow it out, it stops working. That's it. Keep going. Make it whistle. It's okay. Perfect. Keep doing that. Keep doing it. Keep doing it. Deep breath. Deep breath. Good job.
Okay. Can I have a handover, please?
Yeah.
12-year-old Lauren, normally fitting well, is playing rugby today. Make a try, whispers for a left leg to somehow give way and go backwards. The crackling sound like a gunshot sound was heard, immediate pain and deformity to the left femur. Pain score initially is 10 down to 5 or so with the traction.
We need chest, pelvis, and each of you as well.
Is there any pain on your chest when I'm touching you?
It's all on this side of it.
There were a lot of doctors and nurses around her bed. I think actually that's the point that freaked me out the most, because I then realised that actually it was a real trauma call.
Right. X-ray ready.
Lauren will now be taken for an emergency X-ray to assess the severity of her injuries. 89-year-old Maya was brought into Resus 20 minutes ago, suffering from breathing problems and severe chest pains. Her daughter Janet has come to A&E with her.
Janet, you must be tired. I'm all right, Mum. Don't worry, I'm fine.
Doctors are waiting for the results of blood tests to see if she's suffering from pneumonia.
I'm going to come back in again, see how you're getting on.
Well, we were brought up in Clapham. That's where, when my parents first bought a house, I was 3, and we lived just off Aberville Road. And my 2 younger siblings were born in that house. I have an older brother as well.
You didn't sleep good last night. Did you go and have a little kip this afternoon?
Only for an hour. My father bought a shop in Broomwood Road. We were the corner shop that everybody knew. They had an off licence as well, so they had many, many parties. And Mum especially was a very, very hospitable person. When it was party time, it was party time.
Dr. Tom has the initial results of Maya's tests and is concerned she has fluid on her lungs.
Hello. Hello.
It's Tom, one of the doctors. Hi, how are you?
Hi, Doctor.
Hi, how are you feeling?
Much better than I did a couple of hours ago.
Okay.
My body's failing, Doctor, but thank God this still works.
Mum and Dad were very good providers, always had a lovely home. First kids in the road to have a television, first kids in the road to have a car. I can remember all those things. I mean, this is in the 50s, so not many people had televisions and cars those days. It was a nice childhood, a loving childhood. She always knew straight away if there was something wrong by my voice. I just felt she was always there for me. Proper mum, you know.
What are you able to do then at the moment? Are you able to wash and dress, or do you need help with things?
A bit of both, really. She likes to do as much as she can, but this morning she just really couldn't do it.
It doesn't have carers, it's just...
No, she has district nurses in, but no, my sister's been doing it.
Yeah. And obviously, with the heart problems, have they talked about options? Are they? I'm guessing they're not going to do another operation.
They said they can't do. They don't want her to do anything intrusive. They said because she won't be able to handle it basically.
Sure. With your heart problems and things, God forbid it's not going to happen now. But if you were to get worse and your heart was to stop, do you feel that you would want a resuscitation, or would you feel that you would want nature to take it?
No, let me go, baby. Let me go.
I don't think that's going to happen, but it's good to know what your thoughts are.
The do not attempt resuscitation order is there to say, if you stop breathing, if your heart stops, our focus is going to be on comfort and dignity, not on resuscitation.
Oh, let me go.
'Cause I don't-
If I make July the 6th, I shall be 90.
Wow, yeah, that's good.
Oh, I've had a good innings.
I don't think that's going to happen, but I just wanted to check what
That's
you were
right.
thinking.
Oh, no, let me go.
Okay.
I thought she'd say that.
Thank you, Doctor.
I think the first thing we'll do then is get an x-ray, and then I think it's going to be best for you to come into hospital for a day or two to try and get some of this fluid off.
I got to my gin and tonic, so I'm all right.
I'm going to go and grab your wife.
31-year-old Liam has been in resus just over an hour. Doctors are monitoring him very closely after having suffered 5 epileptic seizures.
Cool, just through here. So I've popped some chairs here for you. Liam? Liam?
Lovey. Darling. I'm here, sweetie. Are you okay?
When I met Liam's dad, I did want to get pregnant. Because I wanted something to love. My parents split when I was 13. My dad was the love of her life. And she just could not get over it. Because we did drift apart.
You've got one of our pillows from home underneath you.
I started to play up myself. And I was skipping school. I got caught shoplifting. Started fighting. One of the most difficult parts of my life.
He's just exhausted. Poor thing.
He was just like a godsend. He really was like a godsend. Once I had Liam, that's what really brought my mum to her senses. She totally changed once I had Liam. We got closer. We were just basically joined at the hip, which was brilliant. They sent me to a special school for pregnant schoolgirls, which I did. I learnt a lot there. I had to grow up very quickly. For somebody of that age to have something grow inside of you, you know, you get this natural instinct of, I've got to look after this. Your whole world is focused on this baby.
We're going to be taking Mr. Lewis around to Richmond ward very shortly.
If Liam wasn't born, I don't know where I would be.
It's just...
Probably could have ended up in jail, the way I was going.
Let's go.
I don't know what I'd do if anything happened to Liam. I don't.
Liam will now be taken to intensive care, where he'll be closely monitored in case he has further epileptic seizures. "12-year-old Lauren came to resus 30 minutes ago after collapsing while scoring a try in a rugby match.
Where's your ticket for the ride?
She's had x-rays of her chest pelvis and a suspected broken femur, so doctors can determine the extent of her injuries. Lauren's mum Rachel and stepdad John are in resus with her.
John's just come to sit for a while.
You all right?
Okay? All right? Lauren was my first, and I wanted to have a little girl. I wanted to have what I have with my mum, actually, and that was the mother-daughter bond.
Just got messages from the girls' rugby team to say they won.
Did she actually score the try then?
Surely they gave it to you.
Lauren is a tomboy. She would always be the one up a tree or climbing on something, always kicking a ball around with the boys. So at the moment, I don't have that kind of relationship where we can go out shopping and, you know, doing the girly things, because Lauren doesn't want to do girly things. She doesn't want her nails painted or me to plait her hair.
So you don't want to play rugby anymore?
No.
You will.
When she was probably about 4, she started playing football with her dad. She then started horse riding. She was picked for the athletics team and cross country and netball. She lives to play sport, really.
Where is Arden? All right, I'll tell the lady when she comes back and she might be able to... Is it worse since the X-ray?
Try and relax.
John's passion is rugby, and that kind of rubs off on Lauren. He's quite keen that Lauren does push herself as far as she can, really.
I just feel an overwhelming sense of pride when she does well, and when she's not doing well, I want to encourage her and want to continue to see her improve as a human being and going into adulthood.
Doctors are now examining Lauren's x-rays to see if she'll need an emergency operation to her leg to give her the best chance of walking normally again.
Because Lauren has played sport, you know, all of her life, I really did think that she was going to struggle terribly with it.
Just take your time.
You take your time, yes, yeah. Stop a bit, that's it.
No rush.
It's time for a rest, that's it. All right, goodbye.
We've got to do this and make it for you. You're going to have to. Just take it easy, all right? Take it easy, just take it. Don't rush, just take it easy.
"12-year-old Lauren came into resus just over an hour ago with her mum Rachel and stepdad John after collapsing whilst playing rugby. X-rays now confirm Lauren has a severe break to her femur.
It's stinging. Right, I'm going to tell the lady a minute. She's complaining that this is stinging, something's stinging on her feet.
It's not comfortable, but what it's doing is stopping that coming together. Where's it hurting? Bone pain, I think, is one of the worst pains ever. Bone pain is horrible. It's like toothache pain badly. You get horrible spasms. But let me see if we get you some more painkillers. Guess what? She can eat and drink.
She can eat and drink? Are they not operating today, then?
No. I've got sandwiches and stuff, but there's a Marks and Spencer's around the corner that's got better stuff.
A bottle of water, a packet of crisps, and just get me something like chocolate or something.
Do you want me to get you a little bell so you can
Yeah.
ring it and demand her attention?
So, I've just spoken to the boss. The operation that we want to do is basically putting a plate with some screws in there to hold the fracture in place. Risks with surgery, as with any surgery that you do, there's risk of bleeding, a risk of infection, damage to nerves or vessels in the area. No contact sport for at least 3 months, we say.
think it's your worst fear as a mother, is your children being injured.
Do you want some more painkillers now? We can give you a little bit more morphine if we need to.
She brings me happiness and love, and she's mine. I gave birth to her, and I carried her for 9 months, and I just want her to be happy and to just be true to herself.
Give it a minute or so, it should work quite quickly.
Can have a little sleep.
Hi, Lauren. It's been so long. I don't even want you to go, because I actually quite like looking after you.
Oh.
When I was about 25, I ruptured my meniscus in my knee and was told I have to have a partial knee replacement. They're not designed for 12-hour shifts. That's what scares me, is I know that will be what stops me having to work in the ED. You got brothers and sisters?
Yeah.
I know, what?
I've got 2 sisters.
Oof.
2 stepbrothers and 1 stepsister.
How do you feel about that?
Just that's what I do, just keep on going. Younger, older?
They're all younger.
Oh, you're the older. Get a bit of peace and quiet, aren't you? Tired.
Lauren will stay in a ward overnight ahead of extensive surgery in the morning.
OK, Miss, so can you sit forwards for me? That's lovely, and rest back.
Are you doing it here?
Yes, we're going to do the X-ray here.
89-year-old Maya was brought into resus just over an hour ago with breathing difficulties and severe chest pains.
Chest X-ray, base 7.
Doctors are taking chest X-rays to see the extent of the fluid on her lungs.
All done, OK.
It's all right?
Yes, all finished.
She's got very loud crackles all over her chest and swollen legs. So, I mean, she's quite comfortable. She's not needing oxygen or anything.
You were due to go to a nice restaurant in Knightsbridge tonight.
I'll go. I can go. What time you book?
It's 8 o'clock over here.
Oh, I finish at 8. That could work out nicely for me.
When my first grandson was born, my mum said, I want to be called Gigi for great-grandma.
Are you going to wear that nice dress tonight?
I'm not sure yet, I'll see.
Hope you have a nice meal now then.
My daughter's named after her, so she's Maya too. Really, really close. She actually said once that my daughter Maya has added years to her life. She just watched her play and really, really close bond. It's lovely.
I'll be up in the morning anyway, OK?
OK, love, enjoy your night.
Anywhere we went, she was always, we're 4 generations here. Always. Everyone had to know, because, I mean, obviously everyone was interested.
Hello.
Hello, my name's Sarah. I'm one of the nurses. I've just taken over, OK?
Have you got a cream cracker or something?
I can get you a cream cracker, yeah. Yeah? Do you want some cheese, butter, or just plain?
No, you can have a bit of butter.
Bit of butter, yeah. Give me 1 moment, I'll be back with that.
On my 60th birthday, I had my daughter, one of my granddaughters, and my mum in the same house. I mean, how lucky can you be?
So, Maya, they're going to take you to the ward now. Lovely to meet you. It's always good to meet a fellow Welsh man, well, lady.
I definitely enjoy meeting people and looking after people who are from Wales. It does make me miss home quite a lot. It was a real pleasure, actually, looking after Maya.
Maya will be admitted to hospital, where doctors will attempt to remove the fluid from her lungs and carefully monitor her condition.
The first afternoon I came in to see him, he looked a vulnerable little boy again, and I hate that. I really hate that.
Looking into the future definitely feels like it's going to be positive. I want to be able to drive. I'd love to be able to drive.
If he has a year without seizures, then he's allowed to then get provisional and start learning.
I'd love to be able to have a good career and can just live what people would consider to be a normal life.
I just really want it just Roger to be removed now, and just for me to be able to slowly work my way back into do sports and just be able to do normal things that I used to be able to do.
I think in many, many, many ways, I'm like my grandma. She was one of my best friends. I miss her.
She died 9 days before her 90th birthday, and we had the wake in a club that she wanted to have her birthday in. Apart from Mum, she was a friend, and I will miss her. But every time I do feel sad about it, I think how grateful I am to have had her for so many years.
The last thing she said to me, she held my hand and she said, "Kate, just have fun." And something switched in me, just clicked, and I was like, duh, of course, just have fun. That was the best advice.
Oh, ow, 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 it's coming in my wrist again. Since I'm really hungry, I think the sausage roll can sort that out.
Adult particle, 20 minutes.
The main problem with internal arterial bleeds is that you don't always know how much bleeding is occurring.
I remember just thinking, please, just let this be okay.
Worst case scenario, you can bleed out, lose your blood volume and die.
There's cardiology on the way.